59th Directing Council, 73rd session of the Regional Committee on the WHO for the Americas. Want to use the opportunity to thank those who participated yesterday. I think we had a very good day. We completed the session on time with very valuable inputs and decisions. We are going to begin with item 4.5, which is increasing production capacity for essential medicines and health technologies. But before we begin, I am going to ask Madam Secretary to make some announcements. Madam Secretary.
Mr. President, and good morning, everyone. We would like to remind the delegates that the proposed resolutions and the adopted resolutions may be found at the Resolution Tracking System, or known as RTS, of PAHO. For your information, the following adopted resolutions have been uploaded into the system. CD 59.R1, Roadmap for the Digital Transformation of the Health Sector in the Region of the Americas. And CD 59.R2, Policy on the Application of Data Science in Public Health using artificial intelligence and other emerging technologies. When connecting to these resolutions, please use the credentials that you received earlier via email by the Secretariat. Thank you very much. Thank you, Mr. President, and back to you.
Thank you very much. So we will begin item 4.5, increasing production capacity for essential medicines and health technologies. I would like to bring document CD 598 to the attention of the Council and invite the representative of the Executive Committee to report on the item.
Buenos días, señor presidente.
Good morning, Mr. President. The Executive Committee reviewed the policy at its June session. Delegates commended the policy's focus on promoting equal access to medicines, sharing good practices, and strengthening regional production and international cooperation. Promoting generic medicines, increasing transparency of production costs, and increasing local production through technology transfer were highlighted as ways of fostering more equal access to medicines and health technologies. It was suggested that high-income countries should support those with fewer resources, including through capacity building, technology transfer, and training. Delegates agreed that the COVID-19 pandemic has exposed the urgent need to strengthen and diversify global supply chains to facilitate equal access to health products, essential supplies, and raw materials in the region. The importance of sustainable financing mechanisms to support research and development was highlighted, as was the need for initiatives to strengthen national and regional production of affordable medicines. The critical work of industry in responding rapidly to the COVID-19 pandemic and developing vaccines was commended. Further engagement with patent holding companies was recommended in order to promote public-private partnerships, foster technology transfer, and facilitate the local production of medicines and health technologies. Strong support was expressed for greater technical, multi-sectoral, and multilateral cooperation in this area, including between PAHO, the WHO, the World Intellectual Property Organization, and the World Trade Organization. The Executive Committee adopted Resolution CE 168.R4, recommending that the Directing Council approve this policy. This is all we have, President. Thank you very much.
Thank you very much for that report. I will now therefore yield the floor to Dr. James Fitzgerald, Director of the Department of Health Services, Health System Services of the Pan American Sanitary Bureau, to present the item. Dr. Fitzgerald.
Thank you very much, Mr. President. Delegates to the 59th PAHO Directing Council, Director Dr. Etienne. The COVID-19 pandemic shed a spotlight on the critical importance of medicines and health technologies in the control and management of an international public health emergency. Stockouts and inequities in access to essential medicines, vaccines, and other health technologies affected the response capacity of health systems and impacted the delivery of essential health services. Export restrictions in the context of a prolonged health crisis highlighted the dependence of Latin America and the Caribbean on imports of medical products from outside the region, the vulnerability of global supply chains during emergencies, and the heterogeneity that characterizes the Americas in research, development, and production capacity. Historically, the region of Latin America and the Caribbean has been characterized by a heavy dependence on imported medical products from other regions. Based on 2018 data for Latin America and the Caribbean, ECLAC estimates that only 4% of imports of a basket of health technologies related to the COVID-19 response were sourced from the subregion itself. In addition, the level of public expenditure on research and development in health is just 1/6 of that reported by higher income countries. Ensuring access to essential medicines, vaccines, and other health technologies for health systems requires effective coordination and management of public policies so that actions across sectors are consistent, aligned, and sustained. And in times of a pandemic, regional coordination, collaboration, and solidarity is of the utmost importance. The policy document presented today outlines a vision to increase regional collaboration and capacity in the development and production of essential medicines and technologies, improving access and health outcomes, contributing to national and regional security and the economic and social development of countries. 3 strategic lines are proposed. Firstly, strengthening intersectoral coordination and governance in health, science and technology and industry, setting explicit priorities across these sectors. Secondly, strengthening capacities in engineering and biomedical, pharmaceutical and biological sciences, developing R&D infrastructure and in enabling support institutions, including universities and national regulatory authorities. And thirdly, strengthening regional collaboration and the development of strategic partnerships and networks in health, research, development, and innovation. Since the 168th session of the Executive Committee in June of this year, the Secretariat launched expressions of interest to support the development of mRNA vaccines and reagents in this region, convened meetings of countries and CTAP, the Technology Pool Initiative, and launched a regional platform for the advancement of the production of medicines and health technologies in the Americas. This platform responds to the request from member states to establish a regional forum and support collaboration and cooperation between sectors and countries to advance the development of specific and much needed critical health technologies for health, including all critical health technologies and not only vaccines. President, the Secretariat would like to express a sincere thanks to member states for the support and comments received during the country consultation process. Thank you.
Thank you very much, Dr. Fitzgerald, for that report. I now open the floor to the plenary for discussion and invite delegates to raise their hand on the electronic platform. And I ask our moderator to assist in managing speakers. Thank you.
Thank you very much, Mr. President. We will then proceed to record the request for the floor for this agenda item. We see Ecuador followed by the United States. Ecuador.
Muy buenos días. Muchas gracias, señor presidente.
Good morning, and thank you very much, Mr. President. The COVID-19 pandemic, as the document said, did highlight the weaknesses in our health systems, with the response capacity limited for essential services. These weaknesses mainly resulted in supply shortages and affected other essential health technologies in a context characterized by an increase in demand and major fluctuations in the prices of a lot of medical devices that could not have been avoided. This leads the region to take concerted action to address this challenge in a way to increase capacity and development for medicines and other health technologies for our healthcare systems, for better resilience, sustainability, and equity. In this context, Ecuador has undertaken a clear commitment through the implementation of the Health Transformation Program with clear objectives that are part of an innovative and renewed approach to make it easier to participate across sectors and to create better governance mechanisms. There have been efforts made to improve production capacity for medicines within the country, and Ecuador stands ready to start conversations and invest in these technologies. Ecuador supports this draft resolution and emphasizes the need to create inclusive mechanisms based on international policies that can build on national regulations to ensure that there is quality, safety, and efficiency of production in the region, to improve the health of our people in an equal way. Thank you, Chair.
Agradecemos a la delegación del Ecuador por esa
We
intervención.
thank Ecuador for those remarks. We offer the floor to the United States, followed by Canada.
Thank you, Mr. President. The COVID-19 pandemic has demonstrated the importance of resilient, diverse global and regional supply chains for critical medicines and other health products. The PAHO report and resolution on increasing production capacity for essential medicines and health technologies highlight several key factors that contribute to that goal, such as the need to promote sustainable and strategic regional and domestic production, to strengthen regulatory systems, and to facilitate trade in key health products. We particularly appreciate that the report and the resolution contain a nuanced and balanced discussion of the complex issues that must be considered to facilitate effective and sustainable local production. As the report notes, to be sustainable, local and regional efforts must take into account a variety of public health, economic, environmental, and social factors. As stated at the PAHO Executive Committee, the United States supports the proposed resolution on increasing production capacity for essential medicines and health technologies. We were also pleased to attend the first meeting of the PAHO Regional Platform for the advancement of COVID-19 vaccines and health technologies manufacturing in the Americas. And we look forward to further discussions with PAHO and member states as PAHO begins to implement the action items discussed in the resolution. As part of that implementation process, it will be critical for PAHO to coordinate its work with the ongoing global discussions on local production, regulatory system strengthening, and access to medicines and other health products at the WHO and in other multilateral organizations. It is important to harness the political will of this moment to make the changes necessary to facilitate the global and regional response to the COVID-19 pandemic, and to ensure that we are better prepared for the next one. This report and resolution make a thoughtful, considered contribution to that larger effort, and we look forward to future regional collaboration on these and other related issues. Thank you, Mr. President.
Agradecemos a los Estados Unidos por su intervención.
We thank the United States for that statement and now offer the floor to Canada, followed by Mexico.
Thank you, Mr. President. Canada considers this policy on increasing production capacity for essential medicines, vaccines, and health technologies, and the strategic direction it provides for the region to be a welcome step by PAHO. While this pandemic has underscored the urgent need to scale up global efforts to strengthen supply chains and to boost and diversify COVID-19 vaccine manufacturing capacity, it has also shed light on our region's vulnerabilities in this regard. There is no question that current efforts to scale up production capacity for essential medicines and health technologies are crucial to the regional and global response to this pandemic. But this is also a critical opportunity to establish a strong foundation to build off of post-COVID-19. Canada recognizes that long-term, building this expertise and developing local and regional manufacturing capacities for health products can contribute to better and more consistent access to safe, effective, quality, and affordable essential medicines, vaccines, and health technologies in the Americas. To this end, in July of this year, Canada announced a national biomanufacturing and life sciences strategy aimed at increasing production capacity through investments and partnerships to produce life-saving vaccines and therapeutics, measures that are expected to assist in domestic, regional, and global responses to future public health emergencies. Finally, as we continue to advance these efforts, we would like to stress the significance of multi-sectoral collaboration. At the global level, Canada has expressed its support for the continued focus on close collaboration between the WHO, WIPO, and the WTO to ensure that respective experience and expertise is harnessed in this work. As we progress regionally in this area, we also wish to underscore the importance of engaging across sectors in the Americas. Thank you.
Agradecemos a Canadá por su intervención. Cedemos
Thank
la
Canada for that statement, and now offer the floor to the delegation of Mexico, followed by Jamaica. Thank you very much, President. On behalf of Mexico and its regulatory authority, we support and recognize the importance of strategic guidance for the roadmap and setting cross-sector priorities in our national policies as member countries. Mexico is a country that focuses on transforming health, moving towards universal and free healthcare, and have taken steps towards regulatory convergence through our national regulators and authorities, like SECMED, where we have gotten full equivalence for recognizing medicine and drug national registries. We are also making progress with other regulators in the region in order to increase resources and build capacity for our agencies. Communication and cooperation are the foundation of the steps we're taking. The goal always being to ensure that there is equal access for health supplies and medical supplies that are of great quality, safe, and efficient, in order to reduce the vulnerability gaps through resilient, strong, and robust and universal healthcare systems. We have research clusters and development clusters for technology transfers that all support national strategies and regional strategies. Steps have been taken to strengthen a national industry in order to save lives, and we produce respirators for improved health of our population. And we're also proud of the production of the Patria vaccine, which seeks to provide an alternative that is more accessible for a region that is always safe and efficient. We recognize, of course, the work done by the PARF network as part of what is being done to increase uniformity in regulating the drug industry, to increase efficiency in our regulatory agencies, and also contributes to providing access to essential medicines and health technologies. We have taken a commitment with the region and with our people to ensure that everyone gets equal access to drugs and medical devices that they need, always in a timely way, where they need it, being certain that it's of the best quality, safety, and efficiency, which is what they deserve. I'd like to close by saying that in order to have health on the globe, we need global solidarity. Whatever racial background we're from, whatever health sector we work in, and beyond any differences or in our language or our cultures, we must continue moving forward based on solidarity for health and for regulations. Thank you.
Agradecemos a México por su
We
intervención.
thank Mexico for those remarks. We now offer the floor to Jamaica, followed by Argentina.
Mr. President, the last 18 months have been challenging for Jamaica in finding consistent and reliable supplies of vaccines and other health technologies in order to support our response to the pandemic. In the first few months of the pandemic, we had to face a crisis for supplies of personal protective equipment and laboratory supplies, as we were at the mercy of larger countries that held on to these resources. This threatened to derail our response and undermine the trust in our health infrastructure, as there were long turnaround times for laboratory tests, as well as dissatisfaction among healthcare workers about supplies of personal protective equipment. In the last few months, it has been the shortage of vaccines, as promises for supplies are delayed as larger countries continue to pull and engulf resources. Even more recently, the break in our supply chain for liquid oxygen created periods of uncertainty in our hospitals. Indeed, the vulnerability of the region, and in particular, the Caribbean sub-region, is very real to us. It is with these experiences fresh in our minds that we support multisectoral action and an increase in regional capacity for the development and production of medicines and other health technologies to improve access and enable consistent and reliable response to the region's health priorities. At the same time, Jamaica would ask that the WHO and PAHO intervene to ensure that essential medicines and health technologies that have gone through the rigors of approval are recognized and accepted globally. This we ask as vaccines approved by the WHO, taken by our citizens, are not being accepted in some countries. We are indeed grateful to PAHO for several intercessions on our behalf, and at this time recognize the work of countries like Argentina and Mexico in the production of vaccines that we have benefited from at a time of great need. We also recognize the work of Cuba in the development of vaccines that will no doubt benefit the entire region. And we would also like to recognize Trinidad and Tobago and Costa Rica that have supplied us with liquid oxygen. There is no doubt that regional production capacity increase access and also stimulate economic recovery in the region. We therefore support all the strategic lines of the resolution and urge the director to provide the technical cooperation and to support them the support to member states in this regard. I thank you.
Agradecemos a Jamaica por su
We
intervención.
thank Jamaica for that statement. And now offer the floor to Argentina, followed by Brazil. Thank you, President. We thank the Secretariat for the great documents they have provided as foundation to strengthen our work to improve global supply chains and medicine development and the development of other technical, or rather health technologies. We appreciate all of the content we have read as a delegation. Ensuring that there's access to vaccines and drugs should be a priority for all countries because it is necessary to ensure that we have access to health for everyone. Thanks to technology transfers from foreign labs, we have flu, pneumococcal vaccines, and also HPV vaccines produced for Argentina. We have also been able to join efforts with Mexico to produce the AstraZeneca vaccine and with Russia for Sputnik V vaccines. We need to address the bottlenecks in the global supply chain and ensure universal and equal access to raw materials, which is why we approve the COVAX and ACT initiative, among other instruments available. We welcome the inclusion of references to the Doha ministers meeting, and also welcome the fact that the temporary extension has been supported and discussed by a number of different countries in order to increase access. We would have liked to have seen the inclusion of the initiative in the different paragraphs in this proposal. We believe it's important to also promote generics as strategies for promoting access, and also ensure that there is price transparency and production cost transparency, as well as technology transfers as an instrument to promote more local production. Thank you very much. The interpreter highlights that with the sound of the original, the message is hard to fully hear. Thank you very much. Before we offer the floor to Brazil, let me please ask delegates to please speak at a slower pace, make it easier to capture the message by interpretation, and also to not go beyond 3 minutes of intervention. Thank you very much. We'll now hear from Brazil.
Muito obrigada, senhor moderador.
Thank you very much, a distinguished moderator. Brazil greets Barros rapporteur on the increase of production of essential technologies and capacity for essential medicines and health technologies. The pandemic showed the weakness of these global chains and the need for using epidemiological criteria in order to ensure equitable access to vaccines, as well as other supplies without leaving anyone behind. The Brazilian government is committed to the development and the strengthening of productive national capacities for the production of medicines and health technologies and vaccines, particularly for developing countries. Brazil supports the facilitation of agreements and transfers of technology through international cooperation and with the participation of the industry. We have adopted measures in order to increase the national productive capacity of medicines and health technologies. With the purpose of promoting development and manufacturing on national territory of supplies and strategic and essential medicines for our SUS, single medical system in Brazil. Brazil, since 2020, offered vaccines against COVID for its entire population. Today, we have over 20 million doses of vaccines insured, and until the end of October, we hope to vaccinate our entire adult population. The association of the Osvaldo Cruz, Fiocruz, with the AstraZeneca company, through contracts of technological exchanges and transfer of technology, already resulted in the delivery of millions of doses of vaccines against COVID-19. Last month, we established a partnership between Pfizer Biotech and the European company for the production of 100 million doses of vaccines in Brazil a year. This is the most important partnership to ensure equitable access of Brazilian people to vaccines against COVID-19. In future years, we will invest over $650 million in the development of the industrial Brazilian complex, the construction of the Santa Cruz complex. We're interested in enhancing our capacity to produce pharmaceutical ingredients, active ingredients, in order to promote the medium-term production of these supplies. We are not only planning to take care of the national and domestic market, but in our region with these biovaccines. We will invest human and financial resources in this mission. Thank you very much.
Agradecemos a la delegación de Brasil.
We thank Brazil for that statement. And now we give the floor to Honduras, followed by Cuba. Please, Honduras.
Buenos días.
Good morning, President, Dr. Karine Tien, colleagues. Honduras supports this document CD 598, and it addresses an issue that is not recent but has been exacerbated by the pandemic and has shown weaknesses in the region when it comes to production capacity for essential medicines and health technologies. We also agree with the proposed resolution increasing production capacity for essential medicines and health technologies. However, we should recognize that countries' capacity varies greatly, and that participation will be in line with the ability of each country to participate. In that sense, in looking at paragraphs OP1, ACB, IG of the resolution, we request that Honduras get support to increase the retention and acquisition of skilled workers for research, development, innovation, and production activities in order to better respond to health needs and demand. However, it's important for all of this to happen in a way that also increases governance in the healthcare sector which has grown even weaker than before given this pandemic. Director, paragraph OP2B of the resolution states that there should be cooperation with member states in cooperation with health officials, and part of this will be through health technology transfers. My question is, for us, the countries who have limited development, how can this be addressed? We would like for this proposal to be implemented in a way that is equitable and also in line with the specific needs of countries. For everything already mentioned, Honduras expresses its interest to be a more active player in regional and global initiatives in order to ensure that everyone has access to safe drugs and quality drugs. In conclusion, we recommend the Directing Council adopt this proposed resolution that accompanies this important document. Thank you, President.
Agradecemos a la delegación de Honduras por
We
su
thank Honduras for that statement. And now we give the floor to Cuba, followed by Uruguay. Good morning, Mr. President, Dr. Carissa Etienne. We're very grateful to the Secretariat for the document presented to incentivize and increase the production capacity for essential medicines and health technologies is undoubtedly priority for all countries in the region in looking for greater access and coverage. We believe that the approach of the three strategic lines as proposed in the document under consideration constitute the basis in order to attain those objectives. In Cuba, at the beginning of 2020, an innovation committee was established in order to deal with COVID-19, which has contributed to the introduction of new medicines, safer medicines and accessible medicines, as well as technology in order to manage and deal with this disease. Expert groups from the health system in the biotechnological industry in Cuba and from universities have recommended the approval of research work that support the national protocol of performance against COVID. The development attained by the Cuban technological industry, as well as essential medicines, has enabled us to articulate the production and research, linking it to the national health system in order to face this epidemic. A broad folder of products under development was established, which includes preventive medicines, antivirals, and anti-inflammatory medicines, as well as equipment and medical supplies. Likewise, the country has developed 5 vaccines, anti-COVID vaccines that have been approved for emergency use by our regulatory authority, and 2 in advanced stages of clinical assays, which guarantees sovereignty in this very important process that moves forward in an accelerated way. Colleagues, strengthening the regional cooperation and strategic partnerships are now necessary more than ever. For that, the region has sufficient strengths that can contribute to adequate development by having a benchmark of best practices of South-South cooperation and triangular cooperation at a global level. However, we need to step up other actions that will contribute to accelerated training of human resources, performing joint research, as well as transfer of technology that will increase the capacities for the production of medicines and health technologies that are essential in the region, where PAHO is used as a catalyst for the process on the basis of the principles of Pan-Americanism and solidarity. It is necessary for member states to resort to existent integration mechanisms in the region. The development of strategic partnerships is a path to technological sovereignty and the manufacturing of public needs and supplies that are needed so much in the region. Thank you very much. We thank Cuba for that statement. And now we give the floor to Uruguay, followed by Paraguay. Thank you, Mr. President. Thank you very much. The pandemic, the COVID-19 pandemic, has pushed us to look more than ever that the fundamental rights of all human beings be met regarding health coverage and access to health services. We are based our actions on scientific evidence, and we're working actively in order to have all the essential medicines and supplies in order to take care of this pathology. We've gone through different moments during this pandemic, having an increase in the number of cases this year, and therefore the efforts were concentrated on support supplies for patients with a COVID-19 diagnosis in a critical condition in ICUs. Because of these purposes and because of identified medicines, we contacted the benchmarks, intensive medicine, medical schools, the President of the Republic, in order to design a list of priority medicines based on these characteristics. This list was later on assessed in a conversation with the members of the different institutions responsible for hospital, pharmacies, and technical departments, pharmaceutical industries, as well as advisors from our general health department within the Ministry of Public Health, attempting to establish a minimum consumption per day per patient so that we can have vast existence and supplies of these drugs. Therefore, interinstitutional cooperation was absolutely essential. Hand in hand with this, we established contact with companies that commercialized medicinal oxygen, which was critical. The demand for this supply in institutions, as well as the cylinders that were delivered at home, went beyond the historic levels, reaching the top in manufacturing. So we had to create the logistic, and in that regard, promoting cooperation between companies in order to avoid lack of supplies was essential. A plant for generation of oxygen was reopened in order to increase and step up production because the demand surpassed production. Besides, we established contacts in order to allow technical staff and equipment leaving the country to go to other countries in the region. And we're very grateful to the countries that supported us. Since April this year, we have daily contacts with a list of essential medicines. Regarding the diagnosis of the disease, we developed local techniques. There was a huge commitment and support by researchers in the academic area. From the ministry, there were field research from all elements in order to provide guarantees to the population. A health logistic was strengthened with the standardization of work standards in order to promote access to methods and supplies. Medicines were delivered in border Brazilian cities. Medicines were imported in order to treat patients with COVID and oxygen. We can say that teamwork at a multidisciplinary level left behind commercial competition amongst companies. We were accountable and we funded professionals for future development of vaccines. It is absolutely clear that we have to strengthen international cooperation in order to strengthen and step up national and regional capacities. Thank you, sir.
Agradecemos a Uruguay por
We
su-
thank Uruguay for that statement. And now we give the floor to Paraguay, followed by Peru. Thank you very much, Mr. President. Paraguay supports and thanks the Secretariat for the efforts deployed for the introduction of this proposed resolution. Thus, my country has reviewed with interest the document that concentrates on 3 strategic lines. Due to that, we believe that increasing the production of essential medicines and health technologies ought to be taken as one of the strategic components that are key for the region, particularly taking into account that the COVID-19 pandemic has evidenced that the unequal access to vaccines against this disease, preventing its equitable distribution. Likewise, it's also proven the weakness of global distribution chains for essential medicines and health technologies. With a firm will to continue moving forward and coordinating efforts, Paraguay, during the 74th World Health Assembly, supported the resolution 74.6 on stepping up the production, regional and local production of essential medicines and health technologies. That thus, we stress the importance of taking into account local manufacturing to reduce dependence on global markets and imported goods. In connection with these, we express our support for the proposed resolution as an incentive in order to increase a transfer of technology and as an incentive to promote solidarity and international cooperation in the region. We are convinced that its implementation will enable us to improve access to accessible medicines and other quality health technologies. thus contributing to sustainable access to these and foreseeing the scarcity and shortage of medical supplies. Thank you.
Agradecemos a Paraguay por su
We thank
intervención.
Paraguay for that statement, and now we give the floor to Peru, followed by Chile. Thank you very much, Mr. President, distinguished director, colleagues. To the extent that countries declared the health emergency caused by COVID-19, the unexpected increase accelerated in the demand for certain medical devices led almost immediately to situations of lack of a supply, shortages, and increases in prices. The shortage in PPEs and scarcity of pharmaceutical products was one of the first consequences brought about by the pandemic, even coming before its impact in terms of interruptions in health services and morbid mortality. Progressively, we saw lack of supplies of other health technologies, such as ventilators, technologies for the production of oxygen, oximeters, and other medicines used in intensive care units. To date, the existing initiatives have not reached the necessary levels of production in order to meet the regional and global demand. The global production of the vaccine against COVID-19 that have authorization for its use and application is still concentrated on a couple of manufacturers, which besides face hurdles in order to accelerate and expand the production due to the global limitations that exist in the manufacturing of supplies for the production of vaccines. Therefore, to ensure access to medicines and other health technologies, essential medicines and health technologies in health systems, call for a broad and comprehensive approach that will consider the different sides of access and that demands effective management of public policies so that actions and incentives will be consistent and will be aligned between them. It is believed that it is extremely important to acknowledge that access to essential medicines and health technologies is a global priority and an essential component for universal access to health and universal coverage. And that some countries face problems in access due to factors such as the low manufacturing capacity and the very high prices, amongst others, and that these problems might be exacerbated in times of emergencies in public health or a demand that affects us during the COVID-19 pandemic. This is based on the fact that it is very necessary to strengthen and step up a national and regional capacity for the development and manufacturing of essential medicines and health technologies. Because of all of the above, Peru supports the proposed resolution increasing production capacity for essential medicines and health technologies. Thank you very much.
Agradecemos a la delegación de Perú por su
We thank Peru for that statement, and now we give the floor to Chile, followed by Colombia. Thank you very much, Mr. President, fellow delegates. Good morning. Chile thanks PAHO for preparing this document, which proposed clear strategic lines in order to guide the processes to improve national and regional production of medicines and health technologies. Chile, as well as other countries in the region, depends on foreign supply for the procurement of medicines and other health technologies and for the protection of our health personnel. That situation was enhanced during the pandemic. However, we had to set in motion initiatives that aligned with the proposed strategy from the public sector, for example, in order to deal with the situation of access to vaccines. An interministerial committee was established in the country where we had the participation of the ministries of science and technology, health, and foreign relations. We consider an advisory council eminently scientific in nature, which has allowed for good cooperation with universities and the private sector, thus achieving access to vaccines for over 80% of our population. Along the same lines, our country commends and supports the efforts done by PAHO in order to promote a regional platform to move forward with the production of vaccines and other health technologies. Difficult times also bring opportunities, and in Chile, the pandemic is enabling us to go back to national production of vaccines. 2 decades ago, we lost that possibility after the closing of the laboratory, the Public Health Institute. But we hope that in the near future, we will be able to go back to the manufacturing of large amounts that will improve the national situation and to be able to export to other places that have difficulties in accessing vaccines. During this pandemic, it's also provided us opportunities to learn new forms of relating between people, but also between countries. We share our experience, as was stated by the strategy proposed in this document, and it ought to be the beginning in order to kick off a process and bring about changes in the region on this score. Last but not least, Chile offers its support to the proposed resolution. Thank you, and we wish you the best.
Agradecemos a la delegación de
We
Chile.
thank Chile for that statement, and we now give the floor to Colombia. Thank you, Mr. President and distinguished moderator. We would like to thank the Secretariat for introducing this document, which is extremely relevant because of the current health emergency faced by our region. The lack of availability of vaccines against COVID turns the local and regional supply strategy to become even more important to respond equitably when dealing with emerging diseases, promote the research, and reduce dependence on foreign agents. Can you hear me? Yes, we can hear you. We would kindly ask you to speak slower in order to facilitate the work of the interpreters. Thank you very much. Perfect, thank you. So let me start again. The lack of availability of vaccines against COVID-19 has turned the supply strategy, local and regional strategy, to pick up in importance because it enables us to respond on a timely and equitable basis when dealing with emerging diseases, promote research, and reduce dependence on foreign agents. Besides, it favors the participation of more manufacturers by increasing competition and supply, and thus regulating prices in markets. Thus, in Colombia, we've designed a strategy in order to reactivate the production of essential medicines and vaccines at a national level, which is made up by 3 stages. The establishment of filling and finishing facilities, the production of vaccines through transfer of technology, and making available research and development units in order to expand the production capacity. In spite of the important efforts deployed by the country on this score, as well as building a regulatory system for the registration of medical and biotechnological supplies by including technological developments and the inclusion of these medicines. Since 2000, we stopped producing at a national level due to the demands in having to comply with international requirements and the lack of governance and coordination amongst the different stakeholders internally. We are several countries involved in this process to reactivate this productive sector and to step up our national and regional capacities. But this is an effort that calls for joint work and for international cooperation in order to facilitate processes not only for transfer of technologies, but also for the exchange of knowledge, experience in regulatory processes, intellectual property, articulation with the private sector, generation of strategic partnerships, inter alia. In this regard, we stress the efforts made by PAHO to support the exchange of knowledge and technology and increasing local capacities for production and development aspects which are essential in order to move forward with this objective. These aspects will enable us to have the preparation, adoption of actions geared towards the strengthening of the capacity to produce and to define the roadmaps and plans in order to align stakeholders involved. Therefore, we celebrate this initiative of the regional platform to move forward with the production of vaccines, on which we would like to hear additional details on how specifically states can get involved, how it is expected for states to participate at the short, the medium, and long-term benefits for countries. Likewise, we request additional information on future steps after the launch, the plan of action related to the implementation and operation of the platform. Last but not least, we would like to express our support for the proposed resolution as well as for the document that we hope will be adopted in this agenda item. Thank you very much. We thank Colombia for that statement. We have no additional requests for the floor by member states, and we shall then proceed to give the floor to non-state actors in official relations with the organization. And for that, we will now give the floor to Drugs for Neglected Diseases Initiatives at DNDi. You have the floor, sir.
Thank you, Mr. Chair. DNDi welcomes the report. The main challenges identified are not new, and DNDi urges member states to accelerate the action, in particular to promote and develop sustainable financing mechanisms to support R&D, which should separate the price of final products from research and development costs, ensure that TRIPS flexibilities are implemented in national legislations with technical support from PAHO, including policy discussions on TRIPS waiver for COVID-19 technologies, support the work on patent databases and pooling, as well as enact other policies for the pro-access management of intellectual property to ensure timely and equitable access to health technology by overcoming intellectual property barriers when needed. Support regional and national regulatory agencies' work on convergence and harmonization to strengthen regulatory processes, including collaborative regulatory and clinical trials registration to ensure timely registration of health technologies, particularly for NTDs. Implement transparency measures regarding the cost of R&D, which is key to ensure fair pricing and a clear return on public investment in R&D. This was widely cited at the recent Fair Pricing Forum hosted by Argentina. Support initiatives that strengthen and invest in the field of national or regional production of medicines, API, and other health technologies for existing infectious, non-communicable, and pandemic-prone diseases. And manufacturing needs should be mutualized across disease areas where feasible, demands pooled, and common delivery and access mechanisms explored. Increased participation and dialogue with civil society and non-state actors in relation to the platform to discuss challenges and opportunities in the production of essential medicines and health technologies in the region. In relation to the resolution, the DNDi urges member states to develop national policies to promote research and development, innovation and access, and include treatments for endemic diseases of the region, such as neglected tropical diseases, in the definition of priority products for local production. I thank you, Mr. Chair.
Agradecemos a DNDi.
We thank DNDi for that statement. Mr. President, I see no additional requests for the floor, and therefore I give the floor back to you, sir.
Thank you very much. And let me also thank those who participated and gave their valuable contributions to this very important report. I will now yield the floor to Dr. Fitzgerald to respond to comments that have been made.
Thank you very much, Mr. President, and thank you to all the member states that have made comments on the strategy here this morning. It really highlights the complexity of the issue that is here before us, but not just the complexity, but also the diversity of the region in terms of the capacities that exist. We have heard from member states on really the importance of multi-sectoral action, setting national priorities and ensuring the collaboration mentioned by Ecuador, Mexico, Canada, Uruguay, Chile. And this multi-sectoral action must be accompanied with multi-stakeholder engagement, which brings together not just the industry, economy, and health, but also academia, the private sector, and civil society organizations. And here we really have to note the role of the private sector, as we've heard from member states, in being able to surge capacity within the context of a public health emergency. Tech transfer and production has really scaled up throughout the region, as we heard from Argentina, Brazil, Cuba, and Chile. And this will constitute a very critical and important strategy moving forward to increase capacities in the region. But we must do this in a manner that ensures access and access for all as we move forward. As I mentioned, capacity is diverse. The strategy that the member states have considered here today allows for the adaptation and the implementation of national policies and strategies for everyone, irrespective of that capacity, and so that the whole region can benefit. And we note the comment, for example, from Jamaica and the particular challenges of the Caribbean in the very complex supply chains that were faced and the challenges within that context in terms of ensuring access to critical supplies. And perhaps a regional specific dialogue within the context of the Caribbean is required. Also Honduras, noting that a diverse context exists for a number of countries, but this is a roadmap for all countries and steps can be taken. And in this regard, I think we need to congratulate also Honduras for the establishment of a new national regulatory authority. The second comment I think that we heard this morning really speaks to the regional and global collaboration that is required to make this a reality. Comments received from Canada on the national strategy, from the United States, from Mexico, on the actions being taken from Cuba and Peru. We are fully engaged in working with other global and multilateral initiatives. And we have made the commitments, this is a priority for the director, to increase collaboration across the UN systems, not just within the region, but globally. And solidarity and collective action will be really important in this regard. As I mentioned in my opening remarks, we continue to engage with WHO in the Global Forum on Production, with WHO and the Medicines Patent Pool on technology transfer, within the ACT-A initiative with the World Bank and Global Fund and UN agencies, including WTO and WIPO, and regionally with ECLAC in science and technology, in health and industry, and with the initiatives around CELAC and ProSUR. All these are coming together jointly with the IFIs, including the IDB, and civil society groups. And this is speaking to the comment of Colombia in particular. This is the overall objective of the regional platform, where we bring all these actors together to really begin to look at this issue from the health perspective, to determine those priorities and to share information moving forward, but also to develop specific projects that will address some of the priorities, not just in vaccine development, but across a full spectrum of health technologies. Many thanks, Mr. President.
Dr. Fitzgerald, for your responses. At this time, I'm going to ask Madam Director, Dr. Etienne, if she has any comments to add.
Thank you and good morning, delegates. Thank you, Mr. President. I do not have too much to add. I certainly want to thank member states for their engagement in this agenda item and around increasing production for health technologies. And let me also thank James, who has responded to many of the issues. This region experienced the reality of the great dependency when it comes to health technologies. And I know this has been magnified by access to COVID vaccines. But early in the pandemic, we had great issues with supplies like PPEs, masks. We had medicines, issues with accessing medicines. We still have issues with accessing oxygen and oxygen delivery mechanisms. And this is despite the capacity and potential greater capacity that exists in the region. So like you, I think that this is the time that we need to move to accelerate our self-sufficiency by engaging multi-sectoral and multi-stakeholder organizations. And with a view to ensuring a regional capacity for a regional access. And that's going to be very important. It's not going to happen overnight, but what we do know is that we need to accelerate and scale up action now if we're ever going to be able to meet our needs, but also to be better able to face another pandemic. And PAHO is making strides in terms of increasing our production capacity. You will know about the platform that we established. And I would like to invite you to attend the side event this afternoon at 1 o'clock, when you will see how far and how quickly we are moving towards the production of mRNA vaccines and the technology transfer to this region with the assistance of all of the organizations and institutions that James just mentioned, to ensure that the region has the capacity to produce COVID-19 vaccines, but has the know-how to also produce for other diseases using the mRNA technology. So thank you again. And this region must never experience the dependency that it experienced for COVID-19. And we must all together say, never again. We need to work together to ensure that we are self-sufficient in producing the health technology that we require. Thank you so much.
Well said, Madam Director. Thank you very much for that. I think we have a significant consensus around this issue and the need to build capacity, and that is a positive development. I'm going to ask now our rapporteur to read the resolution.
Gracias, presidente. ¿Me escucha bien?
Thank you, President. Can you hear me?
Yes, please.
Very well. Proposed resolution. Increasing production capacity for essential medicines and health technologies. The 59th Directing Council, PP1, having reviewed the policy on increasing production capacity for essential medicines and health technologies, document CD 59/8, PP2, considering that one of the basic principles enshrined in the Constitution of the World Health Organization, WHO, is that enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, or economic or social condition, and that the health of all peoples is fundamental to the attainment of peace and security, and is dependent upon the fullest cooperation of individuals and states. PP3, recognizing that access to essential medicines and other health technologies is a global priority and fundamental to universal access to health and universal health coverage, and that some countries face access barriers due to factors such as limited manufacturing capacity and high prices, and that these problems may be exacerbated during public health emergencies or situations of overwhelming demand, such as during the COVID-19 pandemic. PP4, observing with concern the impact of transport and international trade restrictions on access to raw materials, intermediate inputs, and medicines and other health technologies, including access to substances subject to international controls, such as sedatives and analgesics for intubation protocols during the treatment of patients with COVID-19. PP5, considering Resolution A/Res/74/274 of the United Nations General Assembly, the resolution's access and rational use of strategic and high-cost medicines and other health technologies, CD 55.R12, 2016, Public Health, Innovation, and Intellectual Property, a Regional Perspective, CD 48.R15, 2008, and COVID-19 Pandemic in the Region of the Americas, CD 58.R9, 2020 of PAHO, and the resolutions strengthening local production of medicines and other health technologies to improve access, WHA 74.6, 2021, COVID-19 response, WHA 73.1, 2020, and improving the transparency of markets for medicines, vaccines, and other health products, of the World Health Assembly, together with the adoption of the Global Strategy and Plan of Action on Public Health, Innovation, and Intellectual Property, and its priority actions. PP6, recalling the agreement on trade-related aspects of intellectual property rights, TRIPS agreement, in its amended version, and also the Doha Declaration on the TRIPS agreement and public health, issued by the World Trade Organization, WTO, in Doha in 2001, which states that intellectual property rights can and should be interpreted and implemented in a manner supportive of WTO members' right to protect public health and, in particular, to promote access to medicine for all, and which recognizes the importance of intellectual property protection for the development of new medicines and the concerns about its effects on prices. PP7, recognizing that health is a precondition and result of sustainable development and calling for the participation of all relevant sectors in coordinated multi-sectoral action to urgently address the health needs of the population. PP8, recognizing that the creation and strengthening of national and regional capacity for the development and production of raw materials and essential medicines and other health technologies is important for improving their affordability and accessibility, and adequately responding to regional health needs, especially during health emergencies, and that this also contributes to health security and economic and social development. PP9, recognizing the importance of promoting competition to improve the availability and affordability of medicines and other health technologies consistent with public health policies and needs through, inter alia, the manufacture and introduction of generic versions, and especially of essential medicines in developing countries. PP10, recognizing the importance of transparency, access to sustainable financing, strengthening of research, and development and transfer of technology under voluntary and mutually agreed terms, as well as the importance of voluntary initiatives such as the COVID-19 Technology Access Pool, or CTAP, and Medicines Patent Pool as mechanisms for building and strengthening national and regional capacity for the development and production of raw materials and essential medicines and other health technologies. PP11, recognizing the need for strengthened national regulatory systems convergent with international standards to help ensure appropriate oversight of the quality, safety, and efficacy of the raw materials, medicines, and other health technologies produced in the region. PP12, recognizing that regional and sub-regional integration can stimulate production through the development of sustainable demand, including the needs of member states with small markets, and reaffirming the importance of international cooperation and collaboration with regional agencies of the United Nations system and other international and domestic financial institutions. Resolves OP1, to urge the member states, considering their contexts, needs, vulnerabilities, and priorities, to A, promote the implementation of comprehensive national multi-sectoral policies on essential medicines and other health technologies that include roadmaps for their implementation and the explicit statement of multi-sectoral priorities for development, production, and equitable universal access. B, create or strengthen multi-sectoral governance mechanisms with health sector participation to increase national research, development, innovation, and production capacity, defining roles, respecting sector competencies, and prioritizing attention to regional health needs with leadership of national authorities and the collaboration of academia, the private sector, civil society, and international organizations. Strengthen, and this is under C, strengthen national capacity for the development and production of raw materials and essential medicines and other health technologies, including the training of skilled human resources and, where applicable, the strengthening or development of national infrastructure and clusters that support research, development, innovation, and production activities to better meet health needs and priorities. D, strengthen the capacity of institutions with enabling and oversight functions for the medicines and other health technologies sector, including the strengthening of national health regulatory systems, among others. E, develop or strengthen as appropriate a coherent policy environment for the health sector and the science and technology, industry, and trade sectors to encourage the promotion of research, development, innovation, technology transfer under voluntary and mutually agreed terms, and the production of quality raw materials, essential medicines, and other health technologies, promoting affordability and accessibility, transparency, effectiveness, and competitiveness, environmental protection, and the sustainability of projects. F, increase investment in science and technology for the production of raw materials, essential medicines, and other health technologies, and strengthen the incentives for industrial promotion and the use of public procurement that simultaneously fosters affordability, sustainability, competitiveness, development, and regional production. G, promote international dialogue and collaboration to make progress toward timely, universal, and equitable access to quality assured, safe, effective, and affordable essential medicines and other health technologies, including their components and precursors that are necessary for public health emergencies and long-term planning, while ensuring their fair distribution and eliminating unjustifiable access barriers through a joint effort to promote resilient supply chains. OP2, to request the director to A, provide technical cooperation to the member states in developing and implementing comprehensive policies on essential medicines and other health technologies to help strengthen national capacity, meet multi-sectoral objectives, and improve access to essential medicines and other health technologies. B, collaborate with member states in coordination with the national health authorities and promoting technology transfer under voluntary and mutually agreed terms, as well as intra-regional activities in science, technology, and innovation, including networks of institutions devoted to research, development, and innovation, and collaboration with regional industrial associations and international financial institutions for economic and social development. C, promote collaboration and the exchange of information and experiences among member states with the participation of the national health authorities and prepare model lists to prioritize the needs for medicines and other health technology in the region in order to guide investment in other incentives for increasing regional development and production. D, continue to support the member states by strengthening the capacity of national health regulatory systems to help ensure appropriate oversight of the safety, quality, and efficacy of medicines and other health technologies, including those produced in the region, by promoting convergence, regulatory harmonization, and networks of national health regulatory authorities. E, continue promoting transparency of prices and economic data along the value chain of medicines and other health technologies, including those produced locally, in order to foster affordability and access. F, to continue providing technical support as appropriate and when requested in collaboration with the national health authorities and competent international organizations such as the World Trade Organization and the World Intellectual Property Organization, including support for policy processes to countries that intend to make use of the provisions of the TRIPS agreement, including the flexibilities recognized by the Doha Declaration on the TRIPS agreement and public health in order to promote access to pharmaceutical products. Promote, with the participation of national health authorities, the development of a regional platform to discuss challenges and opportunities in the production of essential medicines and health technologies in coordination with the relevant agencies of the United Nations system and other relevant stakeholders in order to consider the deliberations of the WHO World Local Production Forum. Mr. President, that was the read of the proposed resolution.
Thank you very much. Let me thank our rapporteur from Chile for that very extensive resolution, which clearly covers significant areas of concern. It is a testament to the lessons that we have learned so far from the COVID-19 pandemic, and also the efforts that have gone into trying to capture those lessons and to drive policy that will strengthen our health system in the region. So really appreciate that. Now, I do take note that during the contribution of delegates, there were substantial agreement around the report, and therefore that also is a good sign, means that we're all thinking alike. However, if there are any concerns, comments, recommendations around the resolution, then I will recognize those delegates through the moderator and ask them to make their contribution at this time.
Muchas gracias, señor presidente.
Thank you very much, President. We will now take note of requests for taking the floor regarding the resolution that was just presented.
Señor presidente, no
Mr. President, we do not see any requests for the floor. The floor is back over to you.
Thank you very much for that. Again, a lot of thought has gone into this document, and comments very positive in support. I want to commend those who have championed this particular document, and of course the resolution. Having had no objections or comments, I declare the resolution adopted. Very well. Congrats to all who have participated and to our region. Okay, I now move to item 4.6. One Health, a comprehensive approach for addressing health threats at the human-animal environment interface. And I invite delegates to look at document CD 59-9 to the attention of the council and invite representatives of the representative of the executive committee to report on this item. Thank you.
Muchas gracias, presidente.
Thank you very much, Mr. President. The Executive Committee welcomed the proposed policy and endorsed the One Health approach. The committee expressed support for the proposed strategic lines of action put forward in the policy document. Nevertheless, delegates felt that several aspects of the policy could be strengthened to address issues specific to the region, such as illegal mining and the use of agrochemicals. It was pointed out that the policy did not adequately recognize the importance of working with local populations, including indigenous peoples. It was also suggested that the document should place greater emphasis on sharing information, conducting joint research, and utilizing the existing technical and human resource capacities in each country, including the expertise available at PAHO, WHO collaborating centers. The committee underlined the need for multidisciplinary and multi-sectoral action to implement the One Health approach and ensure that adequate attention is given to social determinants of health, such as access to water and sanitation and to nutritious food. The committee adopted resolution CE 168.R11, recommending that the directing council approve the policy on One Health. Thank you very much, Mr. President. This concludes my report on this item.
Thank you very much for that report, that brief report, but important. I now yield the floor to Dr. Marcos Espinal, Director of the Department of Communicable Diseases and Environmental Determinants of Health of the Pan American Sanitary Bureau, to present the item. Dr. Espinal.
Thank you, Mr. President. Good morning. Mr. President, Madam Director, members of the Directing Council, I'm pleased to introduce the policy document CD 59/9, One Health, comprehensive approach to addressing threats at the human-animal-environment interface. The One Health policy document aims to foster coordination and collaboration among the different governance frameworks of human, animal, plant, and environmental health programs to better prevent and prepare for current and future health threats at the human-animal-environment interface. One Health is a collaborative, multidisciplinary, and multi-sectoral approach aiming to achieve optimal health outcomes by recognizing the interconnections between people, animals, plants, and their shared environment. Health threats that could be addressed under One Health include diseases of zoonotic origin, antimicrobial resistance, and foodborne illness. Worldwide, about 60% of the infectious organisms known to be pathogenic to humans are zoonotic, having an animal source of origin. The COVID-19 pandemic is the latest example of the devastating impact of zoonotic diseases. Antimicrobial resistance is responsible for an estimated 700,000 annual deaths worldwide. In the region of the Americas, 77 million people, including 31 million children under age 5, fall ill every year from contaminated food. The One Health policy builds on existing mandates and plans and on the experience of PAHO and other relevant organizations and stakeholders. The policy document was prepared with the input of several entities across the Bureau, including the Health Emergencies Department, Evidence and Intelligence for Action in Health Department, the Pan American Center for Food and Mouth Disease, and various other units. The policy was discussed with member states in May 2021 at 2 informal consultations with representatives of the Ministries of Health, Ministries of Agriculture, and Veterinary Services, and Ministries of Environment and Regulatory Agencies. At the Executive Committee in June 2021, a member states working group further enriched the document, relying on and promoting the cross-cutting themes of gender, equity, human. The policy articulates the following 6 strategic lines of action. Line 1, carry out a stakeholder analysis and mapping. Line 2, establish multi-sectoral, consensus-driven coordinating mechanisms. Line 3, strengthen the multidisciplinary aspects of existing frameworks, such as IHR, InfoSAM, Codex Alimentarius, and others. Line 4, foster the implementation of multi-sectoral technical activities. Line 5, embrace digital health solutions and emerging technologies. Line 6, promote research and capacity building. The Directing Council is invited to review the policy One Health, a comprehensive approach to addressing threats at the human-animal environment interface, provide the recommendations it deems pertinent, and consider approving the proposed resolution presented in Annex A. I thank you, Mr. President.
Thank you very much for that presentation, Dr. Espinal. Very important area to cover. Before I open the floor to the plenary for discussion, I just would like to announce that at 11 a.m., we will take a 10-minute break. So we will begin the interventions now, but at 11 a.m. sharp, we will take a 10-minute break and then resume after. So I now open the floor for any intervention. Kindly use the electronic platform to raise your hand. And in our usual style, I'll ask our moderator to conduct these proceedings.
Thank you very much, Mr. President. We see the request from Argentina, followed by the United States. Argentina.
Gracias, señor presidente, señor moderador.
Thank you, Mr. President. Moderator. Increase in antimicrobial resistance is one of the key issues faced in public health that threatens advances in modern medicine. The goal to take a broad approach at addressing these issues across sectors, in particular when it comes to animal, agriculture, and human health, Argentina has a strategic plan for national response coordinated by the healthcare sector with engagement from all stakeholders. Our country has been working based on a health approach with other national agencies like the Environmental Industry, Fisheries, Science and Technology Institute, as well as Innovation Institute. We have been working together across the board within the country and also within the provincial levels in order to address a number of different diseases like SARS-CoV-2 in animals and yellow fever, as well as other diseases. We also work together to address AMR through collaboration with representatives from a number of different sectors, including health, food safety, PAHO, and other organizations. There were periodic encounters despite the COVID-19 pandemic, and this led to 7 initiatives being proposed under our framework for collaboration with the EU. Recognizing the value in international cooperation and with the support of PAHO, we have deepened our cooperation with the Caribbean community in order to increase our ability to detect and address issues pertaining to AMR. There were a number of different activities that were carried out, and they are all in line with what we have been doing virtually. In 14 member states with CARICOM and with other stakeholders, we've been able to increase capacity to conduct higher capacity detection tests, improve laboratory capabilities, and also conduct monitoring for prevention. We also welcome the creation of a high-level expert panel made up of the tripartite partnership of FAO, IOMS, and PAHO in order to address these zoonotic diseases. Our goal is to deepen cooperation between governments and to also support scientific-based approaches. We welcome this and other proposals under this item. Thank you.
Agradecemos a la delegación de Argentina por la
We thank the delegate of Argentina for that statement. We've taken note of the request for the floor, US, Canada, Venezuela, and we will give you the floor as soon as we come back from the break. And before that, let me give the floor back to the president.
Thank you very much. Thanks to those who have participated so far, and there's a long list of contributors for this segment. We appreciate your efforts and willingness to contribute, but ask for your patience for a short break, 10 minutes, and then we will reconvene and pick up from this point. Thank you very much. 10-minute break. Ready? Okay, thank you very much. Welcome back. We are at the 59th Directing Council, Pan American Health Organization, and we took a 10-minute break. We are on item 4.6, One Health, a comprehensive approach for addressing health threats at the human-animal environment interface. And prior to the break, we had started to take contributions from delegates, the plenary, for discussion around the report that was given by Dr. Espinal. And I will hand back therefore to our moderator to continue the sequence of presentations.
Thank you very much, Mr. President. As mentioned before the break, we will now yield the floor to the delegation of the United States, followed by Canada.
Thank you, Mr. Moderator. The United States carefully reviewed the policy and we support approval of the proposed One Health resolution. We commend the strategy's focus on promoting a collaborative and multi-sectoral approach to detect, prevent, prepare for, and respond to future health threats at the human-animal environmental interface. We recognize the importance of improving animal health and food safety and protecting achievements in socioeconomic development of communities and industries in the Americas to reduce the impact of zoonotic diseases, antimicrobial resistance, and other One Health threats as reflected in the strategy. We strongly support the recommendation for technical activities to prepare for and reduce emerging and endemic zoonotic diseases backed by a sound risk analysis component, including a lens on understanding the drivers of disease emergence and the incorporation of data from microorganisms, animals, humans, and the environment. We encourage PAHO to work closely with the WHO, the FAO, OIE, and UNEP in consultation with member states in implementing this policy and ask that they engage with WHO headquarters as they build tripartite One Health structures and programs. Collaboration among the tripartite plus and WHO regional offices is essential to ensure effective, non-duplicative, non-conflicting strategic and systematic work plans and actions. Member states must also work to encourage more collaboration among multilateral organizations and express support for more coordinated and collaborative approach on One Health. We would like to thank PAHO for their early engagement with member states on this strategy and for holding consultations for feedback during its development. We look forward to continuing to collaborate with PAHO in these efforts as our region works to implement this policy. Thank you.
We would like to thank the delegation of the United States for their intervention. We now yield the floor to Canada, followed by Venezuela.
Thank you and good morning, Mr. President. Canada applauds PAHO's initiative and efforts to develop a One Health policy, as well as PAHO's insistence on the importance of environmental considerations, including wildlife, soil, water, and plants, in developing a more nuanced understanding of the complex interactions that exist between the animal, human, plant, and environment sectors. The current pandemic is a strong reminder of the importance of sustained research and multilateral and regional engagement to manage global challenges. Thus, we are strongly committed to a collaborative One Health approach that involves and mobilizes partners across human health, animal health, and the environment, and that ensures complementarity in actions between all the international initiatives that are currently being discussed and underway, including this regional policy. Canada is pleased to see that the policy highlights the importance of collaborating with local populations, for example, Indigenous peoples, to monitor for disease and develop pandemic prevention programs. We consider that a more collaborative and inclusive approach where local and Indigenous knowledge is meaningfully considered in One Health programs and policies is crucial. Canada acknowledges the importance of strengthened international scientific collaboration in support of a One Health approach and believe we need to make better use of advances in our ability to collect, analyze, use, and share human, animal, plant, and environmental data in order to anticipate, assess the risk of, and respond to health security threats. This interconnectedness needs to capture formal and informal information, data, including gene sequence data, sample sharing, and assessing multi-sectoral surveillance from human, animal, plant, food, climate, and aquatic health chains. Moving ahead, Canada continues to strongly encourage the Secretariat to collaborate with and integrate the work of the Tripartite Plus One Health high-level expert panel to ensure alignment of efforts. As we know, this panel is expected to guide the development of a dynamic new research agenda and draw up evidence-based recommendations for global, regional, national, and local action. In this regard, we look forward to continue working with partners to ensure complementarity in actions between all the international initiatives that are currently being discussed and are underway, including this regional policy. Thank you very much.
We thank the delegation of Canada for their intervention. We now yield the floor to Venezuela, followed by Guyana.
Thank you, Mr. President. The Bolivarian Republic of Venezuela agrees with the content of this proposed resolution, One Health, a comprehensive approach for addressing health threats at the human-animal environment interface. Acknowledging the initiative taken by the Director of PAHO, climate change threatens with reverting current achievements in public health of the global community. An increase in climate change, such as floods and drought, will have a catastrophic impact on health, particularly the population. The interpreters apologize, but there's very poor sound with a lot of echo, so we will do whatever we can. This has raised the limits between animal and human population, together with trafficking in persons and trade, resistance to antimicrobials, diseases transmitted by food, and zoonotic diseases. An example of this is the SARS-CoV-2 that has been spread in unimaginable proportions. We know that many of the microorganisms are subject to acute variations in climate that we're suffering. We have infecto-contagious diseases and other vector-borne diseases. We welcome the political purpose of this resolution, One Health, aware of the necessary integration, networks, and solidarity with the most vulnerable peoples, and particularly to move forward in combating the anthropocentric risks of climate change in order to improve prevention and preparation and preparedness to deal with future risks in the human, animal, and environment interface. We have to take into account the universal social impact to continue fighting for preservation of life on the planet. In our country, we want to promote the historic social model. And we're also considering that this is based on the respect for Mother Earth and the good living of our people. Considering diversity, systemic and cosmopolitan comprehensive views, the role of the state, the nation, in including technologies and other forms of organization, of production, distribution, and consumption that lead to sustainable use of natural resources, respecting resources and nature. Venezuela is part of the 7 countries that make up the Amazon basin, one of the largest reserves of biodiversity in the world, as well as one of the main sources of elements. In spite of the ecological impact on the Amazon, it is one of the most preserved ecosystems in the world, and therefore we urge all Amazon countries to protect it so that we can have one health for mankind. Thank you, sir.
We thank the delegation of Venezuela for that intervention. And before yielding the floor to Guyana, I would like to remind member states to please read your intervention slowly so as to facilitate the job of our interpreters. So we go now with the delegation of Guyana, followed by the delegation of Brazil.
Thank you very much, Mr. Moderator. Mr. President, COVID-19 is the single most disruptive event in recent human history. Globally, we have more than 228 million confirmed cases, with more than 4.6 million deaths. At no time in public health has there been more pressure for a concerted mechanism to mainstream the One Health agenda. In the coming years, Guyana will accelerate our efforts to formalize a One Health agenda, transforming an ad hoc collaboration into a seamless mechanism and cooperation between various stakeholders, including agriculture and environment. Guyana, within weeks, will commission a One Health Coordinating Committee. In this regard, Guyana would like to see the regular meetings of Ministers of Agriculture and Health of the Americas reconvene. One Health was RIMSA 17 major agenda item. Not much has moved since RIMSA 17. One Health has been on our agenda for a long time, but it has remained more rhetoric rather than a concerted effort. National and international efforts to contain zoonotic diseases must be the cornerstone of public health measures. The fact is that these efforts continue to lag, even as the risk of emergence of infectious agents capable of jumping the species barrier is increasing. COVID-19 has shown spectacularly that such jumping can have a devastating impact locally and internationally. In the case of COVID-19, the social and economic recovery will take many years. The health of humans and animals and plants are linked together, but by and large, our surveillance systems remain separate, fragmented, and in fact, underdeveloped. We need to fix this and fix it urgently. Guyana supports the call for additional research, but while most of our focus has been on killing microbes, very little work has been done to understand the microbiome and the role of good microbes play in protecting health. We urge that more research be done in this area. Mr. President, Guyana also urged that PAHO, WHO should intensify efforts, and we ask that the One Health team advance the One Health agenda in PAHO. Thank you very much.
We thank the delegate of Guyana for his intervention. We yield the floor to the delegation of Brazil, followed by Chile.
Muito obrigada, senhor moderador.
Thank you very much, Mr. Moderator. Brazil would like to express thanks for the efforts put forward by the Secretariat regarding One Health approach for Brazil. The matter warrants special attention. Ours is a country with one of the greatest biodiversities in the world. Given that reality, the proposal of fostering coordination and collaboration between the different sectors of governance and human health, animal, environmental health under the One Health approach is appropriate. That's a single approach to address the interface between animal, human, and the environment. This is an important topic taken up in international fora because the COVID-19 pandemic laid bare how necessary it is for us to look at this interface between animal, human, and environmental health. At the same time, what we saw during the COVID-19 pandemic, it has been shown to be very important for public resources to be brought to bear to make health systems broadly resilient. Now, the SUS, the single healthcare system, is Brazil's approach to addressing the pandemic, and we understand as key that countries do their best to strengthen their respective healthcare systems with a focus on primary healthcare. For Brazil, it's very important for us to ensure that the One Health approach not underestimate the climate and environmental aspects, as well as the social determinants of health. We have to strengthen water and sanitation infrastructure, increase access to medication. This all has equally severe effects on universal health care. And we could talk about, well, it's also very important for us to define what this means. It includes strategies, decision-making, and a response to animal health, human health, and we have to work together and across sectors. Now, the One Health approach needs to recognize the host of factors that contribute to the potential public health emergencies. That's why it's key for there to be a balance between the three realms, animal, human, and the environment. Thank you very much.
We thank the delegation of Brazil for the intervention. We yield the floor now to Chile, followed by Peru.
Thank you very much, Mr. Moderator. I would like to thank the Secretariat of PAHO and its technical team for having prepared this document, the proposed resolution, One Health approach. This document offers an organized view on the challenges posed by communicable diseases by way of zoonosis and also antimicrobial resistance. In our country, we have forged ahead in ensuring cross-sector governance, including different components of the One Health approach, such as the development of specific activities, including the participation of all actors involved. The National Plan against antimicrobial resistance includes participation of 6 ministries that are collaborating with different sectors, academic sectors, scientific communities, among others. I should underscore, well, the implementation of a strategic plan to carry out these activities together is underway. And so in virtue of this, the fact that food control systems are disparate, that is a challenge for us. And we have to define common plans to ensure the food safety of these products. I should also point out that Chile actively takes part in the Covax Alimentarius to address matters that relate to food safety and in trade of food. We reiterate our commitment to that process to incorporate the One Health approach to address health threats in the interface between animals, humans, and the environment. And Chile does support this resolution.
We thank the delegation of Chile for their intervention. We yield the floor now to Peru, followed by Cuba.
Muchas gracias, señor moderador.
Thank you very much, Mr. Moderator. The One Health approach policy seeks to ensure coordination and cooperation among the different frameworks of governance at the national and international level with human, animal, and plant health programs, including the environment, in order to prevent diseases such as the current one and prevent others of the same type. Now, this is a strategy that cuts across different areas covered by PAHO, such as human rights and others, to address the risk of the transmission of disease to human beings from animals and the environment. It's necessary to do that for us to work with the complementary approach across policies, including multi-sectoral approaches, such that we can maximize surveillance, prevention, and oversight or control of zoonotic diseases such as wild rabies, teniasis, and those that are vector-borne, malaria, dengue, yellow fever, chikungunya, Zika, Chagas, and others. Just as the surveillance of wild animals and vectors that are reservoirs of disease, and they do interact with the population, and so resistance to pesticides that are no longer effective to controlling vectors, and they also interact with the environment. And so this policy needs to be taken into account in adopting economic resources, and there has to be better financing such that we can ensure the sustainability of these initiatives, as well as to assess the impact of programs. We consider that as a country, we need to prepare ourselves and to adopt the necessary platforms for us to interact across institutions in a collaborative way, to have access to knowledge of priorities and topics that fall to us to develop, to come up with strategic plans, and to be prepared for emerging threats and emergencies. The One Health approach at PAHO should coordinate and offer technical assistance to prepare countries and territories with this One Health approach. We do agree with the draft resolution recommending that we include the different strategic lines of action for the One Health policy to promote the allocation of public resources and cooperation to develop and carry out the different activities that would address threats to health in the interface between animals, humans, and the environment, to foster the implementation of environmental policies to the benefit of people, and that they also protect the ecosystems, wild flora and fauna, namely, and to strengthen the oversight system, surveillance system, mindful of environmental threats that can also have an effect on all of these three spheres, animal, human, and the environment. Thank you.
We now yield the floor to Cuba, followed by Mexico.
Muy buenos días.
Good morning. We'd like to thank the Secretariat for the report. Colleagues, the current risk to human health is growing and ongoing, given other factors such as the emergence of known diseases and new diseases, antimicrobial resistance, and environmental pollution, which all of which makes it more than ever necessary for us to have a more scientific, a more systemic and effective approach to health problems based on integrated or comprehensive policies. The concept of One Health acknowledges that people's health is intimately tied to that of animals, plants, and the environment. Therefore, this calls for a collaborative, multi-sectoral, and multidisciplinary approach that is applied to all these spheres for us to thus achieve solutions that lead to optimizing people's health. Now, given the current dangers, they do result from a number of factors which give rise to increased interaction between human, animal, and environment. And that means there has to be a real, this threatens our ability to respond. And so it's necessary for us to rise to this world challenge posed by WHO and PAHO, for us to come up with policies and strategies that would ensure intersectoral and multidisciplinary cooperation at all levels with the One Health approach. Now, since 2015 in Cuba, we have been working along those lines. At the middle of this year, we approved a national strategy of One Health with a single multisectoral coordination body and interministerial one charged with coordinating again these activities. There is a macro program at the national level, which includes important research and development programs and interministerial programs to push this approach, but we still have much to do. We believe that the document as presented does cover the strategic lines, which will make it possible for the region to move forward, but we do still insist on the importance that we further develop technical capacities and human resources with this vision within and outside of the healthcare sectors. Therefore, we ratify and reassert Cuba's commitment to work to that end, to address with One Health approach threats to health. That's the only way for us to be prepared for current and future health emergencies worldwide. Thank you.
We would like to thank Cuba for that intervention. We yield the floor now to Mexico, followed by Paraguay.
Muchísimas gracias, señor moderador. Muchas gracias.
Thank you very much, Mr. Moderator and Mr. President. The Mexican delegation takes note of the importance of implementing a One Health policy with the comprehensive approach to health threats from the standpoint of the interface between animal, human, and the environment. In Mexico's case, despite the fact that we do keep up an exchange of information across different government agencies for surveillance, prevention, and control of these types of threats, we do need to improve our intelligence products for decision-making. To that effect, And under the strategy of transforming our public health system in Mexico, we call for the creation of three important centers: the National Health Intelligence Center, the National Health Emergency Center, and the National Infectious Disease Center, all of which will work hand in hand for us from a multi-sectoral approach to improve this One Health approach to address different threats. Likewise, a specific office is being created for public health policy, which will give rise to a comprehensive approach taking into account all of the different aspects of public health and to generate or create public interventions across the sectors. Some of the things we could share with you along these lines: Mexico in 2019 was recognized by PAHO as a country that has eliminated human rabies transmitted by dogs as a public health problem, which we have kept up since 2006. This was an achievement that is carried out by a public health ministry that is aware that animal and human health cannot be dealt with separately. In 2019, we also addressed another topic to include One Health approach for prevention and control of vector-borne diseases, especially for surveillance of yellow fever, in which, because we do have non-human primates in Mexico, which can be reservoirs for the wild yellow fever. I would also like to mention that in Mexico, a group was created, an intersectoral health, environment, food group, which addresses food safety from a cross-sector approach under the One Health approach. And one of its policies is to come up with policies to deal with obesity, and we have the expertise of the country office of PAHO in Mexico working with us on that. Finally, we do think it's very important that with this regional and global outlook of the Secretariat of PAHO, useful and operational tools are being generated for us to craft these intersectoral policies to implement the One Health approach in the different member states of PAHO. Thank you very much.
We thank Mexico for their intervention. We now yield the floor to Paraguay, followed by Ecuador.
Muchas gracias, señor presidente y señor.
Thank you very much, Mr. President and moderator. We appreciate this policy because it does bring to bear a multi-sectoral and multidisciplinary approach. We do think that the document is in line with the actions and the activities that we call for in our national plan against AMR, which enables the health ministry to take part in an active way with institutions such as the Ministry of Agriculture and Livestock and Animal Health, among other ministries and agencies. Within the COVID-19 pandemic, Paraguay has undertaken efforts to bolster national prevention programs and to prevent a disease. We've also approved an empirical treatment for infections guide that we share with the community to raise awareness among healthcare professionals about the services and primary health care professionals about antimicrobial resistance. We also have a surveillance system for microorganisms, especially those that are resistant, and there are still standing challenges to increase, for example, the flow of information, and we need to undertake the necessary efforts for us to incorporate our system with international ones. We ratify our commitment to the One Health approach, which is a comprehensive one, because it has three components: human, animal, environmental realms, which interact. They are cross-cutting, bringing together different sectors who, working together, will bring better health to all. So we approve this document. We understand that it will become a tool that will make it better for us to better approach emerging health threats and to enable us to better understand what the socioeconomic impact of these emerging diseases are. Thank you.
We thank Paraguay for their intervention. We now yield the floor to Ecuador, followed by Uruguay.
Muchas gracias, señor presidente.
Thank you very much, Mr. President. Ecuador is pleased to see the One Health approach document. It's an instrument that takes into account context, needs, and priorities at the national level. With the technical support it offers to encourage articulated work among the different agencies of the state, environment, water, ecology, livestock, agriculture, public health, among others, in which each one within its aegis or purview can bring to bear its know-how to enhance environmental, human, animal health such that the countries be better prepared to respond appropriately to emergencies that might emerge from zoonotic diseases with a better understanding what risks are, taking into account the interrelation of data on microorganisms, animals, human beings, and the environment. That's why we firmly believe that the countries of the region should structure and implement early warning systems that operate on an interface so that we can respond to outbreaks of concern nationally and internationally, and for us after such an outbreak to exchange information on them swiftly and transparently on endemic, zoonotic, and vector-borne diseases, infectious diseases, emerging, re-emerging zoonotic diseases, AMR, and food safety. Furthermore, Ecuador also deems it to be very important for us to start this process by mapping out all of these stakeholders and those charged with those subject matters for them to be identified so they can exchange resources and information and thereby ascertain what existing gaps are vis-a-vis what is called for in this One Health approach policy for us to overcome them with the governance mechanisms that promote intersectoral work, enabling us to create a national roadmap that responds to health threats that are identified in the animal-human environment interface. Lastly, Ecuador congratulates you for this initiative and pledges to work hard on this, taking into account the 6 strategic lines of action called for by One Health approach policy to strengthen the stewardship of the public health ministry and the national health system through improving capacities of all the actors addressing social and environmental determinants, and to ensure that they be included in integrated information systems with a One Health approach across all policies. We approve this proposed resolution, a comprehensive One Health approach to address animal-human environment interface. Thank you.
Thank you very much, Ecuador, for that intervention. We yield the floor now to Uruguay, followed by Bolivia.
Muchas gracias, señor presidente.
Thank you very much, Mr. President. It's true that we do need a coordinated or comprehensive approach to health. The One Health approach includes all of those key aspects outside of the strictly health realms, but that still pose challenges to health, and each of which cannot solve the problems alone. We're talking about agriculture, environment, water, sanitation, energy, housing, labor, transportation, land use, and other sectors. We are all part of a single planet. We are part of One Health to protect nature and to ensure the sustainable use of resources can help us to ward off future pandemics. The pandemic has accelerated, or climate change rather, has accelerated the emergence of diseases, and there are emerging heretofore unknown diseases. Now, Many of the diseases affecting humans are of zoonotic origin, affecting animals and humans alike. There are 200 zoonoses that are a key threat to our health, affecting 2.6 billion people, more than 20%, accounting for 20% of loss in food production. Uruguay, we see that this is something that affects the north of our country with the reemergence of dengue in 2016 after 100 years and other diseases. Now, our health ministry, following recommendations of PAHO and WHO, has sought to address these different diseases, leishmaniasis and others. Now, this experience has taught us the virtue of working across sectors and overcoming the stovepiping of prior approaches. Over the last couple of years, a number of regional initiatives. We have taken part in different regional initiatives. We have approached in an intersectoral way. Our public health ministry is also involved in policies to deal with climate change. We have a climate change in a health interface program. We have another study underway looking into vector-borne diseases and zoonoses, a national plan for the prevention of communicable diseases by vectors that are affected by climate change, early warning systems tied to temperature or cold spells. The sound, says interpreter, is compromised. Interpreting is difficult. Now, we do see the importance of exchanging knowledge and for there to be greater cooperation among countries for us to contribute to better health for all with this One Health approach.
We thank Uruguay for the intervention. We yield the floor now to Bolivia, followed by Guatemala.
The interpreter regrets.
I think you're having an issue with your microphone. If you could please double check. No, we're not hearing you properly. No. No, hay un sonido particular cuando escuchamos su voz.
We're not hearing your voice. There is a unique sound coming from your microphone. I would just say we should move on to the next speaker, Guatemala, and we'll come back to Bolivia as soon as that microphone problem is solved. Guatemala. Mr. President, Guatemala would like to thank the director of PAHO for the leadership she's offered and the technical support that PAHO has given our country in the region. Again, the speaker's sound is breaking up. The interpreter will do his best. We have undertaken a number of efforts to address the pandemic. One Health approach helps us address the interface between animal-human environmental interface, such as what we see now in this pandemic, which was begun with an infectious disease that jumped from animal to humans. Now, there are zoonotic diseases and also the issue of antimicrobial resistance as well as food safety, all of which are covered by One Health approach. Now, this is in line with this multi-pillar approach, One Health, bringing to bear coordinated and cooperative efforts across different ministries with the health ministry to address together prevention and for us to be better prepared for future health threats. We do have intergovernmental mechanisms for us to bring to bear different governance frameworks that span across animal, human, environmental realms. And for Codex Alimentarius, under our health ministry, we do have departments that specialize on the Codex Alimentarius. And so we are currently implementing a bi-national program with El Salvador with the technical assistance from the Guatemalan PAHO country office. And we have put together a strategic plan in Guatemala for Codex Alimentarius. The sound has frozen, says the interpreter. Complete sentences are not coming through, says interpreter, making interpretation impossible. We do try, says the speaker, to identify emerging strains of antimicrobial or microbes that are resistant to antimicrobials. And we do have a regional program with support of PAHO and the Public Health Ministry of Canada has also offered assistance to this effect. Now, given the vulnerabilities that Guatemala faces and our realities, we do fully back this proposed resolution of a One Health approach because it would go a long way toward helping us address the threats that emerge from the interface between animals, humans, and the environment. Thank you.
We thank Guatemala for that intervention. We are going to try to go back toward delegate of Bolivia for their intervention. Bolivia, you have the floor.
Sí, muchas gracias. ¿Se me escucha bien?
Now, thank you very much. Can you hear me better? Yes. Now, water, land, air, and how they interact, and the use of chemical products that are used, the indiscriminate clear cutting of trees, the use of antibiotics indiscriminately in livestock production underscores and lays bare the destruction of Mother Earth, and add to that global warming, which we witness every day with extreme climatic effects and the emergence of zoonotic diseases. All this makes it clear that the concept of health, there has to be a philosophy that looks at health in a comprehensive way, that is animal, human, and the environment health, all of which have to be viewed together. In Bolivia, we do understand that, and therefore we have approached a One Health approach, a comprehensive, holistic approach to health, as we understand human and animal health and that of the ecosystem are intertwined. And we promote the acknowledgement of these different components of Mother Earth as sacred living beings and should be treated as subject, not objects. Now, this is something enshrined in our law of Mother Earth and comprehensive development, which conceives of health as the result of many different organisms, plants, animals that interact with human communities and the rest of nature as a single functional unit under climatic, geographic, geological effects, as well as productive practices and the diversity of life. All of this affects everyone's life. Now, with that understanding and under this approach, Bolivia does deem it necessary and fundamental for us to be rigorous in this One Health approach to address health threats, namely the interface between animals, humans, and the environment. And that this be done in an intersectoral way and not only based on the results or how this plays out in people's health, because when we look at the very rational way that businesses and others behave that ultimately has a deleterious health effect on all of us. And so certainly the pollution of the environment also contributes to climate change. There is poor waste management that further aggravates the situation. And so we do support this approach. And I think that we need to put all of our efforts into it for there to be a multi-sectoral, holistic approach, a cross-disciplinary one to ensure the future of all. We need to address the development of human capacity and to come up with solutions in line with this very important topic. Thank you very much.
We thank Bolivia for the intervention. As we register no additional requests for the floor from member states, we will now entertain requests from non-state actors in official relations with PAHO. We note the request from Drugs for Neglected Diseases Initiative, DNDI. You have the floor.
Thank you, Mr. Moderator. The Drugs for Neglected Diseases Initiative and the Global Antibiotic Research and Development Partnership welcome PAHO's One Health policy framework for infectious diseases, including neglected tropical diseases and antimicrobial resistance. As not-for-profit organizations developing new treatments for vector-borne diseases such as Chagas disease and leishmaniasis, as well as drug-resistant infections with a focus upon sexually transmitted infections, sepsis in newborn babies, and hospital-based infections in children and adults, we note the following. The critical importance of sustained and the adequate funding of partnerships, initiatives, and activities for cross-sectoral surveillance, strengthening access to diagnostics, and ensuring access to existing and new antibiotics and treatments for NTDs. We support measures to strengthen regional and national capacity for prevention, vector control, and reduction of transmission of NTDs. We also support measures to mainstream antimicrobial stewardship programs and neglected tropical diseases in health systems. Finally, as one means to improve access and stewardship, GARD-P, in collaboration with WHO and other international agencies, is developing SECURE, a new initiative which is intended to assist countries to accelerate and expand access to essential antibiotics. We look forward to contribute with governments, civil society, public and private sector to holistically address AMR and neglected tropical diseases through One Health framework. Thank you very much, Mr. Chair.
We thank the NDI for the intervention. And seeing none additional requests for the floor, Mr. President, we come back to you.
Thank you very much. And let me thank delegates for their contribution on this item 4.6, One Health Comprehensive Approach for Addressing Health Threats at the Human-Animal Environment Interface. I think I sense that there is overwhelming support for the report. So this time I will ask Dr. Espinal to respond to comments that have been made.
Muchas gracias, señor presidente.
Thank you very much, Mr. Chairman. Let me begin by thanking each of the member states who have spoken, who have contributed very positive thoughts to this debate, very thoughtful and I'm sure useful. Please be assured that we will be very vigilant to see by which means we can buttress this policy and move forward. We celebrate the fact that a number of countries already have interdisciplinary working methods, such as Argentina, Chile, Cuba, and others who are pushing very much forward. In the ambit of the coordination groups, I want to mention Guyana also, inter alia, because the tripartite +1 combination is a very, very valuable proposition. And by the way, the Secretariat has moved quite along on that particular plank. We have a fairly advanced project on One Health in the context of antimicrobial resistance, including 8 countries in the region, in order to broach this problem. And we have been working on this in the context of various tripartite combinations, including WHO and FAO, including ourselves, of course. And an agreement was signed just recently by the director with UNEP in their standing working party. So the bottom line here is to move the ball forward so that this initiative may become operational. And as the delegate for Guyana put it quite well, we want this to become a reality. Countries want this, and so do we. Now, internally within the Secretariat, we have set up a corporate mechanism for purposes of coordination in order to avoid duplication of efforts, as you might imagine, and with a view to implementing this initiative in as smart a manner as possible, in order to use the money most wisely and to offer corporate quality advice to the countries in the context of such an important initiative as this. And this will be made available to you as it becomes fine-tuned. But let me, Chair, just underscore the fact that we see the absolute need for our countries to push, to promote, to support, use the verb you want, this One Health initiative in every forum. We're going to have in November the World Health Assembly. And so that will be a platform, need I say it, in which the concept of One Health really finds its place, because we want to have a better position to assist us in preparedness for the next pandemic. We want these mechanisms to be up and running, and so I call on everyone to avail yourselves of every opportunity and every forum to speak of this and to support it. I don't wish to take any more of your valuable time, Chair, but it remains for me to say that we are, of course, at the service of the member countries should they wish to contact us with regard to any element regarding the initiative. I thank you.
Okay, thank you very much for that response, Dr. Espinal. At this time, I will ask our director, Dr. Etienne, if she has any comments.
Thank you. Thank you for the opportunity, Mr. President. Let me thank and recognize member states for their firm support for this document. And I pray that in like manner that you will fully support the resolution. Mr. President, for really too long, as a region, we've not paid sufficient attention to the interface between human, animal, and environmental health. We are seeing increased excursions into the forest. We are seeing blurred boundaries with animal and human populations. And globalization does not make that easier. And we have been ignoring the risks, the possible catastrophes that arises out of this. We are seeing the meteoric rise in zoonotics, unsafe foods leading to foodborne outbreaks, but not just that, but also chronic diseases as a result of food-associated contaminants and infectious agents. Antimicrobial resistance, the effects of climate change, and those have been mentioned by member states in their contributions. For here too, we will need this multi-stakeholder, multi-sectoral approaches. We will need the engagement of the non-state actors, particularly the private sector. But Mr. President, I think what we need more than anything else, we need national leadership. We need national leadership, national commitment, and national investments. We need a commitment that goes beyond just the agriculture and the health sector. We need this to be a broad engagement under the direct leadership of the very highest levels of government. And I say we need to go beyond just the national to the regional and to the global levels. It is clear that if we do not act urgently, we will face another pandemic. We will face another pandemic that may well be zoonotic in nature again. And so we have no option but to act now, because we need not only to be able to respond to pandemics and outbreaks and the ill effects of antimicrobial resistance, we need to be able to prevent it, Mr. President. And in this regard, I want to call on our member states to really make a concerted effort so that we can address One Health. Herein lies one of the greatest catastrophes, potential catastrophes of our health systems. Thank you so much.
Thank you very much, Dr. Etienne. Well said. Again, reinforcing the need for a collaborative approach, not just to confronting COVID-19, but also to advance policies for a more resilient health system for generations to come. I will now ask at this point our rapporteur to propose the resolution, to present the resolution, sorry.
Gracias, presidente. Procedo con lo...
I thank you, Mr. President. Let me do just that. I beg your pardon.
Proyecto de resolución.
Proposed resolution, One Health, a comprehensive approach for addressing health threats at the human-animal environment interface. The 59th Directing Council, PP1, having reviewed the policy on One Health, a comprehensive approach for addressing health threats at the human-animal environment interface, document CD 59/9, PP2, bearing in mind that the COVID-19 pandemic has done much to reverse the gains achieved in recent decades on poverty reduction and on health and well-being in the region of the Americas. PP3, recognizing that the health outcomes associated with health threats at the human-animal environment interface, such as zoonotic diseases, antimicrobial resistance, AMR, and food safety issues, depend on policies and programs inside and outside the health sector, and that strategies for the management of risks at the human-animal environment interface need to include other sectors and disciplines to maximize impact and ensure sustainability. PP4, acknowledging that the socioeconomic development of the region of the Americas has been supported by its increasing agricultural production and its role as a global food producer and exporter. Thereby, it is crucial to protect such achievements from the impact of zoonotic diseases, antimicrobial resistance, and food safety problems that not only endanger the health of the population, particularly the most vulnerable, but also hinder the socioeconomic development of communities and industries such as tourism and international trade in animal and animal products. PP5, cognizant that One Health is a collaborative, multidisciplinary, and multi-sectoral approach that can contribute to addressing health threats at the human-animal environment interface, resolves OP1 to approve the policy on One Health, a comprehensive approach for addressing health threats at the human-animal environment interface, document CD 59/9. OP2, to urge member states, taking into account their contexts, needs, vulnerabilities, and priorities, to adopt, adapt, and implement this policy, and to A, establish or strengthen current multidisciplinary, multisectoral, consensus-driven mechanisms for One Health governance, including policies and actions for the stewardship and finance of functional structures working across institutions and enabling coordination, communication, engagement, and collaboration, and for access to relevant knowledge and resources. B, foster multisectoral technical activities, including strategic planning, emergency preparedness and response, rapid and transparent information, data, and sample sharing, in accordance with relevant international agreements, integrated surveillance, laboratory strengthening, and other best practices, with demonstration projects to drive scientific, evidence-based collaborative actions. C, incorporate a risk analysis approach taking into account human behavior and other drivers, particularly those challenges that affect the systems on which society depends: health, agriculture, animal production, and environment. D, promote training and education of the workforce on One Health. Adopt new technologies, including digital solutions and scientific tools, and foster research agendas on the human-animal environment interface. OP3, to request the director to A, apply the One Health approach within the Pan American Sanitary Bureau through interprogrammatic actions, fostering the effective use of the Pan American Health Organization's comprehensive portfolio of knowledge, expertise, and access to stakeholders on health challenges such as food safety, zoonotic diseases, and AMR. B, coordinate, promote, and provide technical cooperation to support countries and territories in implementing One Health in collaboration with relevant human, animal, plant, and environmental health partners and stakeholders, including those from the social determinants field. C, secure political, managerial, administrative, and financial support for the implementation of One Health by advocating and promoting it in collaboration with other international and regional entities from the fields of human, animal, and environmental health, as well as by mobilizing external resources. And finally, D, report to the governing bodies on the progress made and challenges faced in implementation of this policy in 2026 and 2031. That is the draft. Thank you, Chair.
Thank you very much for that proposed resolution. I believe, like the previous resolution, we have substantial agreement on the way forward. However, in keeping with the structure, we would like to invite delegates if they would like to comment on the resolution as proposed, that they use the electronic platform, and would ask our moderator to manage that process.
Thank you very much, Mr. President. We will now proceed to register the request for the floor for this resolution. Mr. President, seeing none, I yield the floor back to you.
Okay, so again, very positive that we are all agreed on the report and the resolution as proposed. I therefore move to adopt the resolution. I want to take the opportunity again to thank those who contributed and those who worked hard to ensure that the report was developed and presented. We now move to item 2.3 on the agenda, report of the working party to study the application of Article 6B of the Constitution of the Pan American Health Organization. I yield the floor now to the delegate of Honduras, who chaired the working group, to present the report.
De nuevo, buenos días, señor presidente, doctora Karina Etienne. Con mucho gusto presentamos el informe del grupo de trabajo para estudiar la aplicación del artículo 6B de la Constitución de la Organización Panamericana de la Salud. El grupo de trabajo establecido para estudiar la aplicación del artículo 6B de la Constitución de la Organización Panamericana de la Salud se reunió los días 20 y 21 de septiembre del 2021 para examinar la situación relativa a la recaudación de las contribuciones señaladas a la luz del establecido en el artículo 6B con respecto a la suspensión de los derechos de voto de cualquier Estado miembro que tenga atrasos que excedan del importe de los pagos anuales de sus cuotas correspondientes a 2 años completos en la fecha de inauguración del Consejo Directivo. Número 2, corresponde al grupo de trabajo recomendar sobre si procede o no restablecer los derechos de voto de los países según dispone el artículo 6B. La conferencia o el consejo directivo podrán permitir que dicho miembro vote si considera que la falta de pago se debe a condición fuera del control del gobierno.
Minister, I am really sorry to interrupt you. Señora ministra, qué pena interrumpirle. Aparentemente hemos perdido la interpretación al inglés. Entonces se nos da un par de minutos para que podamos restablecerlo de forma que usted pueda presentar el informe del grupo de trabajo. Colegas de apoyo
Muy
están
bien, ¿y ahora me
trabajando
escuchan?
en este momento para garantizar que la interpretación del español al inglés sea restablecida.
¿Me escuchan?
La escuchamos. El tema es que tenemos que garantizar.
¿Quieres que lo haga, Rosy? Okay. Can you hear me? 1, 2, 3, testing, English booth. Yes, could you please confirm that you are hearing the English booth? Yes, you can proceed, Madam Minister, please. Please go ahead. Number 2, the working party has been entrusted with recommending whether or not to reinstate the voting privileges of such countries in accordance with the following terms of Article 6B, which reads as follows, and I quote, if the conference or the directing council is satisfied that the failure of the government to pay is due to conditions beyond its control, it may permit the government to vote, end of quote. Number 3, the members of the working party are the delegates of Antigua and Barbuda, Honduras, and Peru. The chair of the working party is the delegate of Honduras. Analysis. Number 4, as of the opening of the 59th Directing Council, one member state, the Bolivarian Republic of Venezuela, was in the situation foreseen in Article 6b, with outstanding assessed contributions due for 2017, 2018, 2019, 2020, and 2021, amounting to a total arrearage of $9,915,755. The Pan American Sanitary Bureau sent a formal communication to the government of Venezuela regarding its situation with respect to Article 6b in May 2021, as well as follow-up communications in July and August, without receiving a response. Number 5, in 2020, Venezuela had its voting rights suspended at the opening of the 58th Directing Council in accordance with Article 6b of the Constitution. At the beginning of that session, Venezuela had outstanding assessed contributions due for 2017, 2018, 2019, and 2020, amounting to a total of $7,854,219 Number 6, consequently, pursuant to application of the provisions of Article 6b and Resolution CD 58 R8 2020, including addenda CD 58/9, add 2, Venezuela's voting rights remain suspended as of the opening of the 59th Directing Council. 7, Venezuela has not made any payment towards its assessed contributions since May 2017, nor presented any correspondence in writing, including a proposed deferred payment plan to the Secretariat regarding payment of assessed contributions due since the 58th Directing Council, which is the most recent meeting of the Directing Council. 8, the Working Party has reviewed the recommendations of the 168th session of the Executive Committee reflected in Resolution CE 168.R1, as well as the last statement of assessed contributions due. 9, the Working Party has analyzed and discussed the delay in the payments from Venezuela. It has emphasized the importance of timely receipt of the assessed contributions for fulfillment of the program budget approved by the member states, and has fully recognized that failure to receive the budgeted amounts at the time they are expected threatens the implementation of planned activities and even the continuity of the organization, making it necessary to impose extraordinary measures for the management of financial resources. It has also affirmed that it is not advisable to make exceptions to the application of Article 6b that may be cited by other member states when they fail to meet their financial commitments. Recommendation of the Working Party. The members expressed a regret, but in light of the lack of a payment or communication with the Secretariat, the Working Party recommends that the Directing Council not reinstate the voting privileges of Venezuela, and that the situation be reviewed again by the member states at future sessions of governing bodies. Last but not least, 11, the Working Party congratulates those member states that have made the effort to meet their quota commitments to the organization during 2021 in the midst of challenges imposed by the COVID-19 pandemic and the resulting economic situation. And it urges those member states with pending contributions to meet their financial commitments without delay. Thank you very much. And this is brought to the attention of the plenary.
Thank you very much for the presentation. Delegate from Honduras, Chair of the Working Group. Are there any comments, any objections, any comments on the report? I see no use of the electronic platform. Okay, there is one, I believe. And I ask therefore our moderator to manage this aspect of the proceedings.
Thank you very much, Mr. President. We will then yield the floor to Bolivia. Bolivia.
Nuevamente, muchas gracias.
Once again, thank you very much.
Thank you. I just wanted to say that the Constitution of Bajo says that for conditions that could give rise to a country facing some external obstacle, that the right to vote could be withdrawn. But I do think that all countries should retain their right to vote. So to this degree, Bolivia thinks that it's necessary for us to consider the difficulties that Venezuela is facing to pay its obligations. And to that effect, we think that Venezuela's vote should be reestablished.
Thank Bolivia for that intervention. And seeing no additional requests for the floor, I yield back, Mr. President.
Thank you very much. We take note and thank Bolivia for the intervention. We will ensure that the contribution is contained in the final report, and we will have to move forward to declare the report approved. At this time, I would like to recommend our break for lunch, but prior to that, I'm going to ask the governing body's office, represented by Ms. Monica Zaccarelli, to make a few announcements.
Thank you, Mr. President. The announcement refers to the side event on technology transfer for the production of mRNA vaccines. The side event will take place in this same virtual room. So you are invited to stay connected and accompany this side event from 1 p.m. to 2 p.m. in this same space. Thank you, Mr. President. This is all.
Okay, so we have made good progress, and I want to take the opportunity again to thank all who have contributed and who have stayed on and listened, and I am sure made notes on these very important discussions and agreements. At this point, we will take the lunch break until 2:30 p.m. And when we get back, we are planning to cover items 5.1, 5.2, 5.3, 2.1, 4.7, and 4.8. It's important to try to cover this ground so that we keep on schedule to address all the matters on the agenda. So do encourage members to report back for a quorum at 2:30, and we will move straight into the items that I have announced. Have a good lunch, and thanks again.
Director General, Regional Director, distinguished delegates. COVID-19 has highlighted the fundamental importance of health to development, to the economy, and to every other aspect of human life. We are in the midst of not just a pandemic, but a syndemic in which the NCD and tobacco pandemics are interacting with COVID-19 with devastating results. Even so, the tobacco industry is attempting to capitalize on the vulnerable situation in which we find ourselves due to the COVID-19 pandemic to sanitize its image through so-called corporate social responsibility activities, while continuing to interfere with the implementation of effective tobacco control measures. I, therefore, urge parties to strengthen their implementation of Article 5.3 of the WHO FCTC to protect public health measures from tobacco industry influence. We must redouble our efforts to implement other tobacco control measures in the Americas as well. I call on WHO FCTC parties to implement Article 13, which addresses tobacco advertising, promotion, and sponsorship in an effort to reduce demand and halt the recruitment of new users. I also urge all parties to the convention to join others across the globe in ratifying the protocol to eliminate illicit trade in tobacco products. To date, 6 countries in your region have become parties to the protocol, but we look to the remaining parties to join our collective effort to strengthen our defenses against illicit tobacco trade. Lastly, I call on senior officials of the parties to participate in the upcoming 9th session of the conference as the party to the WHO FCTC and the 2nd session of the meeting of the parties to the protocol to be held virtually in November, and to get involved in the important preparatory meetings hosted under the leadership of Paraguay. Only by pushing forward together can we build healthier, more resilient populations and a better future for us all. Thank you.
So a very good afternoon to you all. I hope you had some time for a lunch. My name is James Fitzgerald. I'm the Director of the Department of Health Systems and Services at the Pan American Health Organization. And welcome to this side event that we've organized around the 59th PAHO Directing Council on technology transfer for the production of mRNA vaccines in the Americas. We've prepared a short agenda for you today. With some opening remarks from Dr. Etienne, some then interventions from the IDV, WHO, and the Assistant Director, and then some regional comments from some of our ministers before we open it for discussion. So without further ado, I would like to hand over to Dr. Etienne, who will provide us with opening remarks. Dr. Etienne?
Thank you. Thank you, Dr. Fitzgerald. Let me again greet the Ministers of Health and the delegates of the 59th PAHO Directing Council. Good afternoon, Dr. Soumya Swaminathan, your Chief Scientist, WHO. Nice to have you, Mr. Ferdinando Gregalia, Division Chief of Health and Social Protection at the Inter-American Development Bank. A very good afternoon to all of those who are joining us in this session. The region of the Americas continues to lead in global infections of COVID-19, with 7 of the top 20 countries in the world with the highest mortality rates being found in Latin America. Just over 33% of people in Latin America and the Caribbean have completed their COVID-19 vaccinations. And in many countries, coverage is much lower, and in some countries in the single digits. Delays in production have meant that many countries are still awaiting the doses they purchased months ago. Limited vaccine supplies continue to set us back. A handful of companies produce all the world's supply of COVID-19 vaccines, and many of them are letting price and country of origin, not need, determine how and where doses are rolled out. This limited production and unequal distribution of vaccines in the face of staggering demand hinder our COVID response in the Americas. Mass vaccination is critical if we are to stem the tide of this pandemic and mitigate against the spread of further variants. We've heard from the 59th Directing Council that Latin America and the Caribbean are especially vulnerable since we depend almost entirely on manufacturers outside of this region to produce the raw pharmaceutical materials, medicines, and health technologies that our populations need to stay healthy. The regional policy document presented at the Directing Council calls on increased intersectoral action between health, science and technology and industry to develop research and production capacity in the Americas. It urges countries to increase the know-how and infrastructure in biomedical science, engineering and regulatory capacity to address current and future needs. And importantly, it calls on the spirit of Pan-Americanism, the collective and cohesive action amongst countries to build robust capacity and the supply chains within the Americas that will address needs and future pandemic needs. So these actions are particularly relevant for vaccine manufacturing in the Americas. This region has enormous potential and capacity to increase vaccine manufacturing. We see COVID-19 vaccines being developed from basic research in the United States, Cuba, and Brazil. We have seen the proliferation of tech transfer agreements for vaccine manufacturing across multiple platforms between manufacturers and countries, including Argentina, Brazil, and Mexico, including fill and finish agreements in Colombia, Chile, and Peru. And we have witnessed the engagement of smaller economies and island nations in defining national and sub-regional strategies to increase manufacturing capacity and to access vaccines. So it is within this context that PAHO WHO is spearheading an initiative that we believe will significantly contribute to increased production capacity for COVID-19 vaccines, as well as for routine immunizations in the Americas. In April of this year, WHO launched a call for expressions of interest to contribute to the establishment of a tech transfer hub for mRNA vaccines. We, PAHO, actively promoted this initiative in the Americas, knowing the untapped potential that exists in this region. We sought interest from small, middle-sized, public or private manufacturers of medical products to host a COVID-19 mRNA hub and or receive the technology that could be developed into an mRNA vaccine in this region. My dear colleagues, we were very pleasantly surprised with the level of responses and the engagement of countries and manufacturers alike in this call for action. We received more than 30 expressions of interest, with 9 substantive proposals from manufacturers and interested parties from throughout the region, and certainly more in this region than from any other region globally. In June, we convened more than 300 representatives from industry, science and technology, and the health sector to present the initial outcomes of the mRNA expression of interest and to present to interested parties the next steps. And in August, we issued a second expression of interest to call on the private sector to inform us of their capacity and plans to increase manufacturing capacity for pharmaceutical grade reagents and supplies that are required to produce an mRNA vaccine. These focused and targeted interventions will be developed through the PAHO regional platform to advance the manufacturing capacity for medicines, vaccines, and health technologies, a regional platform that we launched at the end of August. I convened this platform to increase the level of collaboration and coordination of all stakeholders around our common objectives and to provide the technical know-how to support the development of specific proposals. And the first and most important project this platform will prioritize is the development of mRNA vaccines in the Americas. This afternoon, we will announce the outcomes of our collective work to date. We will hear of the initiatives that have been selected by PAHO WHO independent technical group that were tasked to evaluate expressions of interest for the development of the mRNA vaccines. We will hear of the proposals and the work that has been done in arduously assessing and reviewing these proposals. And we note in selecting development projects, the commitments being made by manufacturers to support tech transfer and access to mRNA vaccines to the whole region, including through the PAHO Vaccine Revolving Fund mechanism. Our aim to establish a regional consortium across the region, linking the production of the mRNA with the production of multiple reagents and products that are required for the complete production cycle. And that's why we are proposing this regional platform. We propose to stimulate the development of regional supply chains where countries in the Americas can contribute and work together to reduce the critical inputs that are required to produce an mRNA vaccines. So it's an all of region approach where every country would be able to work together to ensure that we work towards self-sufficiency, beginning with the mRNA vaccine. And then, as the resolution that we just passed indicates, we will move to self-sufficiency in the production of health technology, medicines, and other vaccines. Thank you so much to all of our collaborators who have worked with us. Dr. Jamas, AD, and Dr. Swaminathan, the chief scientist, will inform this meeting of those initiatives that have been selected for the development of the mRNA vaccines in the Americas. I'm sure you're waiting with bated breath to hear those selected. In doing so, however, we recognize the important contributions of so many manufacturers throughout the region to this process, and we seek their continued commitment in the process. And in selecting the mRNA initiatives for targeted action, we note that that is only the beginning of a long process where selected manufacturers commit themselves to further technology development and transfer and to supplying the whole region with the product of their endeavors. I want to personally thank all companies, stakeholders, and countries that continue to participate in this process. And I seek their continued engagement through the regional platform. I wish to acknowledge and to thank the World Trade Organization and the IDB for their continued support and for the facilitation of processes that will lead to increased vaccine production capacity. Let me also thank our colleagues and partners at WHO Geneva for their continued input and technical support. It is through collective action, working hand in hand, that we can reduce the vulnerability of this region to pandemics, ensure health security, and support the health, social, and economic development of all of us in all countries. So thank you so very much for being here with us this afternoon.
Thank you very much, Dr. Etienne, for those opening remarks. Dr. Etienne mentioned very clearly the importance of multiple stakeholders involved in this process, not least the importance also of financing for some of these initiatives. And we're very pleased to have with us this morning Ferdinando Vegalia, who is the Division Chief of Social Protection and the Health Division at the IDB. And so, Ferdinando, we'd like to hand over to you for some opening remarks.
Muchas gracias, Dr. Fitzgerald. Voy a hacer mis,
Thank you very much, Dr. Fitzgerald. I will be speaking in Spanish, and a very good afternoon to all of you. It's an honor to be with you on this virtual head table, and thanks indeed for including me on this important session where we are indeed going to be looking at the regional projects to deal with the manufacturing of mRNA material in the region. Under the SARS pandemic that we're suffering under, a great deal of effort has been deployed, but once the perception of the threat diminished, attention was taken off the ball, as it were. And it is very important as we move forward that that not happen. The pandemic has shown the facility within which supply chains, the ease with which these supply chains can be brought, and critical inputs then are missing for the purposes of production. In that regard, the pandemic has shown us how important it is to invest more in terms of producing vaccines, essential medicines, various other inputs, not to mention boosting production capacity in the region in order to face future pandemics. The IDB, through its 2025 strategic plan, has identified different means by which the countries of the region might move toward a more inclusive and sustainable position in this regard. And one way forward is certainly to increase regional integration and to achieve reinvestment. Once companies start taking their eye off farther away areas to look closer to where they can do better, they might invest increasingly in Latin America and the Caribbean. And that's what we believe will happen. We in the IDB, therefore, can only applaud efforts such as those that bring us together this afternoon, because they aim to boost diversification and production, and especially the diversification in the supply chain. That is key. And to that end, of course, greater international cooperation, really pulling together, working in the same direction, so that all these efforts and the benefits therefrom can assist everyone equitably. The IDB has been working very closely at the financing of this. In 2020, we increased the availability of funds and loans and hastened the approval process so that countries could get the money they need more quickly. We have approved more than $102,000 million, 1.2 billion, in other words, to key borrowers, and we have mobilized 2.2 million to deploy the necessary COVID vaccines, and 10 borrowing countries have benefited therefrom. We here in the lending window of IDB stand ready to look at the various projects that may flow from this initiative, as well as any other measure that might be deemed useful to move this technology forward in the region, because that is key. We think that certainly for the IDB, and by the way, any other socioeconomic partners, it is essential that we invest more in research and development and the production of vaccines and other health products of the region. This is everyone's responsibility. We have got to keep our eye on this ball, even though we hope this pandemic will fade away. It hasn't happened yet, and we need to be ready for what's around the corner. So we believe that the public-private alliance is essential. We have our own 2025 vision, and we need also to boost the strength of the public sector such that the manufacturing of biologicals can be easier. And that, of course, will need the input of health regulations. So the public sector has to be there. So in Latin America and the Caribbean, we hope to work very closely with PAHO, because we understand that it's together that we can best meet the needs of our countries. So, esteemed Director, bravo, and count on us. We're right with you.
Many thanks, Ferdinando, for those remarks, really highlighting the importance, I think, of financing for research and development, and also ultimately for the translation of the research and development into processes for the overall development of vaccines, so important, and other health technologies, so important in the region of the Americas. So many thanks, Ferdinando. We are now going to move to the part of the event where we will be announcing the selected regional initiatives for mRNA vaccine development in the Americas. We are really very pleased to have with us WHO Chief Scientist, Soumya Swaminathan. Soumya and her team have been supporting the region in this process, going way back to April with the announcement of the expressions of interest. And so we really do want to thank Soumya for her presence here, and of course all the technical team that she brings with her. Soumya, over to you.
Thank you so much, James, and Very good afternoon to Your Excellencies, Dr. Etienne, Dr. Jarbas. I will be very brief and let Dr. Jarbas give you all the details, but essentially just wanted to remind us about what this initiative is all about. And it is really about sustainable regional health security. Means that every region should have vaccine manufacturing capacity and should have access to technologies that permit the rapid development and production of epidemic and pandemic vaccines. But we have to remember that this also needs to be sustainable. And so in between the epidemics and pandemics, we need to be using this technology to potentially produce other vaccines that are needed. So why mRNA? Clearly, this technology compared to others has proven to be highly successful, at least for COVID vaccines, and is also very highly adaptable. So not just for the variants that this virus may throw at us in the future, but also against other pathogens. And there's already work that started now on using mRNA platform for malaria and TB vaccines, for example. It can also be used to develop, to produce monoclonal antibodies. So it's a very versatile platform, and therefore it has advantages. We initially, within the ACT Accelerator, there was a lot of interest and discussion on establishing manufacturing capacity for vaccines, but also for therapeutics and diagnostics. But within COVAX, along with Gavi and CEPI and UNICEF, we decided to focus on vaccine manufacturing capacity to begin with, specifically COVID vaccines. So the manufacturing task force was launched with 3 objectives. The first one was very addressing some of the upstream issues around things like the shortage of plastic bags, bioreactor bags, glass vials, reagents, raw materials for vaccines. A lot of this was related to export restrictions. And we were working with both the private sector and organizations like the World Trade Organization to sort out some of those problems. CEPI has now created a marketplace where suppliers of raw materials can come together with manufacturers of vaccines. This is now going to be expanded beyond COVID vaccines so that we can solve the global problem of the shortages of these materials, because we know that for all vaccines, things have to move between countries, and there are lots of ingredients that go into vaccines. So this marketplace idea was led by CEPI along with the private sector partners, and it's up and running now. And as I said, it's going to be expanded beyond COVID and will become a part of the day-to-day work. The second work stream was focused around encouraging manufacturers to do voluntary licensing. And the third work stream, which is what WHO is leading along with the medicines patent pool, is to enable manufacturers to acquire technology for manufacturing. And this work actually would not be needed if the current manufacturers, those who have the know-how, would have agreed to share openly with people around the world. But since that did not happen, we have had to move ahead with this concept of an mRNA technology transfer hub. The first hub is being set up in South Africa. The selection for the hub was made from applications that we had received by a group called the PDVAC. The PDVAC is a product development for vaccines advisory committee. It's an independent committee of experts in vaccine development. They reviewed all the proposals and had a set of criteria against which the applications were scored. These included things like the experience of the company in vaccine production, government support and financing, sustainability, access to financing, and so on. And the similar process has been followed for Latin America. Dr. Jarbas will give you more details on the companies and sites that have been selected. What we will offer now is really to support companies which have their own technology, because many companies around the world have their own mRNA technology that they're developing, and we can support by providing access to experts who will assist in comparing their technology with gold standards, experts on scale up, as well as on other elements of the ecosystem like the regulatory upgrading if that is needed, as well as training for the workforce that may be needed to work in these centers. Other centers which do not have already an in-house mRNA technology will be invited to come and receive technology from the mRNA Tech Transfer Hub that's been set up in South Africa. And this will start happening from the beginning of 2022. The hub will provide all of the, they first have to establish the technology, but then will be able to provide not only the complete know-how and the SOPs, but also access to all the material and all the data of the preclinical and clinical validation studies. So we are currently pursuing a number of different options for the South African Technology Transfer Hub. Obviously, if we have BioNTech, Pfizer, or Moderna coming in with their own tried and tested technology, we can move very fast. But in the absence, there are many other mRNAs in different parts of the world that have come to various stages of development, and we can go ahead with the clinical development and down selection of some of those products. Obviously, they all have to meet the benchmarks and the standards of safety and efficacy, and but we're trying to speed up this whole process with all the experience that's been gathered over the last few months. And we're really looking forward, and would like to congratulate PAHO for taking the lead, as well as the region for having come together with such solidarity to discuss this regional initiative, which is really, I think, going to stand us all in good stead in the future. Thank you very much, and over to Jarbas for the details.
Thank you, Soumya. I want again to thank you for the support. It was really a very collaborative work between our team here in Washington and your team in Geneva, and I think that this will be very important to move this initiative forward. Dear Director, Dr. Etienne, colleagues from PAHO, colleagues from the Ministries of Health, I will make my intervention in Spanish to provide a better balance. Com el fin de incrementar las capacidades de producción de vacunas contra la COVID-19 y ampliar su acceso en las
In order to increase the production of vaccines against COVID-19 and to broaden access in the Americas, PAHO and WHO has chosen two proposals to create hubs for development production of vaccines. The selection process took into account all of the expressions of interest that we received throughout the region from the public and private sectors. Now, launching this initiative happened nearly 2 months ago. We had more than 300 people who took part. We received many proposals from many countries of the region. This selection was done by a committee of experts that assessed proposals considering their potential to move forward in development production of vaccines in the midterm in our region. Now, we're pleased to announce that 2 centers were chosen for this initiative, one in Brazil and the other in Argentina. The Institute Bill Moguins, which belongs to the Osvaldo Cruz Center, was chosen given the progress it's made in developing vaccines that are innovative against COVID, mRNA vaccines. And so we hope to make a considerable improvement in the development of this innovative vaccine and to achieve its production in the shortest term possible. PAHO, WHO will make available to Fiocruz a group of international experts who are specialists in the different development and production aspects of this type of vaccine, as well as staying abreast of progress made in the regulatory and productive process. Now, Synergium Biotech company was also chosen to establish the other center, which will be located in Argentina. That company will use work with the associated company for the development of the active ingredient. This group of companies was chosen given their vast experience in the production of vaccines and other biologics, also given their ability to produce complex products and their experience in distribution of said projects regionally and internationally. in highly competitive countries. Furthermore, Synergium has shown its commitment with the supply of products through the PAHO purchase or procurement system. Its experience and technological experience will also enjoy the technical support of PAHO, as well as the community of experts that support this project. And there will be the successful transfer of technology of mRNA in this development process. For these two centers to be established, this will be done in two phases to kick off a regional cooperation effort, working with the technological transfer center in South Africa, as well as other regional productive centers to increase the productive capacity and to benefit the entire region. We are betting on these two centers making a proactive contribution to the technology transfer and technology in the region to broaden regional productive capacities and to strengthen regional value chains to increase access as well as the technological independence of the Americas for vaccines and to cope with emergencies. The scientific community, international community, along with the PAHO WHO, will also offer its support as they have been in regional emerging countries, and also key partners such as MedFiends will also offer support on intellectual property licensing matters, which might be necessary for us to achieve this common goal. Now, to reach this goal of local or regional production, we have to have access to inputs in the value chain. That's why recently a second call was made for expressions of interest for producers in the region that want to join efforts to produce inputs and supplies for these critical products. The region will thereby have a more self-sufficient value chain that would benefit the whole region. This call will be open until October 15th, and we make a call upon all of the producers in the region to join. I would like to stress that this initiative will enable the region to have access to cutting-edge technology for the production of other critical vaccines for the healthcare systems of the countries of our region. Once we have that vaccine, the two centers will request of WHO to assess it to achieve pre-qualification and to follow international recommendations to ensure the quality, safety, and efficacy. Furthermore, to ensure fair access, the vaccine will be offered to member states and territories through the PAHO Revolving Fund, which provides affordable vaccines, has been providing affordable vaccines for over 40 years. The two centers that have been selected have their work cut out for them. But I'm certain that the reward for that effort will be for there to be timely and fair access to vaccines for our region, which continues to be the hardest hit by this pandemic. PAHO WHO will redouble its efforts so that through our technical wherewithal, revolving fund, and capacity of coordination with countries, partners, and main actors throughout the region, can ensure timely and fair access to vaccines. Thank you.
Thanks very much, Jarvis. So there you have it, two sites selected, one in Brazil, one in Argentina. Thanks also, Soumya, for explaining the process by which all of this was done with the support, with your support and the support of the team in Geneva. So this morning at the Directing Council, we really heard about the importance of having an enabling environment, having the conditions, the policies in place that really supports the development of these important initiatives. It is for this reason we've also invited the Ministers of Health of Argentina and Brazil to provide some comments based on this announcement to really highlight the work that has been done at the national level to support the development of the industrial base and science and technology within their countries. So I'm very pleased to invite Dr. Carla Vizzotti, the Minister of Health of Argentina, to provide some remarks at this side event. Dr. Vizzotti. Dr. Vizzotti, do you hear us? Do you wish to make your remarks? Dr. Vizzotti, did you hear us? Do you wish to make your remarks right now? Okay, we seem to be having some technical difficulties in Argentina, so we will come back to Argentina. In the meantime, we are also very pleased to have the Minister of Health of Brazil, Dr. Marcelo Queiroga, who is with us, we believe connected from the UN General Assembly, to join us this afternoon for some remarks. Dr. Marcelo?
Senhora diretora da OPAS,
Madam Director of PAHO, Dr. Carissa Etienne, Chief Scientist of the World Health Organization, Soumya Swaminathan, Assistant Director of PAHO, Jarbas Barbosa, ladies and gentlemen, I'm pleased to have heard this announcement, and also because Brazil was chosen by the World Health Organization to host one of the centers for technology transfer as relates to vaccine production, and in addition to those that are based on mRNA. Brazil shares the goal of the World Health Organization, and PAHO shares in the understanding about the need to broaden access to new technologies and to expand productive capacity in medicines and other health products. That's why the Brazilian government particularly champions technology transfer to developing countries, especially in the Latin American Caribbean region. So the government of President Jair Bolsonaro, working with the Ministry of Foreign Relations and Ministry of Health, has shown interest in hosting one of these centers for technology transfer for vaccine production, especially those based on the new technology of mRNA. The fact that Brazil was chosen to be one of the centers for technology transfer is the result of the long-standing capacity as shown by Brazil in biologic productions. And Bill Manguinhos of the Oswaldo Cruz organization has been producing biopharmaceuticals and diagnostic products, as well as vaccines, of which it's the largest producer in Latin America. And so it was pre-qualified by WHO for this purpose, and continues to work in favor of public health in Brazil and the world through exporting vaccines for yellow fever to 70 countries, which is a partnership with the World Health Organization and PAHO, as well as UNICEF. I should point out the successful relationship between the Oswaldo Cruz Foundation and the University of Oxford and AstraZeneca. 6 million doses over the last 6 months against COVID-19 were produced in our installations, our facilities of Biomanguinhos. Ladies and gentlemen, thanks to the diversified strategy to access for COVID-19 vaccines, Brazil has gone from being an importer to a producer of vaccines. Now, the fact that Brazil has been chosen as a regional hub for vaccine production for Latin America and the Caribbean means that we can draw from our productive capacity of our industrial complex, safe labs, to ensure access of these products to Brazil as well as other partners throughout the region. With this innovative initiative, we will be taking one more important step in the long track record of active innovation in health products and toward the universal access to health as well as medicines and other health products to ensure that we have a resilient and inclusive healthcare system. We understand that for that, there has to be timely investments made in diagnostics, treatments, vaccines. We will continue to be engaged with international organizations, partner countries, pharmaceutical companies to facilitate technology transfer that's necessary to expand the production of said products in this effort, this joint or combined effort for us to save lives. Brazil is more than capable and willing to contribute to building a better prepared world, prepared for future health emergencies. Thank you very much.
Thank you very much, Minister, and thank you for those words on behalf of Brazil. And once again, congratulations to Brazil and to Fiocruz and Biomanguinhos for the selection of their initiative. I'd like to see now if we have Dr. Carla Vizzotti, Minister for Health Argentina, connected. Dr. Vizzotti, over to you.
¿Me pueden escuchar?
Can you hear me now?
Yes, please go ahead. Yep.
Bien.
Unfortunately, Minister, we are not hearing. There seems to be a poor connection. Perhaps what we can do is we can see if we can improve the connection. In the meantime, perhaps I'd like to ask Dr. Barbosa, as the head of the overall technical departments within PAHO, Dr. Barbosa, how do you see the relevance of this initiative for the region as a whole within the context of the pandemic? And normally, how long does it take to ultimately produce a vaccine, noting that we are very much in the initial stages?
Thank you, James. I think that it's very important to have this side event exactly in the same day that our member states approved their resolution to increase the regional capacity. The pandemic highlighted the vulnerability of the Latin America and the Caribbean since the beginning, when the countries were struggling to purchase the gloves and protective personal equipment, ventilators, PCR tests, now vaccines. So it's very important to take this opportunity and to build on the capacities that we already have in the region to establish this kind of collaboration. So this is not to benefit one or other country, We know that it's impossible that each country isolated can produce all the vaccines and medicines and equipments that they need, but we can, working together, to benefit all the countries in the region if the products are available through the PAHO's revolving fund or PAHO strategic fund for medicines. So I think that it's very important. This is not a short-term response, but this is a strategic investment in the region. And I do believe that coming together in a solidarity, with the solidarity that is a very important characteristic of this region, we can achieve this production and to build on this very important first step to have other initiatives to come together, regional production to benefit all countries in Latin America and the Caribbean. Over.
So thanks very much, Jarvis. I think in the meantime, I think we have reestablished a connection with Dr. Rizzotti in Argentina. Minister, can you hear us? And if so, over to you.
Muchas gracias. Ustedes me pueden escuchar ahora.
Thank you. Can you hear me now?
Perdón por los
I apologize for that glitch. I would just like to thank you and to greet Dr. Tien. Now, I'm with the PAHO country office here, gathered with me in this room in Argentina. I just greet colleagues from the WHO, PAHO, the Minister of Health of Brazil, with whom we met in Rome in a bilateral meeting before our countries being chosen as centers, and we spoke about how important this initiative is, the fact that we are bringing together public and private sectors, international organizations, so that we can generate policies and development, not just to assist Latin America, but to ensure other regions of the world don't have to wait any longer for vaccines. We celebrate this initiative for the production of vaccines, especially making use of this technology, mRNA. This is a true stride forward for our region, and it certainly will make access to vaccines more equitable throughout the region. So it is an honor for Argentina to have been chosen, that our pharmaceutical industry has been chosen. It's a big source of pride for us, for Latin American scientific associations, and in this selection process, in which the WHO chose us in Brazil. I commend Brazil as well for us to, we do have a strong pharmaceutical industry with 190 production centers in many of our capitals, with 40 publicly owned pharmaceutical product factories, and for research and development and production to happen within the public sphere for medicines in Argentina. In April, we hosted a meeting in which we spoke of the importance of pulling together to ensure fair access and to ensure the national production of vaccines. Our experience with transfer technology, with vaccines against pneumococcal disease and others. We have the production in our country, working with another company with AstraZeneca. And this means that we can forge ahead in production in the public sphere of medicines, and we have our Ministry of Development and Production, that will also have a hand in this, and with this will have a positive impact in science technology within the public sector and the public health sector. Now, the region of the Americas has been hardest hit by COVID and has not had equitable access to vaccines. 70% of vaccines that have been produced were administered in a small group of countries. And some countries have had a very low vaccine coverage rate. So it's great that we will be able to contribute to more equitable access to vaccines. It is very important that PAHO be leading this process. It's a necessary step to ensure the right to health by everyone. Argentina is capable of stepping up its production and regional production to close the vaccine access gap and that of other pharmaceutical products. This is a great opportunity for us to move forward in this way and to have the technical support of WHO and PAHO and the community of experts. Our local capacity will be able to break from this cycle of dependence. So we commend this initiative and are happy to play an active role so we can continue growing with this and with other vaccines and other plants.
We do have a few minutes for some comments or questions from the floor. So I'd like to invite perhaps some interventions from the delegates of the Directing Council, the honorable ministers, the delegations, if there are any. If you would like to raise your hand and make a comment, we do have 1 or 2 minutes, I think, before we move to closing, noting that we do have to also prepare for the afternoon session of the Directing Council. So do we have any comments or questions from the delegates? Okay. So with that, thank you very much. I think we've received an awful lot of information, some very good news. There's probably a lot to digest, and we'll continue sharing that information with you through the regional platform. But I really wanted to thank everybody as moderator for their participation in the event, and hand over now to our director, Dr. Etienne, to close this for us. So over to you, Dr. Etienne. Many thanks.
Thank you, James. So let me say how really truly pleased I am with what we've heard and seen today. Let me assure the other member states who probably have not heard their countries' names listed. Let me say that this is not the end. This is the beginning. We have already done another call for proposals, because to build self-sufficiency, we need a broader number of countries engaged in inputs, etc. So this is not the end of the road. We have other opportunities, and we hope that many of you will benefit and contribute to this initiative. So let me tell you a little story. When I began my second term in office as the director of this organization, like everybody else, I prepared a manifesto outlining my positions in terms of the priority issues in health and development. And one of those was to increase the manufacturing capacity in the Americas for essential medicines and vaccines that are required for our priority health programs. So, you know, as I listened this afternoon and I heard the richness and the depth of the discussion and witnessed what is the outcomes of this first step in the process, the selection of projects for the development of RNA vaccines in the Americas, I cannot help but feel, okay, we are truly on the right path to increasing manufacturing capacity. And we will not stop here. We need to broaden this. I may not be the director that sees you reach full self-sufficiency, but I'm happy I started the ball rolling. I'm sorry we had to wait until until the pandemic hit us to really realize that this is an urgent need. But what is very clear to me is that we are embarking on a critical and a strategic initiative that will impact millions of lives in our region. And as we begin this work, because I mean, let's be very clear, this is only the beginning, as I said. I want to urge all of us to remain committed to this collective and other collective objectives in supporting these and similar projects and initiatives that will improve the health and well-being of all people. And one of them is the many initiatives that will come around the resolution that we just passed towards self-sufficiency in health technology, medicines, and vaccines. So let me say that I remain committed as the director of the organization to support the development and coordination of this and related projects in health, as you, the member states, have requested. I also remain committed to work with all of our partners to see these projects developed through the regional platform. And let me say also that I'm really grateful for the directorship of the assistant director, and also the leadership of the director of the department, James Fitzgerald, and his team, who have worked really assiduously on this initiative. As we go forward, we will identify the necessary technical support that is required to further further product development, and noting the scientific and technical complexities of the task ahead. We will continue to work with member states in strengthening and enabling conditions, including with our national regulatory authorities. So let me add my congratulations to those projects selected as the first of many that we hope to develop through the regional platform. I want to remind you of your commitment, and it is based on this commitment that you are one of the criteria that you were selecting. You are not in this for you, you are in this for the region. And so I sincerely thank all our partners in this endeavor, the private and public pharmaceutical sectors throughout the region, our science and technology base, academia, our international financing institutions, and other key UN organizations such as WTO. Let me say a special thank you to WHO for this initiative and the support that we've had through them. I want especially to thank all of our ministers of health and the representatives of the health sector for your continued leadership and advocacy on this issue. It is your stewardship at the national level and the collaboration across the region that will contribute to increasing the production capacity for products that increase our health security and address our priority health needs. Addressing them in pandemic times, but importantly beyond. And I can't help but stress this region must arrive at self-sufficiency in production of health technology, medicines, and vaccines, essential medicines and vaccines. So these are our initial few baby steps, but I have every hope that we will get there. So thank you again, everybody, and thanks for attending this, this short ceremony.
Thank you very much, Dr. Etienne. So we will close now. Thank you.
Thank you very much, and good afternoon to delegates. This is the 59th Directing Council, 73rd session of the Regional Committee of the WHO for the Americas. And we are back day 2 after lunch, and I hope you all had a pleasant lunch and break. We had the break while discussing item 5.1, which is report on the collection of assessed contributions. And we were in the middle of delegates making their contributions to the report. We were starting, sorry, okay. Yes, we're actually starting the item 5.1. That's absolutely correct. So I would like to bring documents CD 5912 and addendum 1 to the attention of the council and invite the representative of the executive committee to report on the item.
Muchas gracias, señor presidente.
Thank you very much, President. The Executive Committee was informed that as of June of this year, one member state was in arrears to the extent that it was subject to Article 6.b. Once again, that it was subject to Article 6.b of the PAHO Constitution. As of the 21st of June, 10 member states, participating states, and associate members had paid their 2021 contributions in full. 7 had made partial payments, and 25 member states had made no payments for 2021. As of 21 June 2021, $12 million of the $105.3 million due on the 1st of January had been collected. A total of $139.3 million remained outstanding for 2021 and prior years at that time. The committee was informed that the organization continued to face severe financial difficulties due to significant delays in the receipt of assessed contributions. In order to meet its commitments and carry out its essential technical cooperation activities, the Bureau had already utilized $26.5 million of the $28.7 million available in the Working Capital Fund. In the committee's discussion, concern was voiced about the high level of unpaid assessed contributions, especially at a time when PAHO is playing a critical role in addressing the COVID-19 pandemic. While the economic and social effects of the pandemic were acknowledged, the importance of paying assessed contributions on a timely basis was underscored. The committee adopted Resolution CE168.R1, thanking member states that had made payments for 2021 and strongly urging other member states to pay their outstanding contributions as soon as possible. Thank you, Mr. President. This concludes my report on this item.
Thank you very much. I yield the floor to Mr. Puente Chaudet, Director of the Department of Financial Resource Management of the Pan American Center Bureau, to present an update on the report.
Muchas gracias, señor presidente.
Thank you very much, President. President, Madam Director, distinguished members of the Directing Council, good afternoon. It is my pleasure to present to you the report on the status of collection of assessed contributions. Next slide, please. As you all know, information on assessed contributions is publicly available, and the most recent status is always available on our website. I make this comment because there are times when some of you make or ask questions on where some of the payments stand. To view this information, you can simply go to our main homepage, our public-facing homepage, paho.org. At the top on the right, you can see About, which is what you see here on this slide with the circle number 1, and then on the left, you see access to the latest payment statement. And this is what you see as number 2. That allows you to download a PDF that has the latest report on contributions, as you can see here, circle number 3. Next slide, please. It is important to note here that over the last 10 years, there has been increasingly payments from countries in paying their assessed contributions, as you can see on this slide. As you all know, our Constitution sets forth that contributions are to be fully paid during the year. As you can see on this graph, the amount for assessed contributions are constant. There has been no fluctuation in 10 years. Contributions from member countries are the same today as they were 10 years ago, and these small fluctuations you can see in the darker red line essentially includes the tax equalization fund, which can lead to these fluctuations, but assessed contributions remain unchanged. This is what you see in red. As you can see in the blue line, we have gone from 24 million in outstanding contributions as of December 2011 to close to 43 million outstanding contributions in 2015-2018 on average, and about 85 million outstanding contributions, as you can see here, in December 2019 and 2020, and 86.5 million for 2021 September. This means that right now we have a significant amount that is still outstanding, that is 82% of contributions for 2021. And this is just 3 months shy of the end of the fiscal year and of this budget cycle. Freezing of assessed contributions over a decade goes alongside the increasing outstanding payments, which seriously undermine our work. Next slide. As I was just mentioning, the report on assessed contributions that are still outstanding stand at $86.5 million. Over the first 9 months this year, we have collected $103.3 million, but of this amount, only $35.7 million are for this current fiscal year. As you can see here, of the $86.5 million outstanding, $69.7 million are for 2021 quotas and 16.6 are for previous year quotas. On this graph on the left, you can see what has been collected over the last few years and whether that has been for quotas of the ongoing year or previous year. So we can see that most of the amounts received this year are for quotas from previous years. Concretely, 67.7 have been received for previous years and 35.7 for quotas for this year. On the right, you can see where outstanding payments stand at the end of each year. And this is from 2018 until now. And we can see the significant outstanding amounts for the last 3 years. We can see the decline we've seen since 2019 in collection and how we continue to be dragging given the significant arrears. Next slide, please. 3 member countries account for 81% of the total outstanding amount. Only 15 member countries, participating states, or associate members have paid their full contributions for 2021. 8 have made partial payments, and 19 have yet to make a single payment for their 2021 contributions. I would like to thank the member states that have made their contributions in due time to support PAHO and support efforts to improve the health in the Americas in these critical times and very challenging times. I would like to give a special thanks to Antigua and Barbuda, the Bahamas, Barbados, Bolivia, Canada, Cuba, the Dominican Republic, Ecuador, Grenada, Guatemala, Honduras, Jamaica, Nicaragua, and St. Kitts and Nevis for having fully paid their contributions for 2021. I wish to also thank member states who have supported through partial payments of their contributions for this year, those who have outstanding contributions and who have just informed us on the payments they are going to be making. In this regard, I would like to say that even though we're only 3 months away from the end of the year for this budget cycle, it is very important to receive all of the outstanding contributions, as is receiving information on when these payments are going to be made over the coming months, seeing as this helps us address financial uncertainty. I wish to also let you know that just as we took up in the meeting this morning, there is a member state that has significant arrears and is now subject to Article 6B of the Constitution. Given the arrears in contributions, there is more uncertainty around programming and releasing flexible funding, and makes it more difficult to deliver on the work plan that was adopted by member countries and forces us to use funds from the Working Capital Fund. As of August 31st, PAHO had used up 7.6 million of the $28.7 million available in the Working Capital Fund. This was a necessary step in order to meet the obligations of the organization and to not have to disrupt technical cooperation activities. Next. In closing, I would like to respectfully invite countries who have yet to make their contributions to do so at their earliest convenience so that we can keep the gears turning and the work being done. Thank you very much, Mr. President.
Thank you very much for that report. I would now open the floor to the plenary for discussion to invite delegates to make a contribution. Please signal through the electronic platform, and I ask the moderator to take responsibility for this segment.
Thank you very much, Mr. President. We will now take note of the requests for the floor for this agenda item. We note the request from Honduras, followed by Canada.
Good afternoon. The interpreter points out the sound is very muffled. We will try to do our best. It is a pleasure to be at this assembly of the Directing Council of this organization. Honduras agrees with this report. The interpreter points out once again the sound is very unclear, makes it difficult to capture the specific information being shared. Interpretation shall resume when the sound quality allows it.
Las contribuciones señaladas de los miembros constituyen una parte significativa de los recursos que apoyan al presupuesto por programa de la Organización Panamericana de la Salud en el periodo 2020-2021. El retraso de esa contribución, tanto de las contribuciones pendientes acumuladas de años anteriores, como de las contribuciones actuales correspondientes a este año.
Once again, the interpreter points out that given the muffled sound, which is perhaps exacerbated by the mask, it is very difficult to make out the message. Interpretation shall resume once the audio quality allows it.
Estados participantes y miembros asociados que ya han efectuado sus pagos en el año 2021 e instarlos a que continúen cumpliendo sus contribuciones en tiempo y forma. Solicitar a la oficina que siga dando seguimiento al estado de la recaudación de las contribuciones señaladas y midiendo el impacto que tiene el atraso en la recaudación en la salud financiera de la organización e informe al Comité Ejecutivo acerca del cumplimiento por parte de los Estados miembros de sus compromisos financieros con la organización. Instar enérgicamente a todos los miembros que tengan saldos pendientes a que cumplan cuanto antes.
Delegada de Honduras.
I'm sorry, to the delegate of Honduras. I'm sorry to interrupt. I'm wondering if you can begin your statement once again so that your message can be fully understood by all delegates and also allow for the interpretation. And so we would ask once again, if you could please begin your statement once again, more slowly, so that we can better understand the message. Once again, the interpreter points out that the sound is still muffled. Perhaps removing the mask can help. We will do our best. Once again, we support this report. It talks about how important it is for member countries, participating countries, and associate members to make their contributions at the start of the year to ensure financial stability. Seeing as assessed contributions are a significant part of the resources for PAHO programs in 2020 and 2021, delays in collections, as we have seen in both the current outstanding payments and from previous years, there's been a significant impact on the organization's ability to do its work. For this reason, we thank participating states, member countries, and associate members who have already paid in 2021 to hail this and also encourage everyone else to make their payments. There needs to be continued measuring of the impact of these arrears on the organization's work, and to get reports on how these gaps affect the organization's work. For all members who have outstanding payments, they should be encouraged to pay their contributions in order to more efficiently use the funds in the 2020-2021 budget. We're happy to state that Honduras met its payment commitment. We do encourage the Directing Council to look at the information being presented in the document just referred to and to consider adopting the resolution. Thank you, Mr. President.
We thank Honduras for the intervention. We will now yield the floor to Canada, followed by Mexico.
Thank you, Mr. President. Canada would like to thank the Secretariat for this report and to express our gratitude for PAHO's ongoing support to member states during these challenging times. It is concerning to note that more than halfway through 2021, PAHO has received less than 20% of this year's assessments. As the Americas continue to grapple with this pandemic, it is unfortunate that a lack of or late payments of assessed contributions by member states stand to jeopardize the critical technical support and guidance that PAHO is providing the region. As such, we continue to urge all member states to pay their outstanding dues in full and without further delay to ensure PAHO's ability to continue delivering its vital assistance to the region during this unparalleled health crisis. Thank you very much.
We thank Canada for the intervention, and we yield the floor to Mexico.
Thank you very much, and good afternoon, President, delegates. Our delegation takes note of the report from the Director of the Sanitary Bureau on the current status of assessed contribution collection from member states, participating states, and associate members. This pandemic has had socioeconomic consequences on the region, which is why right now it is difficult to meet those contribution commitments. It has also highlighted the important role PAHO plays in helping with the health response in the region. This is why it is of the utmost importance to ensure that the organization can actually implement its agenda and carry out its fundamental duty, which is to provide technical cooperation in member countries. On this, Mexico reiterates its commitment to meet its obligations to the organization in line with the guidelines in our policies and rules of procedure, and as our documents call for. Thank you very much.
Thank Mexico for the intervention. And seeing none additional requests for the floor, Mr. President, we turn back to you.
Thank you for those interventions. I would like to ask Mr. Shode to respond to the comments that have been made.
Muchas gracias, señor presidente. Deseo
Thank you very
agradecer
much, Mr. President. I thank Honduras, Canada, and Mexico for those statements, which have highlighted how important the organization's work is, and how important it is to also make timely payments of assessed contributions, particularly at a time like this. I would like to thank Honduras and Canada, as well as the rest of other countries who have already made all of their contributions for 2021. We also thank Mexico for the partial payments made in order to once again meet all of its obligations. We thank you all. And I would like to also mention what was said about a follow-up and monitoring of compliance with these contributions from member states. I'd like to say that for 2 months now, we have had a mechanism in place that basically automates communication with member states, providing information on the latest status of payments. And we believe that in addition to this information being available online for countries who are still in arrears, they are going to get automated messages reminding them of what the status of their payments are. Thank you very much. Thank you, Mr. President.
Your intervention and your report, and for delegates who have also spoken. I would like to invite Madam Director, Dr. Etienne, if you have a contribution to make on this.
No, thank you, Mr. President. I want to thank all the member states who made good on the assessed contributions for this year and paid up, those who've also paid up for previous years. I do know that member states are going through difficult fiscal situations and because of COVID-19. But what I can tell you that one of the biggest headaches and reasons for staying up late at nights for any director or head of an organization like this is not having money, the funds to ensure the necessary technical cooperation that our countries need and demand. We need predictability, and if from the 1st of January every year, the accounts are registering your full payment of your assessed contributions. And when the cash does not follow it, then it makes life very, very difficult. So I want to appeal to those who are late in payment. Please, you can make a payment plan, but consider that this organization needs the financial support to continue to provide very high levels of technical cooperation. The Secretariat works to mobilize resources as well, but voluntary contributions are highly earmarked very often and do not provide the flexibility to deliver on your strategic plan and on the biennial work plan, which has priorities that are not necessarily funded by voluntary contributions. So assessed contributions are one of the important sources of predictable funding and flexible funding that we can use to provide technical cooperation around the priorities that you have set. So I thank you again for your consideration, and I look forward to better financial health for the organization. Over, thanks.
Thank you very much, Madam Director. I will move now quickly into our the proposed resolution, and I ask our rapporteur to propose the resolution? Thank you.
Gracias, presidente.
Thank you,
Procedo
Mr. President.
a la lectura del proyecto.
I will now read the proposed resolution.
Recaudación de las contribuciones señaladas.
Collection of assessed contributions, the 59th Directing Council. PP1, having considered the report on the collection of assessed contributions, documents CD 59/12 and add 1, and the concern expressed by the 168th session of the Executive Committee with respect to the status of the collection of assessed contributions, PP2, noting that the Bolivarian Republic of Venezuela is in arrears in the payment of its assessed contributions, such that it is subject to Article 6.b of the Constitution of the Pan American Health Organization. PP3, noting that as of September 20th, 2021, 19 member states, participating states, and associate members have not made any payments towards their 2021 assessed contributions. PP4, noting that as of 20 September 2021, only 34% of current year's assessed contributions have been received, forcing the organization to utilize the working capital fund and other unrestricted resources. Resolves. OP1, to take note of the report of on the collection of assessed contributions, document CD 5912 and add 1. OP2, to express appreciation to those member states, participating states, and associate members that have already made payments in 2021. OP3, to strongly urge all members with outstanding balances to meet their financial obligations to the organization in an expeditious manner in order to efficiently implement the program budget for 2020-2021. OP4, to request the President of the Directing Council to notify the delegation of the Bolivarian Republic of Venezuela that its voting rights continue to be suspended as of this 59th session of the Directing Council. OP5, to request the Director to, A, continue to monitor the status of assessed contributions and the impact of delays on financial health of the organization. B, advise the Executive Committee of member states' compliance with their financial commitments to the organization. C, report to the 30th Pan American Sanitary Conference on the status of collection of assessed contributions for 2022 and prior years. This is the read of the proposed resolution. Thank you, Mr. President.
Thank you very much for that. The floor is open for any comments on the resolution proposed. And I would ask the moderator to conduct that proceeding.
Thank you very much, Mr. President. We will proceed to take note of the request for the floor to discuss the resolution proposed. Mr. President, seeing none, go back to you.
Okay, so if there are no objections to the proposed resolution, I declare the resolution adopted. Thank you very much for that. Okay, we now move on to item 5.2, financial report of the director and report of the external auditor for 2020. I would like to bring to your attention official document 362 to the attention of the council and invite representative of the executive committee to report on the said item.
Gracias, señor presidente.
Thank you, Mr. President. The Executive Committee discussed the financial report of the director after hearing presentations by the Pan American Sanitary Bureau and the external auditor. The committee was informed that total revenue in 2020 amounted to $1.34 billion. That amount includes extraordinary voluntary contributions for emergencies and revenue received for procurement of vaccines and COVID-19 supplies on behalf of member states. Expenditures for 2020 totaled 1.4 billion, almost 1.4 billion, with procurement accounting for the largest share of this amount. Although collection of assessed contributions had improved in 2020 compared to 2019, the amount collected still amounted to 40% of the amount committed. Delays in the receipt of assessed contributions compelled the Bureau to implement extreme measures to reduce spending. It was also obliged to use the entirety of the working capital fund and to borrow from other unrestricted funds. The National Audit Office of the United Kingdom, the external auditor of PAHO, issued an unqualified opinion on the organization's financial statements for 2020, meaning that the auditor concluded that the financial statements accurately reflected the organization's financial position. The external auditor noted that obtaining an unqualified audit opinion in the context of the events of 2020 represents a significant achievement by all concerned. The external audit nevertheless identified some areas for improvement with regard to internal control and financial management and governance. The external auditor made a number of recommendations related to those matters and others, including several related specifically to lessons learned from the COVID-19 pandemic. The Executive Committee welcomed the unqualified report, the unqualified audit opinion and the positive comments of the external auditor regarding the Bureau's internal control environment. The progress made in implementing prior recommendations of the external auditor was commended. Support was expressed for the new recommendations put forward by the external auditor in its report for 2020, particularly those relating to strengthening risk management and reducing costs. On the latter point, the Bureau was asked whether virtual meetings and training, remote working, and outsourcing of some functions were measures being considered for implementation beyond the pandemic. Support was also expressed for the recommendations concerning the organization's management of procurement funds. It was suggested that those recommendations should serve as a basis for developing a roadmap in collaboration with member states to improve the performance of the funds and ensure transparency and accountability. Concern was voiced about the increase in employee benefit liabilities, which was seen as a financial risk for the organization. The Bureau was asked to indicate if it had assessed whether the current approach to funding these liabilities was the best one. The Bureau confirmed that it plans to continue some of the new ways of working adopted during the pandemic, including by implementing a standard procedure for determining whether in-person meetings are necessary and continuing to outsource certain functions. Regarding the organization's procurement funds, it was explained that as those funds are technical cooperation mechanisms, their use is guided by strategies that are fully aligned with the organization's technical mandates. Lastly, it was highlighted that the Bureau has taken steps in recent years to contain staff medical expenses and increase assets to cover the after-service staff health insurance liability, resulting in an increase of $10 million in the assets available for that purpose. Thank you, Mr. President. This concludes my report, sir.
Thank you very much for that report. At this point, we will open the floor, the plenary, for discussion and invite delegates who so desire to raise their hand on the electronic platform and our moderator to manage these proceedings.
Thank you very much, Mr. President. We will register the request for the floor on this agenda item. And we see the request from Canada.
Thank you, Mr. President. Canada would like to thank the director. Yes, please. Sorry. Thank you, Mr. President. Canada would like to thank the director and the external auditor for their respective reports. We are pleased to note PAHO's attainment of an unqualified audit opinion, particularly in light of the unique challenges presented in 2020. However, we remain concerned by the increase in post-employment benefit liabilities and potential financial risk this could pose for PAHO in the long term. While this liability is not due now, exponential increases could result in challenges to cover the growing funding gap. We urge the Secretariat to consider the external auditor's recommendation of regularly consulting with member states on risks and benefits of continued participation in the current arrangement. Furthermore, while we are pleased to note the positive changes the organization has made in risk management, we believe there remains room for improvement. By further promoting a greater culture of effective risk management, conducting more regular reviews of operational risks at the local level, and including risk tools as part of local management processes and decision-making. Canada strongly believes that it is incumbent on us to ensure the highest standards prevail for both a safe and supportive working environment for PAHO staff, as well as communities they serve, which includes protecting against sexual exploitation and abuse and sexual harassment and abuse of authority. The WHO Executive Board adopted a very strong decision in this regard, and we trust this decision is being implemented across all levels of the WHO, including in-country and regional policies. Canada continues to monitor implementation of this decision closely, and we would welcome PAHO's dedicated member state briefing later in the fall in this regard. We would also be particularly interested to learn about the recently developed PAHO policy and steps to implement it, including specific milestones and ways the implementation is measured and monitored. Finally, Canada encourages the Secretariat to continue implementing those recommendations from the external auditor that remain in progress or are not yet implemented to completion in an effort to further strengthen the organization. Thank you.
We thank Canada for the intervention. We yield the floor to Mexico, followed by the United States.
Muchas gracias, señor presidente.
Thank you very much, Mr. President. The Mexican delegation welcomes the submission of this financial report of the director and the report of the external auditor for 2020. And we greatly appreciate the work done by the Secretariat in order to issue this document in an unqualified audit opinion in the conditions imposed by the COVID-19 pandemic. Likewise, Mexico expresses its gratitude for the work of the external auditor in analyzing the financial reports and the recommendations offered, which had value for efficient and effective governance of the organization. In this regard, we reiterate our support for the comments made by the external auditor. In particular, as has already been presented by the President of the Executive Committee, it seems to us that it is important to stress two recommendations. The first one has to do with the need for developing a strategy to reduce cost and manage risks. We agree with the external auditor on the need for a cost reduction program with a clear strategic vision, full understanding of cost and innovative forms for the provision of services in a different way, maintaining at the same time the effectiveness and prioritizing technical cooperation for member states. The second one which has to do with the operation of the procurement funds of the organization, in particular the revolving fund to provide access to vaccines and the strategic fund for medicines. Mexico believes that out of the 11 recommendations made by the external auditor, these should be a strategic input in order to define a roadmap together with member states for a better operation, as well as to assess its cost benefit. Mexico believes that the funds above all should prioritize cooperation mechanisms for member states, being relevant to establish a clear roadmap based on principles of transparency and accountability, guided by the recommendations made by the external auditor. Therefore, we urge the Secretariat to submit a proposal to be submitted to consideration of governing bodies for their discussion. Finally, we would like to support the position and the request made by Canada in connection with the submission of a briefing for member states on the new policy of sexual harassment and measures for its implementation. Thank you very much, sir.
We thank Mexico for the intervention, and we yield the floor to the United States.
Thank you very much. The U.S. delegation appreciates receiving the reports of the director and the external auditor on the financial situation of the organization. We also wish to thank the external auditor, the Auditor General at the National Audit Office, and his team for the effort taken to review the organization's financial statements and financial management practices. We note that in 2020, PAHO had a modest budget surplus of $3.9 million and a positive net asset balance of $274 million. We congratulate PAHO for the progress made with prior year auditor recommendations. Sorry, and appreciate the positive comments of the external auditor on the measures that PAHO is implementing to improve internal controls and the organization's risk management systems. And also concur with Mexico. We support Canada's call for the Secretariat to hold a dedicated member state briefing on the new sexual harassment policy and its implementation. Thank you so much.
We thank the United States for the intervention. And Mr. President, I register no additional requests for the floor. We go back to you.
Thank you very much. Thank you for those interventions. I will turn the floor over to Mr. Claudet, Director, Department of Finance Resources Management, for his comments and response.
Thank you, Mr. President. Muchas gracias, señor presidente.
Thank you very much, Mr. President. I would like to stress the fact that PAHO at all times is committed with reducing costs. In fact, this is a permanent strategy. It is part of the ongoing permanent strategy of the organization and part of the strategic plan and the biannual budgets. And continuously, we are working with that goal of reducing costs, improving processes, subcontracting some of the activities we carry out, to centralize or decentralize certain tasks, to resort to external suppliers or vendors. And with this, I'd like to assure member states that this is a permanent will of the organization, that of controlling its costs and reducing them when possible. Another one of the comments made is the one that has to do with the increase in the liabilities linked to the health insurance. The health insurance, as you know very well, is an insurance, a policy that is shared with PAHO and WHO, as well as with other organizations. It has a governing body. It follows a process which shares all the information, particularly at WHO sessions. And regarding the volume of existing liabilities, as we have discussed in previous meetings of the Executive Committee, the volume of existing liabilities at the end of 2020 was a very high volume, partially triggered by the significant drop in interest rates towards the end of 2020 as a result of the COVID-19 pandemic. We foresee that this year there will be a reduction of those liabilities automatically simply because of the impact in the increase in interest rates that have increased a bit since December last year. And also, and this is most important because all measures that have been adopted in the course of the last 2 years in order to contain expenditures in health are now reaping benefits. And last year, we already observed a surplus, significant surplus. And the trend that we've been following this year is that the surplus, that is to say, excess contributions over costs will be greater than that of last year. If the trend is confirmed, if it does take place, this is a confirmation that all the measures that have been adopted by the organization in order to contain health costs in the region of the Americas are being successful. Last but not least, I wanted to clarify something in connection with the procurement funds, which is an area that has deserved the special attention by the external auditor in the audit for 2020 with significant numbers of recommendations. And many of these recommendations have already been implemented. Others are underway. And in any case, what is clear is that the funds, the procurement funds that are covered by member states respond to the needs of member states. They respond to the requirements set by member states and not to unilateral actions taken by the organization. There's a whole set of questions that have to do with the cases of sexual harassment. And since this is a point that is outside my remit, I will be very grateful if the director of the Department on Ethics, Mr. McMillan, can respond to these comments. Thank you very much, Mr. President.
Do we have Mr. McMillan on, or are we able to accommodate him? Okay. Mr. McMillan, floor is open. Is he on?
I am on, but it says for some reason I can't start
Okay,
the video.
we're hearing you.
Okay. Okay, you can hear me though, but for some
Yes.
reason I'm not able to start the video. So I heard the questions from Canada about our SCA policy. I will be talking briefly about our policy on Friday during the meeting of the executive committee. So I'll have something to say about our policy then. But for the benefit of the conference, our SCA policy was issued in April of this year. It's a very comprehensive policy. It takes into account some of the practices and position in the policy of WHO, as well as some of the policies of other UN agencies. So of course, it's a very recent policy. We think it is comprehensive. We think it covers a number of important grounds that should be included in a policy of sexual exploitation and abuse. I need to clarify, though, that our policy is separate than our sexual harassment policy, which is contained in our policy on the prevention of harassment in the workplace. So we do have a dedicated and specific policy on sexual exploitation and abuse. The policy has been implemented in April. We have issued a bulletin to staff to make them aware of the importance of a prevention of sexual exploitation and abuse in the workplace. We have incorporated the concept of SCA in all the training that we have carried out in the organization. And we are considering some awareness campaigns, again, to increase the awareness and the visibility of this important issue. In addition, we are participating in the WHO task team on the prevention of sexual exploitation and abuse and harassment in the workplace. So we're working together with WHO, and we will further improve our practices in this area to make sure that we are at the forefront in trying to combat the issue of sexual exploitation and abuse in PAHO and in international organizations.
Okay, thank you. So my understanding is that more will be said on this on Friday. So hopefully, if there are any further details required, that will become apparent when
That
the
is correct.
presentation is made.
Thank you, Mr. President.
Thank you very much. Okay, at this time, I'm going to ask Madam Director, Dr. Etienne, if she wants to comment on what we have been discussing at 4.2 so far.
Mr. President, and let me thank member states for their kind comments with regards to the audit and the financial statement. I want to assure member states that executive management and the director take very seriously comments by the auditors, be they external auditors, internal or the audit committee. We have noted the recommendations that have been made, and we are acting. We have commenced action on acting on those recommendations. Let me say that executive management follows up very closely the finances of the organization. We have a monthly meeting with finance, budget, and our external resource and resource mobilization department, and this was even more necessary at a time of limited financial finances, when we needed to come together to steer the organization. And so I want to also stress that we have been very transparent with member states, and we shall continue to be. And we will provide a briefing, a member state briefing on our response to the sexual exploitations. I have told you already, I have a zero tolerance for this. So let me again thank you and give you my commitment that we will ensure that the financial situation of PAHO is healthy with your support, and that we will continue to ensure that technical cooperation is delivered at the highest standards and in conjunction with all of you member states. Thank you very much.
Thank you very much, Madam Director, and thank you all for your contribution to this very important aspect of the organization's functioning, and for the concerns or comments that have been raised. I would like to inform the council that the discussions will be reflected in the final report. And so we will now conclude this item 5.2 and move to item 5.3. 5.3 is appointment of the external auditor of PAHO for the year 2022-2023. I would like to bring document CD 55913 to the attention of the council and invite the representative of the executive committee to report on the item.
Muchas gracias, Presidente.
Thank you very much, Mr. President. During its session in June, the Executive Committee received an update on the appointment of the external auditor for 2022-2023. It was informed that in keeping with the past practice, the Bureau recommended that the current external auditor, the National Audit Office of Great Britain and Northern Ireland, be reappointed for an additional term of 2 years. The Bureau will initiate the process of requesting nominations for an auditor of international repute to be considered by the governing bodies for appointment as the external auditor of PAHO for the 2024-2025 and 2026-2027 biennium. The Executive Committee recognized the high level of excellence shown by the National Audit Office and expressed support for the proposal to reappoint them as external auditor, in particular to strengthen transparency and provide continuity during the current unprecedented situation. It was pointed out, however, that best practice among international organizations is to limit the appointment of the external auditor to a single term of between 4 to 6 years that would not be immediately renewable. While it was noted that the National Audit Office reappointment would still be within the recommended limit of 6 years, the organization was encouraged to consider amending its financial regulations to reflect such term limits. Thank you, Mr. President. This concludes my report on this item.
Thank you very much for that report. I would like now to proceed by opening the floor to the plenary for discussion and to invite delegates to utilize the electronic platform and our moderator in his usual efficient style to conduct this aspect of the session.
Thank you very much, Mr. President. We will proceed to take note of the request for the floor on this agenda item. Mr. President, seeing none, we turn back to you.
Okay, so that is more than efficient. Thank you very much to all. Is there any comment that is necessary from Mr. Shade? Given no comments from the delegates, you're welcome to proceed now.
Muchas gracias, señor presidente. Quiero
Thank you very
aprovechar-
much, Mr. President. I'd like to avail myself of this opportunity to let member states know that the process, well, next year we will amend the financial regulations in the sense of complying with the requirements and giving a maximum term for the appointment of external auditors on the one hand. On the other one, next year, we will initiate the process for the designation of the upcoming external auditor. And thus, I'd like to stress the importance of this position and the relevant role that member states play in the appointment or the nomination and election and appointment of an external auditor. In the past, we have encountered cases in which member states did not nominate or did not propose any external auditor. And this makes it very difficult to appoint one. And thus, I'd like to inform you as of now what the criteria are, because it is good for you to start thinking if you can bring to our attention names of some candidates. First of all, we should stress that the external auditor must not necessarily be the national audit entity. It can be a different agency, not the national audit entity. And they not even have to perform their activity in the country of the member states that proposes that entity. It is necessary that this be an external auditor of international repute. That is to say that they be recognized at an international level. They must submit the reports in English, and they have to be capable of working in a multilingual environment, such as the one that we have in our region, and particularly having the ability to work in Spanish and in English. So we will initiate the process for nominations, for proposals by member states for the new external auditor of the organization next year. But it is important for you to begin considering these criteria so that you can appoint and nominate external auditors. I wanted to remind you that currently the external auditors that work within the United Nations system or agencies are Tanzania, the General Auditor of the Republic of Tanzania, the National Audit Office of France, the General Audit of India, the Audit Commission of the Philippines, the Federal Office of Audit of Switzerland, the National Audit Office or Court of Accounts of Sweden, Ghana, the Director in the Republic of Indonesia, in the National Audit Office of Indonesia, and obviously also the Audit Office of the United Kingdom, the General Auditor in Canada, the General Auditor in Pakistan, the General Auditor of the Republic of China, and the National Audit Office of Spain. They were the previous external auditors. And I say this because you can use that as a reference as to who is currently acting as auditors of other international organizations. Thank you, sir.
Thank you very much for your intervention and for your reminders. That was very important. And I now would ask the Madam Director for her contribution to this report.
5.3. Thank you, Mr. President. I was a little distracted. So are we on 5.3?
Yes, 5.3.
Okay, thank you. No, so PAHO will thank the Secretariat thanks member states for positively considering the reappointment of the external auditors in 22-23. We endorse this. We think that they have worked very closely with the Secretary to improve the processes in PAHO, and we continue to be guided by their insight and their good judgment. However, we need to stress that and to ask member states to begin to look, because by next year we would have to begin the search for new external auditors. And so I would be grateful if member states begin to explore the possibilities of their own auditors to perform the functions of the external audit of PAHO. And we will give notice for when this is due. And last time we had great difficulty in finding an external auditor. So please, if you can start now by helping us to identify, and we will do the processes to come to you for your decision. Over, thank you.
Thank you very much, Madam Director. So there you have it, delegates. We have a charge to assist in finding external auditors. So I think that's an important job that we have been assigned. At this point, I will ask our rapporteur to present the proposed resolution.
Ok, procedo, señor presidente.
Thank you, Mr. President. Proposed resolution. Appointment of the external auditor of PAHO for 2022-2023. The 59th Directing Council, PP1, satisfied with the services of the present external auditor, the National Audit Office of the United Kingdom of Great Britain and Northern Ireland, PP2, noting their expressed willingness to continue to serve as external auditor of the Pan American Health Organization, PAHO, resolves OP1 to appoint the National Audit Office of the United Kingdom of Great Britain and Northern Ireland as external auditor of the accounts of the Pan American Health Organization for the 2022-2023 biennium in accordance with the principles and requirements set forth in Article 14 of the PAHO financial regulations. OP2, to request the director to issue a note verbal to member states, participating states and associate members in accordance with established procedures, requesting nominations for an auditor of international repute to be considered by the governing bodies for appointment as the external auditor of PAHO for the 2024-2025 and 2026-2027 biennia. This concludes my reading of this resolution, Mr. President.
Thank you very much. I open the floor to the plenary for discussion. Invite delegates who wish to participate to express that willingness through the electronic platform, and to our moderator for conducting this session.
Thank you very much, Mr. President. We will take note of the request for the floor. Mr. President, seeing none, we go back to you.
Okay, so there appears to be no objection. So if there are no objection, we declare the resolution as being adopted. All right, so we move on and we're making good time. We move on to item 2.1, the second report of the Committee on Credentials. And I now yield the floor to the delegate of Panama, President of the Committee on Credentials, to present the second report.
Sí, buenas tardes, señor presidente.
Good afternoon, Mr. President. We are going to present the second report of the Committee on Credentials in accordance with Rule 31 of the Rules of Procedure of the Directing Council. The Committee on Credentials appointed at the first plenary held its second session on 21 September 2021 at 11 a.m. The committee examined the credentials delivered to the Director of the Pan American Sanitary Bureau in accordance with Rule 4 of the Rules of Procedure of the Council. The credentials of the delegates of the member and participating states and associate members listed below were found to be in good order, and the committee, therefore, proposes that the Council recognize their validity. The participating states delivered their credentials, and these are the states that did so: Antigua and Barbuda, Argentina, the Bahamas, Barbados, Belize, Bolivia, Brazil, Canada, Chile, Colombia, Costa Rica, Cuba, Dominica, the Dominican Republic, Ecuador, El Salvador, France, Grenada, Guatemala, Guyana, Haiti, Honduras, Jamaica, Mexico, Nicaragua, Panama, Paraguay, Peru, St. Kitts and Nevis, St. Vincent and the Grenadines, Suriname, Trinidad and Tobago, the United Kingdom, the United States of America, Uruguay, Venezuela, associate members, St. Martin, observer states, Portugal, and Spain. Countries whose names were not read should expedite issuance of their credentials and deliver them urgently to the registration desk. The committee will meet again to examine other credentials that are received. Delegates are reminded that those states that do not submit their credentials are not entitled to vote. This is signed by Thais Noriega, delegate from Panama, President from Panama, Lourdes Jara, delegate from Paraguay, Omar Otley, delegate from St. Martin. Thank you, Mr. President.
Thank you very much for that presentation of the Committee on Credentials. Are there any objections from members of the elect? Please use the electronic platform if any contribution is to be made. I see no indication of objections or contribution, and therefore I declare the report approved. Thank you very much for that. I'm going to offer us a 5-minute break, given that we've been at it now for a little while, doing very well in terms of our efficiency of the time and our contribution. So we'll take a 5-minute break, and then we return to complete the day's agenda. And we're going to be dealing with 4.7 and 4.8. So 5-minute break. Thank you very much. Okay, thank you very much. We are back, and I trust you had a good 5-minute break. We are at the 59th Directing Council, 73rd session of the Regional Committee of the WHO for the Americas. And we are resuming in our final session for today, item number 4.7. And 4.7 is the reinvigorating immunization as a public good for universal health. Very important topic, and one that carries significant relevance in light of COVID-19. So I expect that there'll be a fair amount of participation, and we look forward to that. So I'd like to bring document CD 5910, that's CD 5910, to the attention of the council and invite the representative of the executive committee to report on the item. Thank you.
Gracias, señor presidente. El comité ejecutivo expresó su apoyo a la política y reconoció el valor de la
Thank you,
inmunización
President.
público para la salud universal. Se señaló que la pandemia de COVID-19 había puesto de relieve el papel vital de las
The
vacunas.
executive committee expressed support for the policy and acknowledged the value of the immunization as a public good for universal health. It was noted that the COVID-19 pandemic has highlighted the vital role of vaccines in protecting public health. At the same time, the pandemic has disrupted national immunization programs, drawn attention to the risks associated with reduced vaccination coverage, and widened existing gaps in access to health. Concern was expressed regarding the spread of misinformation about vaccines, growing vaccine hesitancy, and the consequent resurgence of vaccines preventable diseases. It was recommended that the policy should place greater emphasis on tackling these issues, including through information campaigns to encourage public engagement and dispel myths related to vaccines. It was emphasized that a multi-stakeholder approach is needed to maintain hard-won gains in the control of vaccine preventable diseases, recover from disruptions caused by COVID-19 emergency, and increase access to vaccines for all. It was also pointed out that expanding vaccination coverage will require new delivery methods and investments in scalable and resilient vaccination logistics, infrastructure, manufacturing, and supply chains. Delegates welcomed the policy focus on best practices and innovative strategies, highlighting in particular the emphasis on digital intelligence and strong leadership. And the policy's alignment with the WHO Immunization Agenda 2030 was also welcomed. The Executive Committee adopted Resolution CE 168.R15, recommending that the Directing Council approve the policy on reinvigorating immunization as a public good for universal health. Thank you, Mr. President. This concludes my report on this item.
Thank you very much for that. I now yield the floor to Dr. Luis Andres de Francisco Serpa, Director of the Department of Family Health Promotion and Life Course of the Pan American Sanitary Bureau, to present on the item.
Thank you very much, Mr. President. Mr. President of the 59th Directing Council, Madam Director, delegates of the Directing Council. Allow me to introduce the policy document CD 59/10, Reinvigorating Immunizations as a Public Good for Universal Health. Immunization is one of the key pillars of public health, an indisputable human right, and one of the best health investments money can buy, saving millions of lives every year and reducing the burden of disease and economic and social costs. Since its establishment in 1977, the expanded program of immunization in the Americas has worked in coordination with member states to achieve the elimination of poliomyelitis in 1994, rubella and congenital rubella syndrome 2015, measles in 2016, and achieved elimination of neonatal tetanus in 2017. The program has successfully expanded the inclusion of new antigens. During the last decade, however, the national EPI programs have suffered setbacks around the world, and our region has not been spared, as stated in the final report of the Plan of Action on Immunization 2014 to 2019, CD 59/INF/7. Areas affected include decreases in vaccination coverage, weakening of epidemiological surveillance, inadequate long-term sustainable financing, and the increasing vaccine hesitancy, linked in part to fake news and infodemia. The region had the largest drop in coverage for DPT-3 in the last decade, 94% in 2010 to 85% in 2020. And the COVID pandemic has since further widened the gaps in immunization, with decreases of number of children receiving DPT-3 by 33% and MMR by 24% in 2020. As a response to the declining coverage rates, the policy document presented here provides a strategic framework of innovation based on an assessment of the current situation and proposes the following actions. Strengthen the case for political commitment at the highest level, pressing on the importance of immunization and maintaining its financial support. Institutionalize strategies such as the use of artificial intelligence and geo-reference tool for the identification of unvaccinated population clusters to identify and target vulnerable populations. Prioritize immunization programs during the transformation of health systems based on the primary health care approach, expanding access and coverage of immunization services in tandem with the healthcare delivery network, in particular at the first level of care. The use of tools to promote taking program decisions based on the latest scientific evidence available. And last but not least, to prevent vaccine hesitancy through segmented, innovative communication approaches to promote trust in vaccines, using tools to convey up-to-date messages to a variety of constituencies. Mr. President, with ample input of member states shaping the proposed policy and its 6 strategic lines of action, and based on the current status of the immunization programs and their shortcomings, this document provides strategic guidance on how countries can redress the political, structural, and operational challenges faced. A strong, reinvigorated immunizations program is essential to maintain the gains achieved to date and to continue protecting the region from morbidity, mortality, and social and economic consequences of vaccine-preventable diseases, now more than ever. The Directing Council is requested to consider the policy document presented provide recommendations, and consider approving the proposed resolution. I thank you.
Thank you very much for that presentation. I will now ask members of the plenary to raise your hand using the electronic platform and ask the moderator to manage this segment of the session.
Thank you very much, Mr. President. We will take note of the request for the floor on this agenda item. We see Guatemala followed by the Dominican Republic.
Señor Presidente,
Mr.
ministros.
President, ministers, delegates of member states, Director of PAHO, special guests. In the region, including Guatemala, vaccine coverage from routine programs have been affected in the last few years and considerably during the pandemic caused by COVID-19. The gap that we're seeing in protecting our children against the diseases in our countries should be reason for concern because we may be losing gains. These gains are fragile and we need to protect them. In Guatemala, starting in 2019, we have detected 3 viruses from the vaccines that can lead to cognitive issues. And following research and the steps taken in the country, an international independent team considered that there were no clinical cases of polio and the country continues to be free of this disease. However, these events should be seen as a risk factor or a signal that risks may exist in our countries. To reduce these risks, the action agenda and strategy that we are adopting today in order to reinvigorate immunization as a public good in member states is of the utmost importance, and national programs must be strengthened to do it. I'm pleased to say that Guatemala is starting to take steps in order to implement recommendations from the International Assessment on Polio and will improve the immunization program as well as monitoring immunopreventable diseases. We're also reviewing our regulations to better support programs for immunization as a public good, and the ministry is going to continue supporting initiatives under the Vaccination Act until it is passed. This is why Guatemala supports the approval of the strategic framework with prioritized actions in order to reinvigorate immunization as a public good for universal health. These strategic focus areas are a great opportunity for health ministries to build on efforts and better govern, monitor, and integrate services, and to do better strategic outreach focusing on immunopreventable diseases. Once these capacities are fully embedded, we hope that they continue to be put into practice so that they can be tailored to the realities of the different benefiting states in order to provide timely and quality services for our people. This is a necessary road that we must take to save lives and to improve lives and health in our countries. Thank you.
We thank Guatemala for the intervention. We now yield the floor to the Dominican Republic, followed by Venezuela.
Gracias, señor presidente. Buenas tardes.
Thank you, sir. Good afternoon. The Dominican Republic believes that this document constitutes a necessary appeal to collective action in the different countries in order to achieve higher levels of health and well-being in the new regional and global context. In spite of the impact of COVID-19 in all spheres of life, it is necessary to expedite the evolution of a system towards a next level. The proposal that appears in the proposed resolution to reinvigorate immunization as a public good is a commitment so that we can move forward in order to build a modern and inclusive health system with a capacity of adequate response to the challenges of the present and the future that will be sustainable, affordable, accessible, and clear approach on primary health care. in order to ensure sustainability of the achievements made in the country as regards to control, elimination, and eradication of vaccine-preventable diseases, which implies implementing and continuing the proposed actions in the strategic lines proposed for policies. For the Dominican Republic, this is a progress in order to establish the basis of our strategic plans on immunization for the next decade for the attainment of the common goals of the government of the Dominican Republic and those enshrined here. Thank you.
We thank the Dominican Republic for the intervention. We now yield the floor to Venezuela, followed by Chile.
Gracias, señor presidente.
Thank you, sir. The Bolivarian Republic of Venezuela. The interpreters apologize. We'll do what we can, but it comes and goes. We agreed the principle of not leaving anyone behind. We agree in saying that during the last decade, national immunization programs have undergone ups and downs, including a reduction in immunization coverage, the weakening of epidemiological surveillance, insufficient financing for long-term sustainable vaccination, and the increasingly bigger gaps in vaccination. Venezuela has seen the onset of immunopreventable outbreaks after having achieved certification as a country that was able to eliminate measles in 2017 with a genotype D8 with impact in the most vulnerable groups, thus showing the impact of the measures, unilateral measures imposed since 2015 on our country. Let us recall that the last case was recorded in epidemiological week 33 in 2019. Currently, we are going through a re-verification process from WHO in order to obtain the certification as a measles-free country. The health of the peoples of the world must be above the ideological policies. As a universal health principle, we must look after the health of boys, girls, and pregnant women. We recognize the United Nations system, and we thank WHO and PAHO for the technical cooperation offered with a firm purpose of recovering this great need to revitalize immunization as a public good for universal health. Leads us to understand health as one of the fundamental rights, as it is enshrined in the Venezuelan Constitution. This document refers to the relevance of immunization as an essential human right. It is important to stress that the same efforts deployed by the Venezuelan Bolivarian government in order to attain the goal of vaccinating 70% of the population against COVID-19 is being intensified in order to include this in the national immunization scheme. We celebrate the initiative of member states to consider the vaccine against COVID-19 as a universal public good and not as a market good. This has been done in several unilateral stages and reduces protection to intellectual property that facilitates access to vaccines against COVID-19. In these terrible circumstances faced by mankind, particularly the most vulnerable populations. Thank you very much, sir.
We thank Venezuela for the intervention. We now yield the floor to Chile, followed by Honduras.
Buenas tardes, soy Alfredo
Good
Dorado.
afternoon. My name is Alfredo Dorado, the Ministry of Health of Chile. Thank you very much, Mr. President. Distinguished delegates, Chile is grateful for the document presented and expresses its support to the strategy of reinvigorating immunization as a public good for universal health. Our country has immunization programs that come before the creation of an enhanced immunization program, which enabled us to have the eradication in 1950. As of 1978, we established the broad immunization program, which included PCG, polio, BTP, and VASA vaccine, including these in immunization within the concept of public health, by thus establishing the mandatory nature, free nature, and guarantee by the state, which turned immunization into a right for the population, human right. The decree of 2010 of the state ministry establishes mandatory vaccination against immunopreventable diseases. And this instrument has progressively included some vaccines and reflects the principles of the enhanced program, reaffirming the principle of free access to safe and effective vaccines. The national immunization program in Chile is universal and non-discriminatory for anyone living in Chile. This constitutes a state policy which assures that it will be maintained over time, an allocation of permanent budget in order to mobilize and include new vaccines using lead technology. The current pandemic proves that a national organized immunization program deployed throughout the territory, organized on technologies and infrastructure, allows us to be prepared in order to face times of crisis such as the current one. This is how to date, and because of COVID-19, we have distributed over 30 million vaccines and a coverage of almost 90% with a population older than 18. Because of our experience with the current events, it is important and it is imperative to approve the policy proposed of revitalizing immunization as a public good for universal health. Thank you, sir.
We thank Chile for the intervention. We yield the floor now to Honduras, followed by Jamaica.
Muchas gracias.
Thank you
Honduras-
very much. Honduras congratulates the Secretariat for the proposal in this policy document to reinvigorate immunization as a public good for universal health. Even though we all acknowledge the importance of immunization for health for our peoples, we've sadly seen how we've reduced the coverage with the different vaccines, and more than ever during the pandemic caused by COVID-19, and therefore this document currently acquires a great relevance. We believe that we ought to develop plans, as in this case, that will go back to stressing the importance of immunization as a sustained program, taking into account the 6 lines of action in order to strengthen leadership, ensuring the budget for immunization, including the cost of human resources in the process itself of vaccination, the importance of having a campaign launched, including all groups and in their own language, that can provide confidence that the population had at one point in health services in the region of the Americas. Confidence that unfortunately has been reduced, particularly during this pandemic. Therefore, it is extremely important to establish a risk communication process for the population on this topic, particularly with those populations of ethnic group in their own language. Therefore, we respectfully ask the Directing Council to approve this proposed resolution that comes under this very important document. Thank you very much, sir.
We thank Honduras for the intervention. We now yield the floor to Jamaica, followed by Cuba.
Mr. President, Jamaica wishes to commend the Council for summarizing the magnitude of the challenges faced by member states in maintaining immunization coverage. Furthermore, providing this comprehensive report on the strategic framework for strengthening national immunization programs and revitalizing immunization as a public good for universal health is welcomed. Jamaica notes and endorses the recommendations posited. There is a strong political and technical commitment to immunization in Jamaica, as evidenced by the full integration in our public health system, as well as a public-private partnership, especially as it relates to vaccine supply and data collection. Technical cooperation is required to craft a strong legislative framework that facilitates high vaccination coverage across the life course, address root causes of vaccine hesitancy with audience-specific targeted interventions, identify strategies that will foster greater public trust and confidence, have system redundancies that can be activated when there is a disruption of services as seen in the COVID-19 pandemic. Model and forecast disease trends, build research capacity within country, and improve vaccine waste management. COVID-19 has highlighted the inequities between vaccine producing and non-vaccine producing countries, resulting in small member states unable to access vaccines in a timely manner. We encourage that the established umbrella partnership model, building on multilateral collaboration, is revised to be more responsive and effective. Cost still remains a barrier in some countries, and a review is needed of the cost of some vaccines that prohibits member states from a universal introduction of new vaccines into the routine immunization program. Again, Jamaica congratulates the Council and supports the proposed activities. Thank you.
We thank Jamaica for the intervention. We now yield the floor to Cuba, followed by Argentina.
Muchas gracias, señor presidente. Agradecemos
Thank you
a-
very much, Mr. President. We thank the Secretariat for the document presented. We believe that the strategic lines of action as presented reflect essential aspects in order to reinvigorate immunization as a public good for universal health. We support the strengthening of primary health care policies and that immunization programs have become part of the actions developed at this level. This undoubtedly will improve access and will enable us to deal and approach inequalities in order to achieve universal health. We also ratify the importance of strengthening the capacities of well-trained human resources with necessary skills and certificates that will allow us to have adequate implementation of national immunization programs within countries. We acknowledge the efforts made by the international community, essentially by the World Health Organization and the Pan American Health Organization, in order to combat the pandemic and the search for initiatives for global and equitable access to vaccines. We reaffirm the need for working in order to achieve universal immunization soon, as well as reaching equitable prices for supplies and equipment that will allow us to protect all. Technical cooperation has been an essential aspect in the strengthening of these programs. We believe that we ought to reinforce the interagency harmonized work aligned with national priorities in order to attain the greater impact on the implementation of this policy in member states. On top of this, we need to strengthen leadership and governance of health systems in order to achieve the goals set, and that vaccination will truly be a public good for universal health. In Cuba, the national immunization program is a priority for the national health system. Currently, within the context of the pandemic of COVID-19, we've developed 3 vaccines and 2 candidates to vaccines, deploying a broad vaccination process in the Cuban population. Cuba will continue to promote cooperation and integration. And within this framework, it reiterates the will to cooperate in keeping with its possibilities on vaccines, taking into account the principle of solidarity and cooperation with the peoples that is characteristic of our country. Thank you very much.
We thank Cuba for the intervention. We give the floor now to Argentina, followed by Brazil.
Gracias, señor presidente. Garantizar el acceso
Thank you,
equitativo.
sir. To ensure equitable access to medicines and vaccines ought to be a priority for states because it is a necessary condition to promote the true enjoyment of the right to health by all. We are convinced that this is one of the interventions in health that is cost-effective, that has shown its impact in the eradication of smallpox at a global level, elimination of wild poliovirus and other diseases, as well as endemic circulation of congenital rubella and measles in our country. However, and in spite of all that, we still have close to 20 million children in the world that do not receive the vaccines they need. In Argentina, immunization is a state policy that attempts to create accessibility and close access gaps. Our national calendar has 17 free vaccines mandatory for all the stages in life. We prioritize this intervention, reinstating the procurement and distribution of vaccines in the national calendar in the last few years that had been impacted, which enabled us to interrupt the circulation of the measles virus, thus recovering the certification obtained by Argentina previously. Immunization campaigns should not be under the levels set as an objective, and that the benefits of immunization will not be distributed unequally amongst countries. We ought to consider the impact and the decrease of vaccination levels in the context of the pandemic and the efforts that will be needed to recover schedules and the susceptibility of those that are prone in order to recover from immunopreventable diseases. We support the proposed resolution, understanding that immunization is a human right and one of the best investments in health. Thank you.
We thank Argentina for the intervention. We now give the floor to Brazil, followed by Guyana.
Muito obrigada, senhor
Thank you
presidente.
very much, Mr. President. We agree with the adoption of the resolution as approved by the executive board that establishes lines of action in order to strengthen immunization programs through the introduction of best practices, including new behavioral and data analysis techniques. In the course of the last decade, the coverage of many vaccines were dropped. This was worsened by the global plan of the COVID-19 pandemic. The strengthening of primary health care systems and expanding access to health services are key elements in order to ensure expanding vaccine coverage. It is also important to improve logistic structures of human resources so that those vaccinated will safely and effectively be reached by all society, and in particular, reaching the most vulnerable groups. Brazil has the largest public vaccination program in the world, established on the basis of the single health system that ensures universal, comprehensive, and free access to health. We have a vast accumulated experience with the National Immunization Program, the largest public vaccination program in the world, that has several immunization vaccines spread throughout the territory. We understand that immunization is a global public good, and we urge ministers of health of Mercosur in recent statements defended this as a safe and effective vaccine against COVID-19, which is a fundamental human right. As is said in the objectives of Sustainable Development number 3, immunization is essential in order to guarantee healthy beings and promoting well-being for all ages. We know that as regards productive capacity manufacturing of vaccines, producing health technologies, our region has to work strongly in looking for self-sufficiency. Thus, and has been stressed in the course of today's deliberations, we share the understanding of PAHO and WHO regarding the urgent need to expand and decentralize the production of vaccines, because developing countries are those that are most affected by its shortage. Thank you very much, sir.
We thank Brazil for the intervention. We now give the floor to the delegation of Guyana, followed by Colombia.
Thank you very much. On behalf of our Honorable Minister, Dr. Frank Anthony, I make this statement. Guyana strongly supports the resolution CE 168.R15, reinvigorating immunization as a public good for universal health. Guyana's support for this resolution is unconditional because for decades our country has committed to universal coverage for all relevant vaccines. For all the children vaccines, Guyana has achieved almost 100% coverage. Even with the disruptive consequence of COVID-19, Guyana has been able to maintain high vaccine coverage in our routine children immunization program. For this, we are eternally grateful to the health workers who have ensured that the vaccination program is not derailed, even as COVID-19 leaves behind social economic difficulties. For more than 2 decades, Guyana has stated that even in times of austerity, Guyana will never reduce investment in vaccines and immunization. In this regard, Guyana wants to assure our colleagues that we are fully committed to the revolving fund mechanism for vaccine procurement. We hope that the present inequitable access to COVID-19 vaccines that forced each of our countries to seek out other arrangements for procuring vaccine is merely an anomaly, and that far from distancing ourselves from the revolving fund, we're even more resolved for a strengthened revolving fund. Guyana has already begun putting in place initiatives to strengthen our digital infrastructure and our capacity for artificial intelligence as we transform our paper-based immunization record into fully electronic record keeping. We therefore fully support the strategic action for utilizing digital technology to improve effectiveness and efficiency within the immunization program, contributing to an enhanced universal healthcare system. COVID-19 has certainly exposed several fault lines in our platform for universal healthcare. One of those fault lines is the increasing impact of misinformation and the growing vaccine hesitancy. Guyana is pleased that in Resolution CE 168.R15, recognition is given to the dangers of vaccine hesitancy. The anti-vaxxer movement is now a public health risk factor, just as alcohol and tobacco, and just as high sugar and trans fat are risk factors. Guyana is committed to expanding our communication program to ensure we confront vaccine hesitancy. Finally, colleagues, vaccination has always been a voluntary option for citizens in all of our countries. Clearly, as COVID-19 has revealed, there are circumstances where vaccine mandates may become necessary. The COVID-19 vaccine mandates being rolled out presently among countries provide us with one circumstance in which such mandates become a legitimate public health response. Guyana urges PAHO WHO to take leadership and ensure that these mandates, these travel mandates, while protecting our citizens in our own countries, must never be unfair to citizens of any other nation. Thank you very much. We fully support this resolution.
We thank Guyana for the intervention. We now yield the floor to Colombia, followed by the United States.
Gracias, señor presidente.
Thank you, Mr. President. We acknowledge the important contribution made by this policy document, as well as a proposed resolution through which we promote the reinvigoration of immunization as a public good for universal health. The adoption of the proposed policy is of utmost importance, bearing in mind the fact that the challenges proposed in the initiative respond to the context we are being impacted in the Americas and the rest of the world. For Colombia to classify this as a public good is of extreme importance, bearing in mind the fact that these are goods or services that are for the good of the population enjoying this and provide dignity to the life of people. This acquires a great relevance currently because all countries should have access to vaccination against COVID-19 in a safe, equitable, and rapid form. However, we see huge challenges in complying with this major objective and huge gaps between countries in our region. The need for taking into account the scientific evidence available. In connection with the vaccines, this has become evident. And in this regard, it is essential to acknowledge the effectiveness of the biological substances authorized by WHO. And this is something we have to continue working on. One of the essential tools in immunization campaigns are vaccination certificates that are currently being granted in a digital format. These vaccination certificates acquire great importance as an instrument in order to learn about the immunization status of people and thus to be able to move safely to the reopening and the reactivation and international movement of travelers. However, in contradiction and compliance with what is established in the IHR and what has been warned by the committee on this instrument, we've observed how these certificates that should facilitate the movement processes and become a tool for follow-up have also become a barrier, a hurdle upon being requested as a travel requisite. We urge countries to comply with what is established in the IHR and what has been dictated by WHO in connection with this vaccination certificate, and to promote and to facilitate the normal movement of travelers. And we call on PAHO to continue promoting compliance with what is stipulated in the IHR. Another major lesson of this pandemic has been the need for moving forward towards digital certificates, and for that, the development of guides by WHO, which have been an essential support. It is necessary for countries to work on the implementation of these guides at a national level, and for PAHO to continue facilitating this process and providing the technical support needed by countries for the implementation of these guides. In the current context, the importance of a joint teamwork, solidarity and articulated, has been broadly recognized, and therefore the interoperability and mutual acknowledgement of digital vaccination certificates cannot be an isolated issue. We urge countries to continue working on that interoperability, and we ask PAHO to continue facilitating the dialogue and the coordination of all processes. Thank you, sir.
We thank Colombia for the intervention. We give the floor now to the United States, followed by Paraguay.
Thank you, moderator. The United States welcomes this timely policy on immunization. Immunization is the cornerstone of the primary health system and a critical component of pandemic preparedness and response. We must build on our region's successes to reinvigorate our immunization programs and recommit to fully immunizing every child in the region, with special emphasis on unvaccinated or zero-dose children. We welcome this policy's 6 lines of action, especially its focus on innovative strategies along with proven best practices. Expanding the role of extensive immunization as a public good will require new delivery methods and investments in scalable and resilient vaccine logistics, infrastructure, manufacturing, and supply chains. And we would encourage PAHO to highlight this in an updated immunization action plan for the region. We also want to emphasize the safety component of the systems being put into place across the PAHO region, which will lead to safer vaccines. We call on PAHO and member states to continue to promote confidence and trust in safe and effective vaccines, including COVID-19 vaccines, as well as all vaccines included in the national childhood immunization schedules. We appreciate the policy's focus on developing innovative communication approaches to build trust in vaccines and combat vaccine hesitancy. We must also address misinformation and disinformation about the safety and effectiveness of vaccines, and welcome PAHO's efforts to develop communication plans and conveying authoritative information about vaccines and immunization. Transparency and meaningful engagement of civil society and communities are critical to these efforts. As we noted during the executive committee, there are numerous measures different stakeholders can take to maintain the hard-won gains in immunization, recover from disruptions caused by COVID-19, and increase access to vaccines for everyone. We as governments should develop, update, and implement national immunization plans that align with this policy document, the WHO Immunization Agenda 2030, and involve civil society and communities, provide adequate funding for immunization programs, and implement robust social awareness campaigns to promote vaccine confidence and trust in science, to increase access to vaccines over the life course and leave no one behind, no matter where they live. Donors should invest in vaccine research and innovation, development, manufacturing, and delivery, with a renewed focus on the needs of underserved, vulnerable, and marginalized populations. Governments and funders should continue to work closely with the pharmaceutical industry and scientists to accelerate vaccine research and development, increase supply of quality, safe, effective, and affordable vaccines to meet global needs, and apply lessons from COVID-19 to other diseases. We look forward to our continued work together to reinvigorate immunization in the region and support the proposed resolution. We do have a number of small edits to propose during the consideration of the proposed resolution. Thank you.
We thank the United States for the intervention. We now yield the floor to Paraguay, followed by Canada.
Gracias, señor presidente y señor
Thank
moderador.
you, President Moderator. Paraguay is thankful for this presentation of an important proposal. We take into account that with the COVID-19 pandemic, there's been an exacerbation of how important it has been to use vaccines against these diseases in all countries. This health crisis and these health crises force government to focus on the response to this emergency. However, the current challenge is to conserve the gains that we've achieved in the region, given the death caused by vaccine preventable diseases. Seeing these immunopreventable diseases, Paraguay is proposing working together in order to ensure that the region continues to be free of diseases like rubella, polio, and measles, and to achieve our common goal, which is keeping the Americas safe. This policy paper gives us the guidance in order to carry out the different vaccine activities. However, we believe that the implementation period is particularly long, taking into account the gains that we have already achieved in the region, as well as commitment from member countries that we see in paragraph 5 of this document. My country reiterates the political commitment to ensure availability of resources to protect the financial sustainability and operability of the immunization program. It also approves the adoption of this resolution. Thank you.
Thank Paraguay for the intervention. We now yield the floor to Canada, followed by Ecuador.
Mr. President, Canada welcomes PAHO's leadership in reinvigorating immunization efforts in the Americas. Our region has been recognized as a leader in this regard, and it is crucial that we safeguard our status as one of the regions with the highest vaccine coverage levels in the world to protect the health gains made to date. Immunization remains one of the most cost-effective investments in global health, and in the midst of this pandemic, the vital role of vaccines in protecting our health has been truly underscored. Canada remains committed to supporting equitable global access to COVID-19 vaccines and working alongside the WHO, PAHO, and other member states to educate, engage, and empower communities to make confident, informed vaccine decisions. We are proud to be a part of the COVAX facility to support rapid and fair access to safe, effective, and quality vaccines, including through our contribution to the advanced market commitment and additional resources to deliver and distribute vaccines in participating countries. This year, we have had the pleasure to hear from Canadian youth across the country who have a critical perspective to provide in global health diplomacy and decision-making. For youth in Canada and around the world, reinvigorating immunization as a public good for universal health has never been more important, and it is crucial that we as a region proactively address inequities in accessibility and disparities in healthcare by centering the voices of individuals with marginalized identities at the decision-making table. As we have seen throughout the pandemic, youth can play a critical role in knowledge translation and the dissemination of information to family members, community members, and peer groups. We know that by having systems in place that are reflective of all voices across all communities, we can better address vaccine hesitancy and achieve better health for all. Finally, as we collectively face the challenge of addressing the pandemic's disruption on health services, including immunization programs, we also need to look at the future, post-COVID-19. This policy serves as a positive step in addressing the reduction in vaccine coverage, weakening of epidemiological surveillance, inadequate long-term vaccine financing, and increase in vaccine hesitancy and misinformation in the Americas. Canada looks forward to working collectively to advance this critical work. Thank you.
We thank Canada for that intervention. We now yield the floor to Ecuador, followed by Uruguay.
Muchas gracias, señor presidente.
Thank you very much, President. Ecuador appreciates the support we received from PAHO as well as what has come from the revolving fund for access to vaccines. As a country, we believe that immunization is a global achievement that sets an example for development, and the revolving fund is the ideal mechanism for our region. Thanks to this mechanism, Ecuador has 18 vaccines that have become fundamental vaccines that has also allowed us to eradicate a number of diseases. Vaccines are the very foundation of our primary healthcare system and are also part of our constitution because they are part of the irrevocable human right that is enshrined in it. It is also part of the steps in public health that can be financed. This is why Ecuador welcomes the proposed draft resolution to strengthen the national immunization plan and the reinvigoration of immunization as a public good for universal health, especially in this current context in the pandemic, where we have seen how beneficial it can be to have leadership and do financing for the implementation of these steps in order to achieve the goals that were part of the COVID-19 immunization plans. Ecuador also reiterates its position to continue supporting a national immunization steps in order to achieve the SDGs in the country and in the region, focusing on our regular vaccine program. Ecuador believes that the implementation of the draft resolution to improve our management in public health is a challenge we'll take up, and we'll use this document as a great starting point, given the very valuable information provided in a history, background, and analysis that allows us to look at the current situation. In addition to the 6 pillars proposed to reinvigorate immunization as a public good for universal health. Thank you very much, Mr. President.
We thank Ecuador for their intervention. We now yield the floor to Uruguay, followed by Suriname.
Muchas gracias, señor presidente.
Thank you very much, Mr. President. On document 5910, reinvigorating immunization as a public good for universal health, Uruguay fully agrees that it is through information sharing between countries in the region that we will be able to strengthen immunization national plans, as well as reinvigorate immunization as a public good for universal health. The goal is to overcome the challenges that have come up in the region, and that way achieve the targets that we have set for ourselves in vaccination programs. Vaccines are also highlighted as important throughout the life of our citizens and focus on universal access in order to have full coverage for vulnerable segments of the population and increasing access for individuals who have socioeconomic disadvantages and face chronic diseases, migrants, individuals who are incarcerated, as well as other priority groups covered by our vaccine policies. In terms of the use of technology, technology is a key tool to use, particularly given what we're currently going through. This is why Uruguay has an IT system for vaccinations for all individuals, and also we use technology in order to ensure that vaccine records are reliable. All of this is key in order to formulate strategies that can increase vaccination, focusing on innovative approaches for different groups, always focusing on how to improve vaccine coverage, ensuring vaccine continuity during the COVID-19 pandemic has been seen by our country as a priority. We're looking for innovative mechanisms to conduct outreach in order to let everyone know how important it is to be up to date on your vaccine schedules. This is why the strategy is being formulated to have the best impact possible on this issue. When it comes to COVID-19 vaccines specifically, Uruguay created its strategic plan in line with the WHO guidelines, and also has ensured that we follow guidance on the vaccines authorized to combat COVID-19. There were a number of other secondary strategies set that were part of the framework or the umbrella program rather, and that is to go out into the communities to where people live. There were different plans, barrio, so between neighborhoods, between businesses, and between provinces in order to make sure that the entire country was covered when it came to vaccine access. We also believe that this is a great time to create mechanisms to allow us to do information cross-fertilization and to improve that the kinds of lessons learned that different countries have access to better inform decisions when it comes to national immunization programs. Thank you.
Thank Uruguay for the intervention. We now yield the floor to Suriname, followed by Peru.
Thank you, Mr. President. Suriname welcomes the policy document on reinvigorating immunization as a public good for universal health and acknowledges the challenges which have been negatively impacting the national immunization programs of our region. Suriname has also been negatively impacted as our vaccination coverage has fallen significantly by over 10 percentage points in 2019 compared to the previous 5 to 10 years. This is also being made worse by the impact of the COVID pandemic. While Suriname has traditionally had a vaccination program well integrated into our primary healthcare system, there is a need for capacity building for supervision and monitoring in our staff, innovative communication strategies to strengthen promotion on the benefits of vaccination, and stronger financial planning to sustain vaccine procurement and support other aspects of the program, such as surveillance. Suriname is now implementing the DHIS2 tool for COVID-19 vaccination with support from the PAHO, and with the short-term goal of expanding this nominal electronic registry to the routine childhood vaccination as well. The need for complete, accurate, and timely data for monitoring and informing our planning is well recognized, and with this, we hope to soon strengthen the quality of our data. The hesitancy around the acceptance of the COVID-19 vaccine underscores the importance of using scientific evidence to guide the program and inform our communication strategies. And it is hoped that PAHO will provide the necessary guidance and material to help counter the anti-vaccination messages using a religious basis. While we support the strategic lines of actions in the policy and the requests of countries in the resolution, it is anticipated that a more detailed plan of action will be developed to give us more guidance for the implementation. Thank you, Mr. President.
We thank Suriname for the intervention. We now yield the floor to Peru, followed by Bolivia.
Muchas gracias, señor moderador.
Thank you very much, moderator. President. Immunization is the public health activity that has had the best cost-benefit outcome and intervention in the healthcare sector. In order to reduce mortality and morbidity from COVID-19, the Health Ministry approved the National COVID-19 Vaccine Plan for progressive immunization of 22,217,000 people in 3 different stages based on the health priorities of the country. According to this policy, the first target will be to protect the continuity of basic services. The second will be to reduce severe morbidity in seniors, and third, to reduce the impact of the disease. When it comes to immunization as a public resource, the steps taken have always been based on ethics and putting people first, ensuring that costs can be reduced for hospitalizations. These different steps have been diverse, but require greater resources and international cooperation. In addition to what the health sector is doing, it is vital to also increase engagement from regional and local governments. Alongside an organized community effort, Strategies for providing outreach and identifying the target population is also key for vaccination. It's important to state that the most affected group during this pandemic has been adults, followed by young adults and young people. The largest number of deaths was seen in seniors, followed by adults. Despite these great efforts, there's a need for an increase in vaccine manufacturing, which continues to fall short in the face of also unequal access. There needs to be strengthening of vaccine programs in our countries and also a reinvigoration of immunization as a public good for universal health. This is why Peru supports the adoption of this resolution. Thank you.
We thank Peru for the intervention. We now yield the floor to Bolivia, followed by Mexico.
Sí, muchas gracias. Buenas tardes.
Thank you very much. Good afternoon. The plurinational state of Bolivia recognizes that free and universal access to healthcare and therefore to drugs and vaccines on equal footing and without any discrimination is a duty of the government and a right of all nations and peoples. Bolivia, in our health prevention policy, also includes immunization and all vaccines free for everyone without any discrimination. However, drug prices for the latest vaccines and how difficult it's been to get them has shown how countries like ours have had these challenges to face in both numbers of vaccines available as well as prices, which has heavily weighed on the economy of our country. It is obvious that the COVID-19 pandemic has laid bare the weaknesses in our countries when it comes to access to medicine and vaccines, and has also become a threat when we look at how other producing countries have acted in making access to these essential medicines an instrument they use for coercion and for their personal interests. Vaccines are a public good and save lives and are part of the strategy to prevent deaths, disability, and other preventable diseases. This is part of the steps that the health sector needs to take and should be part of the positive impact we have through vaccination, and requires that we take these steps for increased social engagement. COVID-19 vaccine drives can be enhanced with better distribution. And Bolivia has seen an alarming fall in routine vaccine programs, as well as in screening, prevention, and treatment of infectious diseases, all of this because of the pandemic. Bolivia believes that the strategies for reinvigorating the immunization as a public good are fully relevant, and vaccines should not be used as a business tool, and there should be increased production and efforts to ensure that vaccines are available to everyone. Bolivia will continue to decisively enhance our vaccination program and ensure that everyone in our country can be vaccinated in a timely fashion, and will also continue to build capacity for our healthcare staff to achieve our goals. We fully endorse the policies and the strategy proposed by PAHO and the WHO. We take note of the information and the background as we continue to build our program for better immunization in our country. Thank you.
We thank Bolivia for the intervention. And finally, we yield the floor to Mexico.
Muchísimas gracias, señor moderador.
Thank you very much, moderator. Thank you to everyone who has been in this meeting and participated in this discussion on immunization. Friends, the COVID-19 pandemic has imperiled our systems, both for healthcare and for public health. In Mexico, information on social distancing during the first wave of the pandemic actually led to reduction in vaccine rates that we had seen for 5 years. And this is due to a number of different problems. For example, there was limited supply of vaccines, on the international market. As we saw, it was a case for HPV vaccines and also medicine for preventing TB in newborns. There was also hoarding of these supplies for some of these medicines. These strategies proposed in the document and in its resolution are in line with the focus areas that we have identified in Mexico, where governance, leadership, and financing are absolutely vital for ensuring that we come back to the necessary coverage in order to preserve the gains we've had over the course of the years. For example, eliminating measles in our country. Information systems are absolutely vital for making sure that we have more information for decision making, and to also have a registry of those who have been vaccinated, and to have hard data in order to be able to better assess our vaccine coverage. To do this, the work that we are currently doing now is absolutely vital, alongside the country office of PAHO in Mexico, in order to have a better registry system for both the administration of vaccines as well as public health surveillance for any events that have to do with immunization and vaccination. One of the pillars here is primary health care, in order to bring public health services to people and not the other way around. A number of risk communication labs have also been set up with technical support from PAHO's office in Mexico, which has been absolutely vital in increasing vaccine buy-in. These labs are going to be useful as well in order to broaden information and knowledge around other vaccines and improve public health awareness, which can reduce health risks. We appreciate and welcome the resolution proposed to reinvigorate immunization in the entire region, particularly in the countries where we have the higher rates or communities who are anti-vaxxers, which fully hurts our countries and indeed the world. Thank you.
For the intervention. And Mr. President, there are no other requests for the floor, so we go back to you.
Thank you very much. Thank you to all the persons who have delegates who have contributed to this very important discussion around immunization. As expected, a number of contributors, and all worthwhile, all valuable, all important. And it demonstrates, of course, the interest in this particular area, particularly now with the COVID-19 pandemic, where vaccination is an important part of our response to resume normality. Substantial agreements, but I do note that there are some recommendations that vary from the report. So at this point, I'm going to ask Dr. Serpa to respond to the comments that have been made and any other additional comments.
Thank you very much, Mr. President. And I will switch to Spanish. Primero que todo, quería agradecerle a los
Well, let me
estados
start by thanking member states for their statements. They were truly important, and according to my count, there were 20 states who spoke on this issue, which shows how important these immunization programs are. I want to start by saying that we stand ready to support any of our member states. And we stand ready to provide any technical support and any technical input. And I say that because the implementation of these programs obviously need to be put into the context of these countries. And as we know, in these countries, there are different degrees of information and different programs in terms of also progress on meeting needs. This is why, just as we proposed, we're going to be working with member states, a discussion that is already ongoing, to work on an action plan that ensures that we address the details of what will be the implementation of these programs and to ensure that that is going to lead to the necessary changes that allow for immunization to become a universal reality. I should note that we are in line with global and regional programs, which will allow us to also measure our progress as we move forward. Additionally, I know that a number of member states mentioned vaccine confidence and trust. This is an important dimension that has gotten a lot of attention from us. When it comes to mistrust of vaccines, it's nothing new, as we have already heard. However, we know that it has become a heightened concern. That is because there is more access to information, and it's become also harder to know what messaging from what we're hearing are actually evidence-based and what isn't. And so we see here that we have strategies to improve information, to instill more trust in these vaccines, be that for COVID-19 or for a different disease. But for this, there need to be a number of strategies deployed at once. We are working on improving outreach programs embedded within national plans. We have courses and handbooks and documents that can help inform work done in countries in order to increase trust in vaccines. And this goes not only for individuals and communities who are following the news, but also for specific situations. Say, for example, for journalists, we have webinars aimed at journalists to show the best way of using these tools. Young people who, more than anything, use social media to communicate, we're actually doing a deep dive of what they're doing on these platforms, and we're also tailoring messages to the different segments of the population. What perhaps is the most vital component is that the focus of all of this work should be and are healthcare workers. They are the ones who need information, who are requesting information, and some of these professionals, because they are younger, unfortunately, they don't know what measles looks like. They don't know what polio is. This is why we are working with healthcare workers in the regions throughout our hemisphere. We are showing what it looks like to be impacted by these diseases. And this can help actually have our healthcare workers be our messengers in saying that everyone needs to get vaccinated. We know that in this case, we should be turning to the messengers, ensuring that they have the tools they need. And this is why we are making sure that our healthcare workers have the proper training and have the information they need to deliver the messages that need to be delivered, and to make sure that they are working with us side by side to tackle the mistrust. That is what I wanted to share. Once again, we are here for anything you need when it comes to technical input or assistance, particularly when it comes to increasing equity. I applaud the work done by member states, and we look forward to continuing to work with you. Thank you.
It's an intervention on matters that have been raised. I now hand over to Madam Director for any comments that she has on this issue.
Thank you, Mr. President. At risk of being named spreading fear, this is another area that I want to draw member states' attention to. In fact, as you will see, many of the technical agenda items that we've placed here are because they are very high priority. Our immunization programs are in jeopardy. And while that was exacerbated by the pandemic, that was long before the pandemic. we have been seeing decreasing coverage for most of our vaccines across countries. I have listened to member states. I've heard all the innovations and the work that is being done around your immunization programs. But something is happening that we need to take stock about. What we are seeing is we have been looking at the investments in your countries on the immunization programs. Those are declining. Immunization programs at one time, they enjoyed high visibility and advocacy at the very highest levels of government. We have lost that to a significant extent. Inadequate surveillance. Some of our countries have totally decentralized immunization and not, yes, they should be embedded in the first level of care, but there needs to be a central level guiding surveillance and monitoring and analysis. And for some, a lot of this has been left to every individual district or department, or etc. So the lack of coordination in terms of the governance and the management of immunization programs seems to be one of the problems. Of course, the growing vaccine hesitancy is a problem. And our inability as the health sector to adequately respond to the levels of vaccine hesitancy that we are seeing. So what we have is, over the years, it's an accumulation of susceptibles. And it will get to a point when it is enough to sustain an epidemic of the vaccine preventable diseases. I want us to remember that vaccines have contributed to health and well-being and the economic development of our countries. And to date, and they are and continue to be the most important public health innovation. So I think it is necessary for all of us to re-examine our immunization programs, taking an objective analysis and look at the immunization programs. I can give you the commitment that in the Secretariat, we have begun this re-examination. We'll continue to look at our approaches to the delivery of the technical cooperation under these programs, and we will see to what extent we can innovate and raise the visibility of the immunization programs in our region, and also with donors. This is a program that we not necessarily receiving voluntary contributions towards, which have declined as well. Countries need absolutely to commit, and we want to ask you to also re-examine your immunization programs. We need in countries the leadership and governance. We need investments in immunization. We used to make the economic case for introduction of new vaccines. We need to return to some of those. And I think the innovation and greater community engagement is going to be very important. And if we probably do not have sufficient community engagement, as people would be more open to receiving immunizations. And of course, we need to strengthen primary health care and embed the immunization program within primary health care. For most of our countries, we're already doing this. For some, immunization is still a vertical program. So we need to embed in primary health care, but to retain the coordination of the surveillance and the analysis, the monitoring and evaluation of your immunization program. And finally, let me say that science counts. Science counts. We have to be more open to research. We have to be more open to research findings and to incorporating those research findings in our immunization programs. As I say, I don't want to be a fearmonger, but we need to tell you very honestly that if our immunization programs continue like this for another 5 years, we will be seeing a series of outbreaks in the region. So let me thank you again for the attention that you've given to immunization, the work that you've done in your countries, but to say that we have much more to do. Thank you so much.
Madam Director, and I think your comments are well placed and very, very important. We in Jamaica do see the very challenges that you have expressed, and I'm sure other member countries similarly so. And I think it's going to be very necessary to take that look and recalibrate and replan to emphasize immunization. At this point, I'm going to ask our rapporteur to present the proposed resolution.
Proyecto de resolución
Proposed resolution, reinvigorating immunization as a public good for universal health. The 59th Directing Council, PP1, having reviewed the policy document, reinvigorating immunization as a public good for universal health, document CD 59/10, which sets out the approach of the Pan American Health Organization and a strategic framework for revitalizing immunization programs in the region of the Americas. PP2, considering that despite the tremendous achievements of immunization programs in past decades, progress has stalled or even reversed in many countries in the region, putting past achievements at risk. PP3, acknowledging that immunization is among the most cost-effective public health strategies available, and that in addition to its health benefits, immunization provides a high rate of return on investment, resulting in contributions to socioeconomic development and educational attainment. PP4, cognizant that this policy reflects and supports the commitment made by member states to advance toward meeting the Sustainable Development Goals by 2030, the goals of the Sustainable Health Agenda for the Americas 2018-2030, and the goals of the Immunization Agenda 2030 of the World Health Organization resolves. OP1, to approve the policy reinvigorating immunization as a public good for universal health, document CD 59/10. OP2, to urge member states, according to their national context and priorities, to A, adopt and implement the strategic lines of action of this policy to reinvigorate immunization programs through the implementation of innovative approaches and best practices, incorporating technological, communication, behavioral, and data analysis tools. Little b, declare vaccination as a public good and raise awareness among healthcare workers to advise individuals regarding vaccination, among parents and guardians to have their children immunized, and among individuals to be vaccinated, considering officially recommended immunization schedules. Little c, strengthen governance and leadership of immunization programs combined with effective oversight, accountability, coalition building, regulation, and attention to system design to ensure adequate and efficient implementation of this policy and progress toward universal health. D, ensure and protect immunization-specific budgets, including but not limited to the cost of vaccines and supplies, human resources, and immunization operations. OP3, to request that the director to A, provide a technical cooperation and promote collaboration within and across all levels of the organization and member states in support of revitalized immunization efforts. B, promote and enhance constructive collaboration with other stakeholders relevant to the implementation of this policy, including but not limited to other international organizations, existing networks, programs, and collaborating centers to pursue synergies and to increase efficiencies. C, enhance coordination, regional and country levels to improve access to vaccines, diagnostic tests for laboratory networks, supporting surveillance, and other key supplies relevant to primary health care through the revolving fund for access to vaccines and the regional revolving fund for strategic public health supplies. D, report to governing bodies on the progress made and challenges faced in implementation of this policy in 2027 and 2031. I've read the proposed resolution, Mr. President. Back to you.
In anticipation, thank you very much for the proposed resolution. In anticipation that we do have substantial agreement, but some difference of opinion on the resolution, I open the floor to the plenary for any comments or proposals. Kindly use the electronic platform, and I will ask our moderator to manage that segment of the proceedings.
Thank you very much, Mr. President. We will take note of the request for the floor to discuss the proposed resolution. We see the delegation of Colombia. Colombia, you have the floor, followed by the United States.
Muchas gracias, señor presidente.
Thank you very much, Mr. President and distinguished moderator. In order to add to the text of the proposed resolution to include some basic lessons that we've seen within the process of managing COVID-19 that are relevant for reinvigorating immunization as a public good for universal health, we kindly ask you to speak slower. Thank you. Let me start again. We've brought to the attention of the Secretariat some proposals to be included in the proposed resolution and for these to be circulated amongst the member states. I will now read out the changes proposed, which also take into account other proposals made by the US. Paragraph OP2, little b, declare vaccination, extensive vaccination, as a public good and raise awareness among healthcare workers to advise individuals regarding vaccination, parents, guardians to have their children immunized, and individuals to be vaccinated following the officially recommended immunization schedule. OP2, little e, a new proposed paragraph, little e, within the framework of the COVID-19 pandemic, and in particular within the global immunization context and requirements for international travel, as necessary to enforce measures to promote the free movement of travelers, taking into account WHO recommendations on immunization and travel. OP3, little a, provide technical cooperation and promote collaboration across all levels of the organization and member states in order to support the initiatives for revitalization of immunization, to increase global immunization, to facilitate the attainment of the SDGs, and to promote knowledge and acceptance of safe and effective vaccines as authorized by regulatory officials, a strict official or procedure on the list of emergency use, a pre-classification of the World Health Organization in order to support the implementation of national vaccination plans in the region and their related processes as proceeds with agreements on national policies. OP3, little d, a new paragraph, to promote the dissemination of scientific information available on immunization, particularly against COVID-19, and to promote its use in decision-making processes by member states, favoring, as necessary, acknowledging the guidelines of WHO and PAHO on immunization, in particular against COVID-19. And last but not least, OP3 little e, which is another new paragraph, to favor the possible coordination of processes related to immunization as necessary and in keeping with national priorities and policies as the process to standardize, recognize, and implementation of digital vaccination or intelligence certificates. Thank you.
Delegada de Colombia.
Thank you, distinguished delegate of Colombia. Before we go to the U.S. delegation asking for the floor, I'd like to ask you once again that you go through the changes introduced to the resolution once again, because they do differ from those received by the Secretariat. And for the benefit of the Secretariat and for all the other member states, we kindly ask you once again to read out the changes as proposed to this resolution slowly so that we can all take note of these changes. Of course, thank you very much. Once again, the first proposal is on paragraph OP2, little b. Declare vaccination, extensive vaccination as a public good and raise awareness amongst healthcare workers to advise individuals regarding vaccination, parents and guardians to have their children immunized, and among individuals to be vaccinated following the vaccination schedule officially recommended. OP2, little e, which is a new paragraph, within the framework of the COVID-19 pandemic, and in particular within the global immunization context and international travel requirements, they apply accordingly measures to promote the free movement of passengers or travelers, taking into account the recommendations and guidelines of WHO on immunization and travel. OP3, little a, provide technical cooperation and promote the collaboration across all levels of the organization and member states in order to support initiatives for revitalization of immunization or reinvigoration of immunization to increase global vaccination and the attainment of the SDGs, and to promote the recognition and acceptance of vaccines, safe and effective vaccines authorized by strict regulatory authorities and/or the procedure of the list of emergency use or pre-classification by the World Health Organization to support the implementation of national vaccination plans in the region and their related or associated processes according to national policies. OP3, little d, a new proposal for a new paragraph, promote the dissemination of scientific information available on immunization, particularly against COVID-19, to promote its use in decision-making by member states, favoring, as appropriate, recognition of the guidelines of WHO and PAHO on immunization, particularly against COVID-19. And last but not least, OP3, little e, to favor possible coordination of processes linked to immunization as appropriate and in keeping with the national priorities and policies as the process of recognition, standardization, and implementation of digital vaccination certificates and/or intelligence certificates or smart certificates.
We thank again the delegate of Colombia for the intervention and for working with us to ensure that we capture the full intervention. And we now yield the floor to the United States.
Thank you very much, Mr. Moderator, and thank you to Colombia for the edits on the resolution. I believe that Colombia has correctly read in the edits that the United States has provided. The only questions we have are just on D and E, subparagraph 3, D and E. I would just respectfully request if we could see an updated version circulated before countries are asked to adopt the final resolution. That would be very helpful. I see we are coming to the close of business today. If we could have this evening to review and discuss with our government, it would be very helpful to have a complete understanding of how the resolution reads before we're asked to sign off on it. So that is our request, moderator. Thank you very much.
Thank you very much, United States, for that intervention. And seeing no additional requests for the floor, I will yield back to the president.
Okay, thank you very much. Thanks again to members for their contribution, and in particular to Colombia and the US for their input post the proposed resolution being tabled. There are changes recommended and of a fairly substantial nature. As a result, the governing body's office will convene, will seek to incorporate changes in the official language and resubmit the proposed resolution to the directing council during the next few days at a later date. So we will therefore have to go back, reconsider, resubmit, or capture the language, resubmit for decision by the General Council. That therefore would bring a halt for now to this particular item 4.7. And given that we are now past our usual stop time for the day, I am proposing that we conclude for today. But before I give a summary of what we will deal with tomorrow, I'm going to ask the governing body's office, Mrs. Monica Zaccarelli, to make a few announcements.
It will actually be the secretary. It will actually be the secretary.
The secretary. Oh, okay. My notes here are okay. The secretary. Can I ask the secretary all to
You may, Mr. President.
make some notes? Right.
Thank you. Hold on. Now I've got to open it up again. Okay, thank you, Mr. President. A couple of announcements. The first is that the third and last meeting of the Credentials Committee tomorrow will be convened at 8:30 a.m. Credentials that are not received by this time will not be further considered. And second, Mr. President, I want to remind everybody about the side event tomorrow, which will begin at 1 o'clock. It is entitled A Comprehensive Response to Tackle the Prolonged Crisis Resulting from the COVID Pandemic, the Strategic Link Between Health and the Economy. Thank you, Mr. Chair. Back over to you.
Thank you very much. Okay, so for tomorrow, we are proposing in the morning to begin with items 4.2, 4.1, and 2.1, which is the last report of the Committee on Credentials. And then we will break, and we hope to then convene with 3.3, 6.1, 6.2, and if time permits, we will go to 4.8. So just for preparation's sake, we are proposing these agenda items for tomorrow. In the meantime, I would like to take this opportunity to thank all who have participated today. I think we had a productive day. We did manage to reach a number of important agreements, and we will certainly continue the dialogue to conclude on matters discussed today that are yet to be concluded on, and to pick up where we need to for tomorrow. Thank you very much, and meeting is adjourned until tomorrow. Have a good evening. Thank you.